respected dignitaries, guest of honors, special guests, awardees, friends, family, and dear audience. On this beautiful note of Sarve Bhavantu Sukhina, Sarve Santu Niramaya, I, Rajashri Gadgil, founder of RSD Nutrition and Healthcare and True Wealth Integrated Healthcare, welcome you all to our annual Founders Day celebration of the life of our founder and mentor, my father, R.S. Gadgil, on his 79th birth anniversary. Every year, this day is marked by presenting the RSD Wisdom and Excellence Awards to healthcare stalwarts and in the company with the Integrative Nutrition and Health Summit 2025. RS Gadgil revolutionized Indian pharma and healthcare with his purpose, passion, science, compassion on one hand, and business, marketing, commerce on the other. Through his 5 decades long journey that started from penicillin to building endless number of top brands like Monosep, Flexon, Glycomet, Ecosprin, Gemcal, Nicocin, Onden, Roxyvine, and many more. R.S. Gadgil pioneered continuing medical education in the country and empowered and supported various conferences and associations like API, INH, MAP, ICC, RSSDI, ASI, IOA, Tomacon, Viron, and healthcare practitioners in bringing about a paradigm shift in academics. Fostering relationships with love and care, he earned the most precious wealth of friends, colleagues, and extended family like you all from all over the world. Let's watch a short video on his journey. With his profound wisdom and our strong purpose of developing effective nutrition and nutraceutical therapies to reduce disease burden for generations to come, I take his legacy forward with RSG Nutrition and Healthcare, True Wealth Integrative Healthcare, and MediNext. A quick introduction on me. Don't want to make it quick one. Celebrity nutrition expert, founder and CEO of True Wealth Integrative Health Centers, as well as RSG Nutrition and Healthcare, 25 plus years of global experience across continents in healthcare, nutrition, nutraceuticals, business strategies, consulting, medical education, and healthcare marketing, with an MBA in marketing and master's from Sion Hospital, postgraduate course from Symbiosis International. My career really encompasses therapeutic nutrition, nutraceutical, and therapy areas like orthopedics, gastroenterology, gynecology, infectious diseases, cardiodiabetes, pediatrics, and more. I firmly believe that nutrition can be modern day most effective and safe therapy in lifestyle and autoimmune and infectious diseases. We have actually conducted the 400 plus patient education programs and initiatives with 1,000 plus global healthcare and nutrition experts, and have reached more than 2 million viewers across in spreading authentic disease and integrative treatment information. That's a little bit about True Wealth Integrative Health Centers. These are our eminent experienced doctors, surgeons, nutrition and fitness experts, and that's our deep core ideology. The True Wealth Integrated Health Centers were established with this mission of Sarve Bhavantu Sukhi, Sarve Santu Mera Mera, which means holistic health and happiness for all, to control, reverse, and prevent diseases and augment health by integrating all appropriate scientific evidence-based personalized nutrition and fitness therapies, functional medicine, and advanced surgical treatments with a holistic wellness approach. This coincides with the Prime Minister Narendra Modi's vision of the flagship Ayushman Bharat Health and Wellness Centers initiative. Integrative healthcare does not mean alternative medicine. At True Wealth, eminent medical doctors, surgeons, personalized nutrition and fitness experts focus on the patient as a whole person to identify and address the root cause and bring about true relief from diseases by combining ancient wisdoms with modern science and bringing about a deep collaboration among health practitioners from multiple disciplines to create a comprehensive health ecosystem to help patients meet all their health needs, including physical, emotional, and social. It was this purpose with which we launched the first Integrative Nutrition and Health Summit 2024 last year, for healthier and happier global ecosystem. And this year, we of course raised the bar of discussions with very respected, eminent, dedicated faculty. And you would know that in just a minute as I announce the first panel discussion on integrative personalized treatment for reversal of lifestyle diseases and long-term control in diabetes, health, heart, liver, kidney, thyroid, and other diseases. Let me take the proud privilege to introduce our first faculty for today, Dr. R.M. Anjana. She's Managing Director, Dr. Mohan's Diabetes Specialties Center and President Madras Diabetes Research Center. She's an MD diploma in diabetes from UK, PhD. She has fellowships across fellowship of the American College of Physicians, fellowship of the Royal College of Physicians, Glasgow, Edinburgh, and London fellowship of the Indian College of Physicians, and fellowship of the American College of Endocrinology. Dr. R.M. Anjana is a globally recognized diabetologist and researcher with deep contributions in diabetes prevention, epidemiology, physical activity, translational research, and metagenomics. She has published 430 plus research articles, led major national and international studies, is part of key global panels, including WHO, ICMR, IDF, Atlas, Arogya World India. She serves on scientific advisory boards for ICMR, NCBIR, and Ayushman Bharat HWC protocols. She has endless awards to her name at such a young age. So we can only imagine how she balances out her clinical practice with research and with so many social activities and all these awards. And I'm sure we're going to hear that from her. Uh, I mean, let me take the privilege also to introduce one more relentless faculty here, Dr. Amit Komne. You can see his resume. He's HOD Critical Care, Social Hospital, Thane. He's consultant intensivist, physician, diabetologist, medical simulation expert, content creator, and health coach. Wonder how he is able to balance all this with his hectic and I would say compassionate lifestyle. He is ENB and FCPS in medicine as an MRCP from UK London. He's member of European Society of Critical Care Medicine and executive office member of Indian Society of Critical Care Medicine, Thane branch. He's India's first to be trained by Mayo Clinic as a medical simulation instructor. He has been a teacher for critical care fellowship programs at DY Hospital, DY Patil Hospital, and has been co-founder for 19 fellowship programs on DY Patil University. So really looking forward to speak with him as well. And last but not the least on this panel is Dr. Mihir Kulkarni. He's consultant nephrologist and renal transplant physician attached to Kaushal Medical Foundation Hospital, Jupiter Hospital, Thane Healthcare, Dr. Bhanusali Hospital, Criticare Hospital. In addition, he is also director of Kimaya Kidney Care and Dialysis Center, Thane. Wonder how, when does Dr. Mihir actually breathe? And that's what everyone around him has to say. He's MD Medicine, DM Nephrology from KM Hospital, assistant professor with Grant Medical College and Sir J.J. Group of Hospitals. He has received many prizes and distinctions, and he's member of Indian Society of Nephrology, Indian Society of Organ Transplant, Indian Society of Critical Care Medicine, and Association of Physicians of India. Having said that, I would really want to jump into the discussion today, and as we have such a great panel here of faculty. Well, I would, should I shoot with the questions, or Dr. Anjana, would you want to say a few words, and then I'm going to really jump into asking a lot of questions which patients around keep asking.
Sure. Thank you, Rajshri. Thank you for having us here. It's a pleasure to be here. A part of this award. It's such a tribute to your father. We're all very, very happy, and thank you.
So I would actually, when we talk about reversal, there is a lot of noise across social media, across whatever we get to hear. Disease reversal, metabolic diseases reversal. So, how would you define it so that, the general public can really understand? And is it actually really possible? If you could throw light on it.
Sure. So, Rajshri, I'm glad you brought that up. There's a lot of talk about this reversal. So let's first get the terminology right. The term reversal is actually not the correct term to use. When we talk about diabetes, the correct term that you would talk about is called remission. So what does that mean when you say remission? It is defined as having a HbA1c, glycated hemoglobin, the HbA1c value of less than 6.5% for about 3 months without any medication. So that is the actual, terminology for remission. Now, the question is, how many people, there's so much of talk about it, especially with apps and people and all. Can it be done? Yes, it can be done. But there are many buts around that. It's possible for a small percentage of people. So a small percentage, as in if you take the entire diabetic population, maybe 2 to 4%. That's it. So we're talking about 95% of people not being able to achieve remission. And even if they achieve it, not being able to sustain it over a period of time, which is what you want. So then you may ask, then why all the hype? The hype's because some people can achieve it. And who are these people? These are people with early onset disease. So typically, we have found in our studies that for someone with less than 8 years duration of diabetes, with good insulin secretory capacity, if you work on the body fat, there are many subtypes of diabetes, but there is a particular type that has body fat as the primary pathophysiological defect. That type of diabetes with, young onset, with good insulin reserve, with less duration, such people can definitely try for reversal. Is it useful to have remission? Yes, it is definitely useful. So even if someone cannot maintain the remission, if you achieve remission for some time, there's evidence to show that long-term microvascular and macrovascular complications, there is a benefit on this. So who should try for it? There's this group of people. So I think the message by and large is that don't try this yourself, right? Look for, if you think you're someone who can try for reversal, go to a qualified person who will scientifically be able to tell you whether or not the reversal is possible, help to guide you in the correct way to do the right things for that reversal and help you to sustain it. So don't be sad if it's not possible. A very small percentage actually achieve it, and an even smaller percentage maintain it.
And we all know how difficult it is to, how disciplined you have to be when you have to really be able to achieve it as well. So having said that, as the president of the Madras Diabetes Research Foundation, which we are really proud of, such a renowned and dependable name in research, in Indian research, given that, what are the evidence-based insights that you can share on, how important it is to sort of integrate treatments, integrate nutrition, lifestyle modifications with medicine, and one more thing, which just yesterday we celebrated International Yoga Day, and if, I know you've been doing significant amount of work there, so if you can also share the potential role of yoga as a lifestyle modification and how it really helps in management of diabetes.
Sure. I think the pillars of diabetes itself are all about integration between diet, physical activity, yoga, the drugs that you take, education, self-monitoring. All of these things need to come together for you to be able to control metabolic diseases, especially diabetes. Now, if you ask specifically about the role of yoga, we've done studies that have looked at diabetes prevention. So these are in children. We've looked at yoga in diabetes, in management, control complications, etc. So let me start with prevention. That's the easiest space. So this was an ICMR funded study. It's called Yoga Diet. And what we did here is we went to schools in Delhi and Chennai. We studied 2,000 children, 1,000 in each city, from about 24 schools. And we looked at, they were adolescent ages, so 13 to 15-year-old children, and we looked at whether doing a yoga intervention helped to decrease stress. So if you look at, various metabolic parameters, body fat being where, there, hypertension, your cholesterol, dyslipidemia happening, the central point there is stress. So we measured all of these parameters, all of these anthropometric things in these children, and we did a 17-week yoga thing. What did we do? It's International Yoga Day. So there are three components to this. There are these asanas, and primarily in schools, we did Surya Namaskar and stuff like that, some other stuff also. Then there was the meditation component, the dhyana, and there was pranayama as well, breathing. So these three were the components. It was for about 45 minutes. They have these PT periods, so once a week, we tried to do that for 16 weeks and one extra. So 17 sessions were given to these children. And we were able to show that, objectively, we could bring down stress by measurement of salivary cortisol in these children. It helped in mentation, cognition, mindfulness, weight control, brought down body fat. It didn't bring down weight. These are growing children, right? So it didn't bring down weight, but it did bring down body fat, which is fantastic. And but the primary one, I think, would be on the mental health of these kids. And this was a randomized controlled trial. We've published this, and there are fantastic effects. So this is long-term stress reduction. What we find these days is that the stress is the primary one. That adds on the weight, then that adds on to diabetes risk. So long-term NCD prevention, you start in kids, you start young, you start with obesity and stress. So I think that's one of the things that we did. Now come to adult life. Let's talk about type 2 diabetes. Does yoga have a role there? Again, this is an INH funded randomized controlled trial that we did in patients with type 2 diabetes, gave them various yogasanas. So ICMR has a set of asanas and things that you can do for those with diabetes. And so we did some of those and looked at what it does. Primarily, again, did it bring down glucose levels? It did before and after, but it was not significantly different between the groups. So it is not a primary therapy to bring down glucose. Rather, it is an adjunct therapy along with medications to control the other things like stress. And again, we had mentation, mindfulness, stress coming down, all of that in these adults. It does have also a good effect on complication risk, microvascular complications, macrovascular complications like heart attacks and stuff like that. So in all of these things, we did find a good effect. Yoga did have a great effect.
Yoga has actually been a part of our lifestyle, or maybe our school days. We would be taught in school itself, and it's we just need to really go back to our basics, given especially given such in-depth research. And what really happens, it's very good that you highlighted that ICMR has a protocol, or they have these yogasanas which are suggested, but how many people really actually know about it? So that's a bit of a challenge, but I think that's the attempt to these kind of programs to reach this knowledge to people. That's when diabetes can be prevented, but when it takes a little bit more trickier or riskier situation, we have Dr. Amit here, who's the intensive care specialist. So the most severe consequences are unfortunately, Dr. Amit, you get to see in the ICUs or in the hospitals. Do you also think that an integrative treatment intervention is very important, and how significantly does it help reduce the risk of patients ending up in a critical care situation?
Okay, thank you, Rajeshri, for having all of us here today and being a part of this for some time. So I would go back to one of the previous questions, what you had asked Dr. Anjana about yoga. And yes, I was never a fan of yoga, okay, I'll tell you honestly and personally. Today, for the first time, I did some yoga, okay. For the first time, our complex had invited, thank you for that. Our complex had invited one international yoga specialist, and they had 2.5 hours of yoga session with mindfulness and all. And yes, I did realize that a lot of stress really goes down. A lot of, as Dr. Anjana mentioned, that it may not help you achieve the primary endpoint, but a lot of secondary endpoints are achievable by yoga, that is stress management. And I think lot of stress these days comes from things which we don't do. Okay, one of it is, I think, yoga, exercise, and these are things which make you integrate and take you towards a better life. So more like your question goes when you said, what's the role of integrative management when it comes to an intensivist like me? I want to tell you that when a patient lands up in RICU with an heart attack or maybe a kidney failure, it's not that time when the bomb has exploded. The chaos is already started long back in somebody for people to know. And it is all about the uncontrolled blood pressure, the uncontrolled sugars that the patients may not be knowing, the insulin resistance, the inflammation that is going inside, obesity. So all these metabolic parameters which are kind of screwed up since a longer time and silently killing somebody. And ICU is just one man or the kind of a bomb exploding that they come up. And hence, as a preventive approach, it is really important that integrated approach is taken so that they don't land up in my lap. Okay. So this is just like catching the fire before it turns into a wildfire. It's nothing more than that. And I think, yes, nutritional coaching, as ma'am said, the pillars of diabetes, one of it is awareness coaching and is okay. So awareness, a lot of social media, I see a lot of awareness about what is insulin resistance these days. Yes, I see the other coin side of it as some people claim reversal of diabetes. Okay, money making businesses. I know that all of it's remission, and people don't remain in remission for a long time. Only a few said 2 to 5% of it do remain. But on the other side of it, I would say diabetes or insulin resistance related nutritional awareness, okay, is lot much there these days thanks to social media. A lot of people talking, at least talking about health, talking about glucose monitoring, talking about proper sleep hygiene, okay. And a lot of these are all your multiple safety nets which might prevent you from landing up in a critical situation like heart attack or macrovascular complications in the ICU. So I would not say these integrative treatments as an alternative medicine, but these are kind of advanced preventive medications. So yes, integration of a lot of things beyond medicine do play a life in today's world. Yeah.
Well, it was absolutely right that you said that there's more awareness at least created about diabetes as a disease.
Yeah.
But most of the times we see that it's more like a metabolic syndrome where there are so many other parameters which are also going completely haywire, and there comes kidney. I mean, such an important organ. I don't think Dr. Mir, that much of noise is absolutely created about kidney disease and about kidney as a safeguarding your kidneys. So what is that you would like to share out here? Because why is it so vital to protect our kidneys? The protection of kidneys, we hear only when people talk about protein supplements and if they should take it or not. But otherwise, the rest of the population, no one is worried about what happens to kidneys. And when they land up with it, I don't think the 5% of reversal chance will diabetics have. I don't think kidney even has that. So, if you can share your insights out here and, um, how do we protect kidneys so that, and are the complications and is the kidney disease really on a rise at this point in time? If you could share that as well.
Thanks, Rajashri, for the invitation. And yeah, kidneys are important. Kidneys filter all the toxins. Kidneys, waste products, urea, creatinine, as we know. This is one of the major functions of the kidney. It regulates fluid, electrolyte, acid-base balance. So unwanted acids are removed by the kidney. Unwanted electrolytes are normally removed by the kidney. So when the kidney doesn't function, these unwanted electrolytes build up, like potassium. Kidney not only filters all this, but also it deals with blood pressure. It produces hormones like erythropoietin, deficiency of which can cause anemia. It has a function in immune regulation also. So all these things are important for the kidney. So kidney is a filter of the body, and that is why it's important. And kidney diseases are on the rise. The leading causes, as we know, is diabetes, hypertension, obesity. There are some acute kidney injury causes. Many a times we have, orthopedic rheumatological problems, and patients keep on popping painkillers which are over the counter available, and those are the leading causes of kidney disease. Sometimes there are certain medicines which are, I mean, the doctors prescribe them for 5 days, 10 days, but patients keep on taking them knowing that they will relieve their pain. But unfortunately, long term, they can damage their kidneys. We have to be careful with contrast agents, and there are so many other leading causes of kidney disease. But to name them, diabetes and hypertension still lead the leading causes in India. So we have to be very, very careful about kidney disease. So why is kidney disease important? Because if the creatinine is not controlled and taken care in time, it can lead to end-stage renal disease. And end-stage renal disease in young people, at least they have an option of kidney transplant. But for others, it is dialysis eventually which is required. So we have to be careful about protection of the kidneys. That's very, very important. As I discussed, kidney disease also has to deal with bones, and bone health is also important for the kidneys. Kidneys deal with calcium, phosphorus, and there is an entity called CKD MPD, which we call chronic kidney disease, bone mineral disease. So to prevent fractures, and in elderly, there, the falls are common. So kidneys do regulate this, and that is why it's important to keep our calcium, phosphorus, parathyroid hormones, vitamin D's under control, because ultimately if these are not kept under control, the susceptibility to fractures does increase. So that is important. Infections, as I discussed, is important. And when it comes to diet, we have to be careful that while dealing with the diet, we don't deal with malnutrition. I mean, we keep on restricting proteins, but that should not cause malnutrition. That is important. So proteins are important in kidney disease also, though a low protein diet would be beneficial. So kidney disease, as you asked, can it be reversed? So generally it's difficult, as we know, kidney disease to be reversed ultimately. But there are certain kidney diseases where reversal is possible. Like I just talked about acute kidney injury diseases like malaria. Now in the rainy season, we have to be careful of malaria, dengue, leptospirosis. So these are reversible. Maybe early stage diabetic kidney disease may be reversible. Microalbuminuria, maybe to some extent we can control the microalbuminuria from progressing to macroalbuminuria. But once it progresses to macroalbuminuria, reversal is not in our hands. There are, I mean, the kidney, as we know, the filtering organ is the nephron, and the nephron's main structure is the glomerular. So there are diseases, glomerulonephritis, which can be controlled with immunosuppression. Uh, we are talking here about metabolic diseases, but obstructive diseases can be reversed, like secondary to stones or prostate enlargement. So these are some reversible diseases are there. SLE, lupus, under immunosuppression can be controlled definitely. But if not controlled, all these diseases lead to end-stage kidney failure and ultimately dialysis. So we have to be very, very careful about this.
So, just an ancillary question to this, Dr. Mihir. How important is it for a patient to come and see a nephrologist, from a protection or prevention standpoint if they have a diabetes? Because they normally visit Dr. Amit, and then,
Yes.
after that, or Dr. Anjana, and then after that,
Yes.
what is really a right time to come and see you? Because
Yeah.
this is something which
Yeah, they need not
will
come
be
to a
done.
nephrologist in the beginning. Yeah, they did not come. Even at Dr. Amit and Dr. Anjana, as they counsel their patients, we have three tests which are important. One is a blood pressure checkup, at least once in 3 months. That's important. Second is the serum creatinine, ideally once in 3 months, but at least once in 6 months. And another test is a urine routine examination. And more specific than the urine routine examination is a urine examination for microalbumin or an albumin creatinine ratio. Because even if the urine routine may not show proteins, the urine microalbumin may be positive, because the dipstick which is used for urine routine examination may not detect the microalbumin. So this microalbumin test at least has to be done once in 6 months. If your BP, if your creatinine, and if your microalbumin is normal, we have definitely a less risk of kidney disease, though we have to be very, very careful. And ideally, once in 6 months, if not at least once a year, keep on measuring these.
Great. So I think from here I'll actually take a cue also to women health, because since Dr. Anjana is
You
here.
add something here? Would it be okay for me to just add something here, Rachi?
Yeah, of course. Please go ahead.
Yeah. So I was just saying we have the national ICMR INDIB study, which is a national study on diabetes and associated risk factors in our country. And from that, we're just publishing the prevalence of chronic kidney disease. It's just getting accepted in IGMR. But there's one new finding that, has come out from that's not yet published. So this is, off the record but what we find is that in traditional teaching, we're always taught for the kidney, number one is hypertension, followed by diabetes and whatever else. There are many risk factors, but hypertension comes up there. But in India today, we're able to show that the number one risk factor higher than hypertension is diabetes. And that's one of the things that's coming out in this paper. The prevalence is high, but independent of that, independently most important thing for chronic kidney disease today is diabetes. And of course, if you have the combination of the two, then your risk for deterioration of kidney function is about 6 times higher. And note that people usually have both. So I think today we also have certain genetic tests in the clinic where we are able to predict which diabetic patient will go in for acute kidney dysfunction, who will have more rapid progression. From our genes, we are able to say this. We are able to subtype diabetes. We're able to say which ones we should monitor more quickly. And hopefully, if this comes to the clinic practice more commonly and more widely, we will have more prevention, less people going to Dr. Mihir, hopefully.
Yeah. So that's great. That's what I'm a fan of, Dr. Anjana, is that everything you talk is out of research. So question that comes up, you and I can't but mention Dr. Mohan. You all will go back, do research, and then speak out of it. So that's absolutely exciting and amazing. Having said that, I want to come to the women part of it because we're going to launch an initiative on women health later today. So, again, other diseases, I mean, we hear of things like GDM, which we never probably had heard earlier, and, PCOS, of course, we know how many percentage, 50% can actually develop diabetes if you have a PCOS. That's the kind of numbers, and then, of course, even menopause, which we are going to focus on later today. If you could throw light on what's going on in that space, and then do add about something which something again which is very thrilling. I won't name it. You name it. Dance can actually be something which can be an activity which will help with all this. And a research on that. Do share those findings. I think which you did in schools, and such a socially and culturally accepted activity. It's absolutely rightly so that you have done the research on it, but I don't think anyone ever thought of doing that. So please go ahead.
Thanks, Rajshri. So yes, absolutely. There's so much of a problem, nowadays with diabetes overall, and I think women have specific issues pathologically, do we have differences? Very few. Actually, men have more risk for diabetes than women have. But socially and otherwise, there are so many issues which prevent a woman from achieving her goals, which is far more different from, men. So when it comes to GDM, we have latest data now that shows traditionally when we talk about gestational diabetes, you're talking later in pregnancy, 24 to 28 weeks, where the woman develops diabetes, you have big babies, difficulty delivery. This is traditional teaching. That's what, and then it goes away after delivery, right? So this is what everybody kind of knows. But today we know that there's another entity that has come in that's called early GDM. So before 16 weeks of pregnancy, this woman is screened and develops diabetes. Now, this is a problem because it's come early on. There's more duration of exposure for the mother and the baby, and this leads to many more complications for both. So this entity has now recently, last year, we had 2 years ago, sorry, this has been recognized as an independent entity that has bad outcomes for both mother and baby. So now we have two forms of GDM. One is called early GDM, early pregnancy, late GDM, late pregnancy. This is very prevalent now. So about 25% of the population have one of these. Primarily, I think because diabetes is coming even before pregnancy now. Obesity has moved into childhood, diabetes has reached young adulthood. So this woman, even before becoming pregnant, probably has diabetes. That's one way of looking at it. But even if not before, then at least in the first trimester, she's getting diagnosed. Now, this leads to more difficult management, worse outcomes for both mother and baby. And beyond all this, after she delivers, this diabetes has a greater risk of staying. Or even if it goes away, this woman will convert into type 2 diabetes. Within the next, say, year, 20% of them have dysglycemia. Within the next 5 years, for sure, she's going to develop diabetes. So it is a problem, and it is increasing overall. The driving factor here is obesity. Pre-pregnancy obesity, the BMI of these women is high already, and then they get pregnant, you gain another 10, 15 kilos, and all hell breaks loose. Now, what about the baby? The baby also has risk. If early exposure, longer exposure, this child tends to become obese in childhood. And, that weight gain that happens is detrimental. And towards puberty, this child then has a risk of developing diabetes. So we're having pubertal age children with diabetes now. So herein lies the issue. So what is the thing of course, PCOS is there, infertility is there, early menopause, all of this is linked. And the key here is the obesity that's starting quite early. So one of the things that we can do in a growing child, you want them to have nutrition. But what is it that we can do to curtail this obesity is physical activity. And after spending about 15 years trying to make women more active and failing really badly, we realized that we had to do something that was innovative in order to get women to be active. So we started doing RCTs, looking at diabetes prevention. We'd have men and women, and then men would come, and then women would drop out after the first few classes. They don't want to have combined classes with men. You need permission from husband, from father-in-law, whatever, if you're an older woman, you need your son or your husband or somebody to take you out on a walk, to come to the doctor, etc., etc. So the problems were many, and we realized we had to find a solution. Plus, if you say go to the gym, it may be okay in a city like Mumbai or Delhi or Chennai, but you just leave the main cities and go into peri-urban areas, rural areas, and you ask for a gym. It's not traditionally accepted for a woman to be going to a gym or working out or strength training or any of all that. So we realized that we had to do something that was allowed for physical activity permissibly, socially in our situation, and that's why we turned to dancing. That was the one thing. The second thing that all women face is time, lack of it. So lack of time is a huge problem. 1 hour per day, 60 minutes per day is a large ask for a woman of any age. So we had to bring that down. So that was the concept that we worked on, and we came up with this intervention that's called Tandav. It's basically high intensity dancing, which allows for 10-minute workouts 2 to 3 times a week with the latest Bollywood, Mollywood, Tollywood songs. There are 4 of them. People identify with that, start driving with that. And by the time you finished your workout, you've developed all of the metabolic benefits. So this started as a thought, a concept. We pilot tested with St. John's University to see whether, the VO2 max was okay, exercise capacity was all right. We did all that and published that first. Then we needed to know whether this would go into a real life situation. So we were funded by NIHR. We did an RCT again. We went to children. We couldn't do this in adults because we don't have women fit enough to do high intensity exercise. That was a problem we had. So we had to go to children. We still had trouble there, but we could train them. Within a 3-week period, children do get fitness levels that allows them to do high intensity activity. So we went to these schools, we did this RCT, and we found fantastic results, for all kinds of things: muscle strength, bone health, fat loss, mental health, social activity, mother-child bonding. So it started with, the children, the girls, and their mommies got invested in it too. So we had the moms and the girls coming in together. There was this whole bonding, and this whole community started forming. 10,000 of them we have now. They're all called Tandavites. We have it across not just India, but also Australia, the UK. People have joined this because Bollywood music is popular all over the world. So we do have people joining this movement now. What does it aim to do? It aims to increase fitness in women, Asian Indian women primarily, and children, long-term disease prevention through obesity management. So that's where we are at the moment. We have this intervention that's widely reaching women in the country.
So, given that we have International Yoga Day, which has become so famous in the last, it's been 10 years that it was launched. You never know, we can have a Tandav Fest, National Tandav Fest coming up in the next decade. You never know.
not? Why not? Actually, we went, the WHO commissioned us to do something on physical activity in India program. So we went to the Ministry of Health, Health and Family Welfare. So we reached out to the NCD prevention officer, and we were thrilled to know that he had heard of Tandav and his wife was a Tandavite. So, we're very, very thrilled. It's reaching people because it's not something that's commercial for us. It's free. It's meant to be an initiative that is meant to improve the health of this country. So it's free for anybody, anywhere, to just pick it up and do it for themselves.
So shifting focus from women health to, something which is probably a little bit more common in men, Dr. Amit, is liver disease more common, but now the non-alcoholic fatty liver disease is probably balancing it out between both the genders. So, are you seeing alarming rise, or is it that we didn't know about this earlier? And how critical then it is to again have a personalized approach towards it. How much does nutrition and lifestyle modification really make a impact here, in addition to your medical practice? And again, what tests need to be done, what's the regimen?
Unmute myself. Yeah. Oh, hi. Okay. So Rajeshi, NFLD, I would say that it is kind of the new diabetes. The kind of it is talked these days, non-alcoholic fatty liver disease. And in every OPD consultations, we see very often, like more than 50-60% times, we see a fatty liver, and people come to us with this fatty liver disease. Okay, most of them are a little bit of alcoholics as well. Difficult for them to be labeled as an FLD, but then yes, this is the new epidemic on the rise, and a lot of it I would attribute it, yes, to due to less of exercise, the kind of stress we have, the cortisols that we build up right from the day we start, how the cortisol fuels up the fat which goes onto the liver, and then the fat onto the pancreas, leading to NFLD, cutting into diabetes. So all these needs a reversal, right? And guess what? There are no pills to reverse it. Okay, there are no single pill which can reverse an NFLD. It's a long, hard approach which everybody has to go through. It involves again physical activity, awareness, nutrition. Okay, nutrition plays a very pivotal role in reversing the NFLDs, the early NFLDs, and MASLDs and what they call it now. So personalized nutrition works here a lot. Okay, it is not the one size fits all that we advise. As Dr. Anjana was saying, it is very difficult for women than men to go and exercise into the routine because of the social difficulties that they have to go through. And yes, more of Tandavites will be more kind of such activities will help reverse the NFLDs as well. And also, I think there needs to be a kind of such kind of movements to reverse it. Okay, so I would expect not. I mean, I don't know what I would expect Modi ji to sometime mention Tandav in his Mann Ki Baat. where he's just mentioned about sugar boards. Okay, so it is more awareness is needed regarding, so they come to us when they have a fatty liver, but then they should come to us asking what to do before they get a fatty liver. So I think when I move back from critical care, we see a lot of such cases, and awareness and pre-workup is needed to reverse them. One important thing is this has started is the preemptive health checkups, which have started. Initially, I didn't like them, that why everybody wants to go and check their health, but yes, they are getting a lot of people under the iceberg, like a lot of preemptive health checkups done, fatty liver, HbA1c's gone up, fasting insulin's gone up. I think more such hidden things under the icebergs need to be uncovered so that NFLD, the new epidemic along with diabetes, can be reversed in some way. Yeah.
So, with that, since we're talking about nutrition, personalized nutrition, really, I mean, it is challenging for us also to make people, understand that there is a need. Once they know there's a need and they come to us, they realize personalized nutrition is not so tough. It's something which is really tailored so that they can follow it. And so many people don't even realize where they're eating fat from and what fat they're
Yeah.
eating. So, so much
So,
easier it can get, if they just even come to us. The next thing, I think I'll go to Dr. P here because we think he's overshot it quite a bit with this interesting discussion. Is that in kidney disease again, patients come to you and come to me rather also that a lot of people don't know what to eat in kidney because most of the
right.
times they've been told don't eat this, don't eat that. So first of all, is it even important to have an integrative approach where, lifestyle, nutrition, planning needs to be done? And then, how do you, it's very challenging to, even make these people understand because a lot of times there are old people, so they want to eat what they want to eat. So, how do you really come out of this situation? Plus, you said proteins are needed and then supplementation, it can that also be tailored and given to them so it's better than they eating proteins which can harm their kidneys further. A lot of questions.
Yeah, yeah. So yeah, protein restriction is important in kidney disease. It's a low protein diet. That's very important in low protein to be eaten. And most of these proteins should be plant-based proteins. It should not be animal proteins. Yeah, eggs and all are okay. Non-veg food, whatever, chicken, fish, maybe once in 2 weeks or something like that. That also in very moderate quantities or limited quantities that is permissible. But as the creatinine starts increasing, or as the GFR, what we call glomerular filtration rate, starts decreasing, we have to be careful that protein restriction is implemented. Along with the proteins, in our regular follow-ups, we do check the patient's potassium, phosphorus, calcium, and we have to be careful about that. Those diets are not rich in potassium or phosphorus if the blood reports show that there is already an increase in the levels of potassium, phosphorus in these patients, and hence we do these renal profiles at least once in 3 months. Important tests are done once in a month for these patients if the kidney disease keeps on progressing. Salt restriction is very important in all these things. I mean, we actually advise the DASH dietary advice to stop hypertension. That's what practiced in hypertensive patients is also practiced in kidney disease patients. So that's very, very important. Fruits, vegetables are important because they are very rich source of bicarbonate. So fruits, vegetables have to be encouraged. No processed foods. So that's very important. Omega-3 fatty acids have been beneficial. Flax seeds and all, just like in diabetes, they are beneficial in kidney diseases also. But we have to be careful that low protein diet is still important. And yes, protein supplements are used. Protein supplements are used for patients in kidney diseases. When we restrict the proteins, proteins are usually restricted if someone's appetite is okay and good. We restrict them to zero point 0.8 grams per kg per day. So if we consider a person to be around 60 kgs or 70 kgs, say if it's zero point 0.8, so he requires around 48 grams protein. So 30 grams proteins we give from the normal regular diet which we eat, and maybe around 15 grams can be given as protein supplements. So the commercial protein supplements which come, you can consider around 1 or 2 scoops per day for the patients who are having a creatinine on the higher side, slightly on the higher side. But we have to be careful that once these patients reach on dialysis, I mean, once they reach end-stage disease, dialysis causes loss of proteins, and that is why the proteins need to be increased when a patient is on dialysis, hemodialysis, or peritoneal dialysis, where the protein requirement does increase. So when the patient is not on dialysis, we have to strictly implement protein restriction, though keep a watch that the patient does not develop malnutrition and protein energy wasting also, because that also can be detrimental. So that's very important. Monitor the serum albumin, monitor these blood test of total proteins, monitor the blood cholesterol. These give us an idea whether we are pushing the patient to malnutrition and accordingly correct them.
I'm really sorry, but we have really overshooted with our discussion, so I will have to curtail some of the questions. But this definitely means we have to get together again to have a complete session on each of these and have extensive series of discussions that we can have. But I would still let you all share your concluding remarks, or if there's something that you would like to share, because I know Dr. Anjana has been doing a study on macronutrients as well, and Dr. Amit also has his inputs when it comes to nutrition. So if you could quickly share some of your inputs here. Yes, Dr. Anjana.
So I think for a healthy diet, whether it is prevention of progression of disease or reversal of diabetes, the general mantra is keep the carbs to 50% at a population level. You don't have to do very low carb. You don't have to do no carb, all of that. In the Indian scenario, we have 70% carbs that we are eating. Bring it down to 50%. Keep protein at 20%. That's the recommendation. We need fat is at 20 to 25%. It's fine where it is. Protein is low. It's about 12% now, needs to go to 20%. Fiber, which is about 3%, goes to about 6%. So this is the general recommendation for macronutrients for a healthy NCD prevention or management. So that's for the diet. For physical activity, pick anything you like. We'd be very happy if you do Tanda. We have classes happening every Friday, so you're welcome to join those. But pick anything. Physical activity, starting from childhood, going up to adulthood, men and women, keeping that going is single most important factor. Yoga, stress reduction, you cannot overemphasize those. So I think you put those together, you have the integrated approach for metabolic disease.
So before Dr. Amit comments, I think I would like to share this that Dr. Amit taking care of critical care, Dr. Mihir taking care of all sorts of nephrology requirements too. He goes out of the way, even looking at the integrative health of the patient. And we're at a single center here in Thane, which is Kaushal Medical Hospital, and we do practice integrative, management of patients here, and it's really exciting. So, if both of you would like to share anything additionally, how we do it. So I think that's why, we have so many happy patients. Through COVID, you all have had so much of success, and through date, when patients walk out of the hospitals, when they walk in, they're of course anxious, and when they're walking out, you see that they are so much more happier, and the stress is off, at least of the medical treatment.
Okay. Rajeshi, I would like to take this opportunity to tell that integrative medicine is yes. And the need for this I felt when 4 years back when I was trying to find a purpose of my life. Okay. I was working with my health coach to find what is the purpose of your life, like what are you going to do it. And so there's a lot of things we thought about making about treating the patients, okay, making them happy, money, health, everything. And then I had this poem written, okay, that the miles to go before I sleep, famous Robert Frost poem. It goes as, the woods are lovely, dark and deep, but we have promises to keep. And then I try to modify it in my way, the way we lived it during COVID, that millions to save before I sleep and millions to save before I sleep. And then my life coach came up with this thing that this was what you lived during COVID. Like we worked a hell lot during COVID to save millions of lives. And this is the real purpose of life, what you have to. So how do I save millions? Okay. I cannot save millions by seeing 100 patients a day when will take 30 years for me to work 365 days a year. So this is how the integrative approach came to my mind, that if I have to save really millions, I have to go online. It has to be education. It has to be awareness. It has to be medicine knowledge, or medicine taught to the people, right? Because these days I have seen there are a lot of online courses for people, for people, for kind of students. For example, a doctor teaching students, a doctor teaching, taking classes for NEET classes, CA classes. There is nobody teaching general public. There is nobody teaching general public how to take care of a bedridden at home. There is nobody teaching the general public how important are nutraceuticals. There are a lot of talks, there are a lot of podcasts and everything going on the internet. But if you want to have one course, okay, so that is what my way of going through integrative medicine is, through developing courses for people where I teach them, or we teach them about medicine, how they can do it in their daily life, because problems are different. For example, a CKD patient, if he gets chronic kidney disease, okay, he is left in a lurch. Okay, अभी मैं खाना क्या खाऊं, मेरा life आगे का क्या है? So what, how beautiful it would be if there is a course by somebody who are experts in this, and they give more knowledge about kind of integrated medicine, and how to deal with this in a form of a workshop or a course. So there is a more need where such education is needed for public, and it should be a good filtered education from proper people who are there in the industry working for it, and not just the so-called coaches that we see online these days. So that's really important. So this is how I would say we will be doing integrative medicine. So this is beyond the ICU. Okay, in ICU we have seen a lot of patients.
Dr.
We can
Amit,
take it now.
I'm going to,
I'm so sorry. Yeah, yeah.
I'm just
So
going to, I'm just
if
going to interject.
Mihir, yeah.
No, I'm just
One idea I would like to
No,
say
I
to
want to interject on your idea itself. I'm sorry. But
yeah,
what
yeah,
you're
yeah.
saying,
Okay.
we don't end up discussing that in the hospital every day, but this is something which even the ministry wants to do. So, there is already,
Yes.
you already have a project in
Yes.
hand which we are working on. So you just have to do it together.
Yes.
Go ahead.
So no, I was saying that the discussion is small, we can have a good podcast on it when Dr. Anjana is here in Mumbai sometime. So that's we can have a proper podcast and more discussion on it. I know the time limits are here. Yeah.
Unfortunately, yes.
Yeah, yes.
Yes, Dr. Mia, did you want to say something?
Yeah, in the ICU, the same thing. It's an integrative approach. It starts in the ICU where when we notice that there is a creeping and an increasing creatinine, we take care of these drugs, drug modifications. Sepsis treatment is very important. Sugar control is very important. And early introduction of nutrition, that is very important in the ICU itself. Preferably, we prefer enteral nutrition through the oral feeding or Ryle's tube. If possible, if it's not possible, then we go for parenteral nutrition. But ideally, early as possible, enteral nutrition in the ICU is important for critical recovery. And once these patients get discharged, once they follow up with us in the OPD because of the excellent treatment in the ICU, we keep a track, follow up every monthly initially, then maybe once in 3 months, keep a track of their creatinine and the EGFR, adjust doses accordingly. Dr. Amit and Anjana, as they advise, and they have been doing control of blood pressure and sugar is very, very important to prevent complications of kidney disease. And another most important thing, always keep on stressing them the importance of diet. They should follow up with the nutritionist. That's very, very important. And a most important thing which we always have to remember is vaccination. Vaccination is very important. Hepatitis B, pneumonia, flu vaccines. Every disease, many diseases have preventable diseases can be. Vaccinations is there for many diseases, so you have to take advantage of those vaccines. Take them as per the recommended duration which has been advised, so that complications and sepsis can be prevented. And last but not the least, bone health. It's very important, as I mentioned, all these bone parameters of calcium, phosphorus, vitamin D to prevent fractures. That's very important because fracture is another morbidity because you just remain bedridden, difficulties, surgeries. So all this can be just prevented right at the primary level.
Great discussion. I think we can't, but we have to stop. But otherwise, but with the promise that we just have so much to share and work on together. I would like to thank three of you for really being here and giving such great insights. And I'm looking forward to having you back. Dr. Anjana, Dr. Amit, and Dr. Mihir, thank you very much for being here today. This is the RSD Wisdom and Excellence Award. And before we actually present that to our first awardee, we would like to share a short video of the awards that have been, presented until now. So our first awardee for today is Dr. S.M. Bandupala. And I am so privileged to, of course, know him through my father and then know him more now and to have him here today. And it's absolutely fortunate, lucky that he's receiving this award from us today. And it is in his good friend's name as well, along with wisdom and excellence. So Dr. Saifuddin Muhammad Ali Bandupala is a highly respected consultant physician and diabetologist with over 40 years of clinical expertise. Renowned for his pioneering contributions to diabetes care and internal medicine, Dr. Bandupala combines deep clinical insight with compassionate approach to patient care. He practices at the prestigious Lilavati Hospital and Research Center, Mumbai, and Dr. L.H. Hiranandani Hospital, Mumbai. He is also a visiting physician and diabetologist at Asian Heart Institute, where he continues to make significant strides in management of chronic and complex medical conditions. A graduate of Grand Medical College, Mumbai, Dr. Bandupala holds an MD in General Medicine and is fellow of the College of Physicians and Surgeons. His commitment to advancing medical knowledge is evident through his active involvement in medical education and his role as a faculty member for certificate courses in diabetes management under the College of Physicians and Surgeons, Mumbai, and the Public Health Foundation of India. Dr. Bandupala specializes in the diagnosis, treatment, and management of diabetes mellitus and metabolic disorders resistant infections in diabetic patients, hypertension, and cardiovascular risk management, insulin therapy, and emerging anti-diabetic therapies. Dr. Bandupala is a sought-after speaker at national and international conferences. Across continents, he has delivered lectures on cutting-edge diabetes therapies, infectious diseases in diabetic populations, and hypertension management. Um, Extensive is his contribution to medical education, and his professional memberships are with ADA, CSI, RSSDI, and Philosophy of Care. He is very respected for his patient-centric approach, blending evidence-based medicine with empathy. His dedication to improving lives of patients with diabetes and related conditions has earned him widespread respect amongst peers and patients alike. It's a proud privilege to have you, sir, with us today. And I'm going to, the floor is actually open to you, and we really want to hear your insights and your life journey, which is really going to be incredible for many to know about. It's a mix of so many experiences, so many rich experiences that you have, and one should actually really know your journey. Someone who really wants to become a physician, diabetologist, or any doctor, it's very inspiring, and I know quite a bit of it. But so the floor is over to you to share.
Thank you very much, Rajeshri. Can you hear me first
Yeah,
clearly?
very much.
Okay. Right, thanks. Thank you very much to ask me to come here, and thank you very much for the award. From the uh, flyer which you have sent, it seems there are two things which was very important for you, and in your organization, True Wealth, and that is excellence and wisdom. Um, I think these two principles probably guide all of us. And when we start our journey, we always feel whether we are up to it. We have some sort of an imposter syndrome. Um, that I have. Am I really worth it? Do really I know my subject very well? Will I be able to give to care to my patients properly? What I heard in the first initial 1 hour of the program, the youngsters probably echoed the same thing, saying that our ability to give proper care, medical care to the patient, should be the center of our practice. If I look back on the last 40 years, it's been not really very extraordinary. It's the usual story of first decade of establishing yourself as a clinician. And I never looked myself as a diabetologist or an endocrinologist or a cardiologist. Though at that period of time, we used to have very integrated training. We did not have any super specialty available at that period of time. I'm talking of 70s, of time. So I always looked myself as as a clinician. And as the decades passed, as the super specialty started coming in, and the trend which we saw was that the patient-centric approach moved on to investigative approach, to instrumentation approach, or to doing thing right according to the protocol. Also, it went through that particular transition. It was true also because the society, the the technology, everything expanded. It was all good for the patient. But when we gained something, we lost something, and what we lost something was the patient centricity. I'm very happy hearing the last 1 year, all the four or participants talked that we would be rather patient centric, rather than being bound by algorithms and bound by data which has been in generated. But it is not going to be an easy transition. And for that, still the technology really, some of the super advances which has happened, extended our life, is uh, going to probably fade out. The new people who are going to come in will fade away from the clinical acumen, which should be an integral part out of giving patient care. And so today, I all of us should think whether are an intensivist or you are a diabetologist or you are a nephrologist or anything or a neurologist or anything. First you should consider yourself as a physician, and first you should consider that the patient comes first as a philosophy. A most important thing is you should consider when to use technology and when not to use technology. It's not or one shoes fit all when it comes to treatment of medicine. If you look at the writings and speeches of Dr. Farooq Udwaria, who was my teacher, our teacher and mentor, or he's always said that bedside medicine should be the first criteria before you go for any intervention medicine. Let me give you a small example of a last week a patient of mine on a CKM on dialysis on every day had an acute cardiac failure. And the cardiologist insisted, we must do an angiography at this particular. I was a little hesitant. I said, see, the patient is already a CRM patient. Let's first treat his failure, that little infection which is there, treat him and do it. But the cardiologist is so adamant, and that he said, ultimately the relative said, no, the doctor is saying an angiography was done. After 15 days, couple of days back, he expired. I'm not saying it is an angiography or a plasty or anything. Otherwise, also, he could have probably died. But I'm just trying to bring to your point how we forget the patient, how we forget the patient, and we look at the heart, we look at the kidney, we look at the brain, we look at the pancreas. That's what we look at, and we forget the patient. So the message today is one, that we must train our youngsters to bring in clinical medicine back into the practice, and they should be aware of all the technological advances occurred. And people who are super specialists also should understand that they are first physician and then a specialist. Now, coming to the today's theme or True Wealth's theme of excellence and wisdom, um, we feel that excellence is difficult to attain. We feel that only the people like who have been successful or have become excellent, and I cannot become an excellent. That imposter syndrome, which I talked of I feel over 4 decades of practice is excellence is an achievable thing. You have to start somewhere. If you feel, I cannot not reach the heights which my seniors have reached, I cannot have that particular excellent fisher which is necessary for me to give patient care. It will never happen. So first step is very, very important. However small a step could be. I had a very personal relationship with a father, Mr. Gadgil. I had even a professional relationship when I was an advisor with an organization. And there, the most important thing, what I noticed at that particular time, and I should tell is that Mr. Gadgil was focused. And once he got into a focus, once he said, this has to be done, ये होना ही है. These were his words. ये करना ही है, Oh, and basically he was ahead of his time. I'm whatever he had predicted and whatever things were done, I'm seeing slowly unfolding it. The relationship between the industry and the doctors are changing. And the relationship with the patient and the industry and the doctors are changing. All these things are basically changing, and he had already predicted. And he said that you need to be a friend of your doctor. And no, uh, uh, what I would say, no pharmaceutical marketing would be successful, which is based on medical untruth. But anything, if you say, and you have to stick to the medical truth, then only things will become very successful, whatever you to do. So excellence is possible. We should aim for excellence, and we may not achieve the sky which we wanted. We may not reach the goal which we had already, but we have to ask ourselves, if not we, who? If not now, when? Which probably Rashri said that if I'm going to talk about integrated healthcare, if it is me, then who? If it is not now, when hit, and we see the fruit which she has garnered. Now coming to the wisdom. Um, I think wisdom, if you think you are a wise man, you are not a wise man. And you should never think that wisdom is completely, you have reached the pinnacle of achieving wisdom. Um, but, but the wisdom and excellence go together. If and the wisdom is based on what? The wisdom is based on failures. Only failures can teach you wisdom. Success will teach you hubris. Success will teach you pride. Success will teach you, I know everything. Wisdom is the one thing. Wisdom is then when we feel, yeah, I'm always need to learn. I always need to know more, or before I take a final step or a final thing. So wisdom may not be achievable completely, and I think the best way is it's for a lifelong study. Only criteria when you can say, maybe you are a little wise man, not very much, is that when people come and ask you, oh, Rashri, what do you think about it? They may not listen to you, that's fine. But at least that question which comes to you, or comes to Anjana, or comes to Amit, and they come and say in the critical medicine, what do you think? Probably you think that you are on a pathway to wisdom. With this few words, I again want to thank all of you for your patient listening, and especially Rashri and his team who have done. Who have been ahead of time like her father, but now everybody is talking, and I just talked about our patient centricity, a integrated approach, not only medicine but holistic approach, yoga, everything. Thing is a way of the future. I again thank you very much for the honor which you have bestowed on me. Thanks a lot.
So I would like to share a couple of incidences, I mean, that I know from my childhood when I was probably in the school, when you both used to work together in one of the pharmaceutical companies. And dad would tell me that, there would be, when you both would get into a discussion, it would be one discussion which would go on and on. And, the amount of deliberation he would do was something he enjoyed a lot. You both, I guess, learned a lot from each other, and those were and that those times he would share what would be those discussions. So that's how I have learned about healthcare. That's how I have learned about the relationships. I mean, as you rightly said, making doctors your friend, because finally we all are human beings. Making your patient your friend, and it's finally about being human, and the philosophy which you follow in your practice as well. So I don't think this platform is enough to actually take your wisdom and the work that you've actually done through all these years. I mean, you've hardly mentioned any of it, and if there is a way that I can actually take things forward, or have more programs where you could actually share this with the general population as well as the doctors, it would be really excellent for them to know. Those days when medical marketing is something which is a well-known thing today, in those days, those relationships or those kind of roles were unknown, and you have done such great work in those times. So much so to highlight, and right from taking care of underprivileged patients to working with small, big hospitals and the super metro hospitals, which you are at, Leelavati, Hiranandani, and having globetrotted. It's a commendable journey for me. Has been it's been great experience for me to see it and be inspired. So I guess this is what really makes people like us do more. So thank you very much, sir, for sharing all your thoughts, and with a promise that I will, of course, do more with you. And we will. We have Dr. Rekha Bhatkande here, but she's around. I think she's just dropped out. But we would like to felicitate you with the award. Yes, Dr. Bhatkande is here. Uh, Bhatkande ma'am, good afternoon. It's always a pleasure to have you here. Again, I'm going to introduce you in a little bit, but multifaceted as you are, a gastroenterologist, dean, so much work that you do in public health. Thank you very much for being here to felicitate Dr. Bandupala. Here, we have Dr. Amit.
Thank you, Rajesh.
We have Dr. Pahuja as well. I think if you can add jump to the screen as well. Yes, and I will share the screen to share the board. Thank you so much, sir. And we will of course bring you the award in person and present it to you. So we will thank you, Dr. Pahujan. So with that, I think we will move forward to the next panel discussion. We are already a little behind in time. So the next panel discussion is on blending integrative care and next generation treatments for sustainable weight loss. We have Dr. Vimal Pahuja with us here. He's consultant and head of metabolic department, Dr. INH Hiranandani Hospital, Mumbai. He's an MD internal medicine. He has multiple fellowships to his name. Of course, diploma in diabetology from UK, scope certified obesity physician. He's faculty to a fellowship program as well at the Dr. LH Hiranandani Hospital, which is a fellowship in obesity, body metabolism, and nutrition, as well as a fellowship in diabetes by MUHS. His specific area of interest is obesity management by a multidisciplinary approach, inpatient diabetes management, diabetes remission, and technology in obesity and diabetes management. We have him, and I think we also will be joined by Dr. Patil here. I think I'll request my team to also have Dr. Bandupala on the screen if we can, and that way, if he would like to add any of his insights as well. But I am going to really start with Dr. Pahuja because his extensive experience in obesity management and holistic management of it is so very important. Dr. Pahuja, you're head of the department at the LH Hiranandani Hospital, and you really have such a specific interest in obesity management for years together. Now we've been hearing a lot of noise, how to manage obesity, but you've been doing it for very long. So, how could you describe the whole multidisciplinary approach, pharmacotherapy and the hospital-based weight management programs that you have? If you could share more about that with us and how all this really helps not only manage obesity, but also, diabetes, hypertension, cardiovascular diseases, because you're the best person to actually tell us about it.
Am I audible clearly?
Yes.
So thank you so much for inviting me here, and congratulations on this wonderful Integrative Nutrition Health Summit 2025. And I'm sure that we all know that you have been doing great work for all these years. And we just saw Dr. Bandupala getting felicitated. He's my teacher, in fact, and he has taught me about diabetes. And he was a person actually who's the reason I'm into this field actually. So I also was it was very heartwarming and heartening experience to see him getting felicitated today. And as he said clearly that you have to see the patient first, which he has always taught me to look at the patient and not the organ, which we always do. And I think this has been the recent kind of a practice that look at a patient as a piecemeal, not at one single organ, and then you just start treating. And this has been happening because of so many broad the super specialty practice has been coming in. However, we keep going to the basics of the medicine every time there's something new comes up. Like we saw COVID. What we saw in COVID, we went back to the basics of immunology. We went back to the basics of infectious disease, virology, and there also we practice multidisciplinary approach. If you see, it was not one person who was managing. There were so many people who were coming into and managing this patient. So you when a new field comes into it starts getting invented, new things starts getting coming up, we start going to the basics of that. And we think that, okay, this is not a way we are supposed to manage. We are going to supposed to manage a different way. I Way back in 2015, I conceived this idea of getting a multidisciplinary approach in my hospital, where nobody was thinking about managing patient with a multidisciplinary approach. We follow a silo practice throughout NUC, and silo practice was a norm back then. I'm talking about 10 years back when I started started a weight management center, which was just a few of our colleagues and my dedicated team who wanted to do something different in terms of managing the patients. And we saw that why not we do an integrated approach? Because when you talk about obesity, as you pointed out, how you manage those patients is has to have a one good history taking, the first thing. And a physician only can manage the obesity because a physician knows all the systems in detail about what kind of system are going to get affected. Obesity affects literally every system of the body. So you cannot say just lose weight loss. The weight loss is not the thing which you are looking at. We are looking at trying to correct the underlying cause of obesity, trying to address the why of obesity. And why of obesity can be only addressed if you look at the mental makeup of the patient, look at the social aspect of the patient's problems, look at the economic issues, look at the physical issues, look at so many the barriers. What are barriers? Why is not able to do that? So all these things will not be possible with a single person looking at all the aspects. It's like the demon with 10 heads, and you cannot treat 10 heads, but one person cannot do that. So you have to have a multidisciplinary approach whereby somebody is looking at the mental thing, somebody is looking at the physical aspect of things, somebody is looking at the food and nutrition aspect of the thing, somebody is looking at the entire picture altogether. Because otherwise you'll be looking at the elephant with somebody is looking at the tail, somebody is looking at the trunk and saying this is elephant. No, it's not. You have to look at the entire picture, and sir has rightly pointed out. So this is why we conceived this concept of multidisciplinary approach, and whereby we can gain all the insights, look at the entire history. And I think whenever you are not able to achieve your goals, or why the patient is not able to lose weight when you're doing something, go back to the history and see what information you have been able to obtain, what has worked, what has not worked, what works well for the patient, what are the problems for the patient, whether you have able to address those issues, and then you can actually give the outcomes to the patients. So this is a benefit of multidisciplinary approach, and that's why you need time, you need people, and you cannot do it just by simply giving medications. That doesn't happen. It's not that simple.
You're muted. You're muted. Rashri, you're muted. Yeah.
So apart from that, Dr. Prahuja, beyond just weight and weighing scale, are there any other key metabolic markers that you track so that you actually figure out that there's true health improvement that is happening through this obesity program? And um, how do these detailed insights guide the development of any sort of integrative and personalized plan or a nutrition meal plan and overall strategies? How does it help you?
Yes, that's a very important, pertinent question as to how you address the issue of obesity and then come to the game plan and come to the strategy. What we generally do is as I said, the entire obesity management lies on the base detailed history taking. That is the first and foremost. So if you see my the pro forma for history taking is a 3-page history taking we do, right from weight gain history, appetite history, which I don't think so. The medical schools will teach you how to take appetite history. There's a different kind of history we do. How to take a weight history. So all these histories we take, and then you look at the weight from what the weight has started, and when the weight gain has happened. What are the events which trigger the weight gain? All these things we have to ask. So these are the things which you should know. What medication he is taking, whether these are responsible. Other markers will definitely come. Of course, anthropometry will do. You will do your body composition analysis. You do at fat percentage. You do muscle mass. You look at muscle mass. All these things aspects we do look into. We do screen for a silent liver disease. We do FIB-4 scores. We look stop bank scoring. We do Curie scoring to see for cardiovascular disease. These scores are a part of my assessment always. So we do that scoring. I don't do fancy tests for just for the sake of it, like doing insulin levels and all. These don't give any much information. What gives you the information is basic good screening history taking and detailed history taking. That gives you the maximum information. Then you do the basis metabolic package. You do a metabolic test. You look at the vitamin levels. You look at the hemoglobin of the patient. You look at the liver of the patient, and of course all other organs you will definitely look into. And then once you see it, and then you see which organs you have to actually address, what is the grading of obesity, what is the staging of obesity, you come to the conclusion, and then you understand why there'll be a problem in this patient for not achieving the outcome. What are the barriers you are anticipating? And after looking at that, then we go ahead and see, because we have also the form to understand whether the patient has anxiety, whether it's got depression, is got stress eating, emotional eating. So then those have to be plugged in first. If the patient has psychiatric condition, that has to be plugged in first. Otherwise, whatever you are doing, you will not be successful. So you have a step up approach. You fix those mental issues first, motivate the patient. If this is not ready for still weight, he's come to you for weight loss, but he's not ready for weight loss, not motivated, you will not be successful. You give injections or do whatever drugs you have, magic drugs you have, you will not be successful, because everything will fall in flat. So what we have to do, we have to motivate the patient, start motivational interviews, then slowly start working on this patient. And then we have to formulate a plan according to the now what we can do for this patient: diet, exercise, and the what is the main important role which will who will play, which team player will play the main important role. We will just assign that, and we will follow it up, keep motivating the patient throughout the journey. So it's commitment I always ask for. It's not 15 days, 1 month. It's not a fever. You have to commit at least 6 months with me, so that we can work on you and give you the desired outcome. So generally, these are the things which I use. I use very simple tools, history taking, and then that's everything can be done.
So I think I'll come to the very talked about question right now, because there are newer drugs and very promising therapies that have
Yeah.
come up recently when it comes to medications. But you see people dropping weight, but does it really affect the appetite, the digestion? Because we've heard that there are gastrointestinal disturbances when these therapies are taken. So, what's really your take on it? In terms of course, the take should they be having supplements? Should they actually work on their digestion with some enzymes? How do they sort of preserve their muscle energy levels? Because all that again, and also any crucial nutrients that they should actually be receiving. So is there what's your take on that?
These are very important issues which we face, and I'm telling you. And when you talk about these medications in any forum, nobody talks about these issues. That these are the things, these are side effects. But what will you will do to address those side effects? What you will do to address the nutrition? I don't see any forum talking about these kind of issues. Not much talk. And basically, you also forget that you are not telling me that patient has got either irritable bowel syndrome underlying, which we not spoken about, or you're not telling me that the patient has the bacterial intestinal overgrowth, small intestinal bacterial overgrowth is very common in our country. And second thing, also we know that we Indian patients don't take enough protein. So these are the three major challenges you will see on this patient, and they get a lot of bloating. They'll come with a lot of constipation, on diarrhea. These are the side effects. But and then that motivation to lose weight and to continue the medications goes from 10 to 0. That's what happens, and I'm telling you this from my clinical experience, that I always get some or other messages from the patients who are on medications that, can I discontinue this medicine? I cannot tolerate because of these issues. So, but we have to understand that there are certain ways where we can alleviate these issues and how to circumvent that, and then motivate the patient. No, be on those medications. I will help you to circumvent those, and how you should address those issues. First of all, I'll come to the issue of muscle mass and protein. And you know that once you start taking medications, your gastric transit time is going to decrease. So of course you don't eat much, and then people don't take enough protein in that scenario. So we have to give some kind of a good blend of protein. Now also we start giving more protein. What will happen? They always develop protein dumping syndrome. They always get uh, protein not getting absorbed, and they get a protein dumping also. So that also has to be looked into, what you are going to give. So hydrosolate and isolates are the good sources where you can actually reduce this kind of issues. We also look into whether you can discuss with the dietitian whether he has got underlying IBS. Maybe put him on FODMAP kind of a diet. Use MCT, because you are encouraging whole grains, but people cannot tolerate also some whole grains. Some people cannot tolerate whole grains. So putting an MCT kind of oils or MCT powders generally tends to address these issues. Digestive enzymes, pancreatic lipases and all, and these things are very, very vital in this scenario. We have to give those to allow the absorption of the nutrients. This is very important, that you should address those things. You always, when you're looking at the protein, strength training also has to be recommended. Now, before the advent of GLP-1, we are talking about exercise, endurance and everything, but we're not talking much about resistance training then. After the advent of GLP-1, suddenly the talk of giving resistance training to all the patients so that they don't break their muscles. So, because protein and strength training has to be incorporated with GLP-1s. That is the norm. You should do it, otherwise the patient may lose muscle. Though a lot of data are being presented now with semaglutide and tirzepatide, that there's no much muscle loss, or there's a quality of the muscle remains intact, though the muscle volume may go down. The intra fiber, or the muscle fiber fat reduces, so that's why the muscle volume may go down. It's not the actual muscle going down, but still I think it's vital that the protein intake is maintained by these methods, and digestive enzymes should be given. You also can give the lot of EPA DHA has to be given, so that muscle mass builds up, because you need EPA DHA to help the muscle mass building. This is the things which we generally incorporate, and maybe you can treat those SIBOs with the gut biotics. You try to address the IBS issues, and then you will be much rewarded in terms of outcomes, and slowly the patient will start tolerating the medicines better.
Such important inputs, Dr. Pahuja, you have really brought up, and like you said, SIBO and IBS kind of symptoms are so common. Patients coming to me at times, it's so common, I can tell you. And doing these, if we plan their diets properly, some amount of supplementation and making them understand why they need it. It's not just because, you want to overload them with supplements, really helps, and they get so much of relief. And choosing patients before putting them on these therapies, and still going the old school way, and the multidisciplinary way seems to be the way forward, from what I understand, from what you just shared with us. So Dr. Bandupala, could you also, the wisdom really, we would want to know out here, is this how it should be?
Uh, what Vimala said is absolutely true, and it should be practiced. But we should not, shouldn't forget that pharmacology, which is happening in obesity, is going to make a tremendous change in the management of other diseases also. because weight, again, weight is a root cause of a lot of other issues. And we should use these pharmacological advances which are there in management of weight. But as Vimal said, don't expect too much from the pharmacology. Do understand and what are the pros and cons of the of the new molecule, and don't be the first one to discard it because one or two patients had severe diarrhea need to be admitted in the hospital and all. We will have to create our own paradigm of how to use this particular molecule for weight loss, plus us what are the side effects we expect and how to mitigate it. The present molecule that is tirzepatide and semaglutide, we just have a recent experience about 2 months, but the weight loss is reasonably very good. Even at 2.5 milligram in Indian population, I have seen even in the first month, 3 to 4 months, 3 to 4 kilos weight loss is there. And the issue which comes is the nausea, vomiting, which is there, which is much less than what the in personal. This is a personal experience, and there as compared to the Caucasian population. Taking a cue from the probiotic and from bacterial flora and what Vimal said. And what I am trying is I am using the nausea, little GI dyspepsia is very common and anticipated its side effect profile. So I use a probiotic 24 hours before I start the injectable and tell them to continue at least 3 to 5 or 10 days is still the effect of the first dose is off. And once they're able to tolerate it, then the second and the third dose can be taken, or you can add a probiotic if it is not there. One or two patients which have already done that had no complaints at all. So this probably proves what Vimal and you both are saying, that the GI flora taking care of is very, very important. Taking care of the diet, and as Vimal has said, and is also very important. And the counseling the patient in resistance exercises so that the muscle mass is not lost. So I think more and more people, physicians should start using this particular molecule because they're going to benefit. Yes, one thing which I have noticed is even if the weight doesn't go down, because I use only in the diabetic patient, I don't encourage people just for a weight loss, but diabetic patients, yes, even if they don't lose weight, the requirement of anti-diabetic agent goes down. Plus, there is a glycemic variability is also stabilized. This is very, very important in management of diabetes. So probably GLP-1 analog already has a benefit in heart and now in the kidneys also. Also, it would be this weight loss medicine which are newer coming up. Amycretin, which is going in a human trial, all these are going to make a sea change, and I'm sure we'll be able to tackle the obesity problem along with a holistic approach.
That's great. This is great sharing both perspectives. I think the audience has been able to learn, and I think I will make sure that this is spread across to as many people that we can, and more such programs. Dr. Pauja and Dr. Bandupala, we would have to have so as to encourage people to take care of their health, stay away from metabolic disorders, and there's lots when it comes to medications, and at the same time having a balanced approach with it. But I would, Dr. Pauja, I would want you to share any concluding remarks and that you could, any takeaways you would want to leave our viewers with.
Yes, I think it's very important to realize that obesity is growing leaps and bounds, and I'm telling you, there are a lot of molecules, as Sir said, coming up, and not only in terms of the GLP-1s or double receptor or triple receptor agonists are also going to come. These are the molecules which are going to revolutionize the treatment of obesity. And these are newer concepts which we are not learned in medical school. The kind of concepts which we had, the pharmacological concepts are completely different. What we learned, the pharmacology we learned, like beta agonism, biased agonism, they were never there in our medical school, never described. And these things are going to come, and many more concepts are going to come. In fact, the research is also looking at not the combining the medications with the medications which will reduce the muscle mass breaking. So these medications are also going to be in the pipeline. We are also going to get a monoclonal antibodies in that scenario. So a lot of medications are there which will be spoiled for choices, and we have to actually understand how to use this molecule in particular patients, how to make a drug cocktail, or how to switch from one another. That will be the guidelines with how to switch from one molecule to another, which molecule you can use, which molecule you cannot use if you have failed one molecule. So all these things are very important questions we have to understand and answer as the scenario will evolve. And as I said, the side effect profile have to be known. So I always give them the note handout to the patient before they start the medications. Go through these handouts. I have prepared those handouts, and they take those patient handouts and come back with the questions. So counseling becomes very important. They are open for they are open for the starting the medications. Pregnancy is very important thing which we have to discuss. You cannot give medication and the patient becomes pregnant because nobody told him, or they have never heard and never read about the medications, and we never discussed that you shouldn't become pregnant. There's external pregnancy which happens. So all these things, they have to be made very, very clear when you're starting the medication. Side effect profiles, and as sir said, probiotics. We discussed that protein. All these things, strategies have to be rerouted in a proper way in different kind of patients. I have just recently keep getting patients who start getting headache after starting medications. The migraine gets triggered. So many things you will see. Oh, this was never told to me, but these things you will keep seeing as you seeing a lot of patients. And now recently we also saw euglycemic diabetic ketoacidosis, or DKA, also getting precipitated with GLP-1s and combined GLP-1 GIP-1s. So these cases are also coming up. So we have to be very vigilant also when you start using the medications. Keep an open eye and about these. But these medications are definitely going to benefit, and use it in a right nutrition. That is also very important. Nutrition has to be nutraceuticals, protein has to be used along with these for in an integrated way, and along with exercise, so that you have best results out of these medications.
Thank you again for joining in to share all these insights with us, Dr. Pooja and Dr. Bandupala. I can't thank you enough. I'm really looking forward to seeing you in person. Thanks for coming here and receiving the award, the RSG Wisdom and Excellence Award. Thank you to both of you, and be there to listen into the next conversations. We have a launch of something which we are transforming the definition, which is Womenopause. It's coming up now, and so now we'll have some beautiful women joining in as well, and we also want men to support this initiative. So, having said that, I would I'll first.
Thank you for inviting
Thank
again,
you.
and
Uh,
and it was indeed wonderful speaking to you. And sir, thank you so much for your lovely insight.
Vimal, always by your side. Rashri, I am in a very small town in Madhya
Yes,
Pradesh.
I
As,
understand.
as I told you, I would love to be with the pretty ladies here.
Yes. No.
But
But
I suppose you will have a recording for
this
that.
is, yes, and this is just the beginning. We are just
That's the
launching
beginning.
it today. We'll have a lot of initiatives coming up.
It is okay.
Yeah.
All right. Okay. Thank you very much.
Yeah. Thank you, sir.
Have a great day. Thank you, all of you. Have a great day.
So really, true power isn't about halting, but it is about evolving. Have you ever wondered why it is menopause, men in the beginning of the word? Menarche, the first period, also starts with men in the beginning. Menstruation starts with men in the beginning. Yeah, I have nothing against men, but well, that's the reason why Womenopause. It's about rewriting the menopause narrative to Womenopause. which is actually about rejecting the idea of a pause in women's incredible life journey and empowering women to embrace this dynamic stage with continued strength and vitality for limitless progress. The Womenopause vision to share you with is to create a living, breathing support system, a support ecosystem that walks with every woman through her dynamic physiological, emotional, and spiritual transitions from menarche to menopause and far beyond. This platform aims to uplift, educate, and empower. The vision is to create an inclusive platform for clinical, nutritional, and emotional dialogue on the entire journey of women's health, PCOS to postmenopause, drive awareness, education, and community support through events, research backed nutrition modules, expert insights, and real stories. Highlight how integrative nutrition, functional medicine, and lifestyle strategies are vital to address hormone shifts, gut health, bone density, mood, and metabolism. With that, I'm actually going to hand over the baton to my partner here, I would say, Dr. Neha Soni. And I would, of course, want to introduce her first. And uh, let me take the opportunity to introduce all the faculty here so that uh, we can have all of them also on the. So that's Dr. Neha Soni. She's a gynecologist and obstetrician with experience of 10 plus years. She practices uh, she practices at Kaushal Hospital and Dr. Manushali Hospital. She completed MS Obstetrics and Gynecology from Maharashtra University in 2014 and MBBS from Maharashtra from the MUHS Nashik. She's extremely active when it comes to menopause as an initiative. We have always been running and doing a lot of physical programs, and she's of course very active in the associations, the multiple associations of women here. So she's the apt person to actually talk about this initiative more. We then have Dr. Supriya Arwari. She is um, consultant obstetrician, gynecologist, and infertility specialist, practicing at the Supreme Hospital, Bhiwandi for the past 20 years. She's MD OBGYN from AM Hospital. She is national coordinator of FOXY, the Adolescent Health Committee. She's vice president of the Thane Obstetrics and Gynecological Society talks. She's joint treasurer of the Association of Medical Consultants, AMC of Mumbai, and project chairperson for AMOG's project Me, Sakhi, and Mananti. Apart from that, she has so many awards to her name, publications to her name, programs and talks and conferences that she's invited to speak. So we are really very happy and proud to have Dr. Supriya Arwari with us today. Then another special friend, Pallavi Srivastav. Very happy to have Pallavi with us today. She's been a corporate and now a very, very deep social worker, I would say, but a leadership position in the social service. So Pallavi currently channels her extensive experience and passion for social impact as a key leader at Divij Foundation. In this pivotal role, she manages strategic planning and operational responsibilities for the organization. The foundation is dedicated to championing causes focused on uplifting the marginalized society and supporting individuals with challenges. Pallavi leverages her corporate expertise to drive efficiency, sustainable growth, and measurable impact, ensuring the foundation effectively delivers on its mission to create positive social change. Pallavi is a dynamic and accomplished professional with a robust background spanning the corporate sector and the non-profit domain. Hailing from Nagpur, she was born and raised. Pallavi brings a grounded perspective and strong work ethic to her leadership roles. equipped with an MBA featuring dual specializations in marketing and finance. She launched her distinguished career with prestigious large-scale corporates like the Aditya Birla Group, ICICI, HDFC. So it's a privilege to have her, and we're really looking forward to doing more activities on these lines with her. Not last but the least, I can go on and on if I have to read her resume, but Dr. Adaga Karkhanis, she's FRCPI, MRCPI, DRM, MRM. Um, I I probably won't even be able to pronounce all her degrees out here. She has so many fellowships and degrees to her name. A very dedicated medical professional when it comes to infertility practice and when it comes to general gynecology practice as well. So she's consultant gynecology, IVF, and fertility endoscopy, cosmetic gynecology, and facial aesthetics. She is invited as speaker at various national and international conferences and for her expertise in PCOD and weight management as well. Anaga has various academic book chapters to her credit. She has been part of the surgical team in the first robotic surgery unit of Ireland. And she's a member of the various gynecological societies in India, UK, Ireland, Europe, and USA. She has graced the ramp at prestigious fashion shows, walking for several renowned fashion designers to champion social causes such as women's empowerment, saving the girl child, and promoting girls' education. She's an active Rotarian, uh, currently the medical director and president nominee of the Rotary Club of Honey Hills. She's conducted various medical camps. So again, we're really looking forward uh, to Dr. Anaga really handholding us through this initiative and help us contribute more to the society. So with that, I'll pass the baton to Dr. Neha, who's really going to talk about menopause and the real need to have an association like this.
Yes, at the onset, thank you so much, Rajashri. Thank you for inviting me over here. And heartiest congratulations on the launch of this initiative. Okay, Womenopause. I mean, it's just a simple play of words, but the impact is huge. So I'll just quickly go through a few slides. If I'll just share the screen. Yeah.
Yes.
Visible? Yeah.
Yes.
So we'll just talk quickly about women's gynecological wellness, right? From teenage to middle age to menopausal age group. Okay. So as we have seen in the previous panel discussions as well, when it comes to women's health, I mean, unfortunately, they are the last ones to take care of their own health. They put their family first, their careers first, and they ignore their health to a large extent. But that should not be the case. They should take care of their health first, and that is something we need to create awareness about. They focus on their partners and their children, and their health comes later. So that should not be the case. They should take charge of their health. They should pay close attention to their body, to their symptoms. They should be educated about what screening tests and what tests need to be done at certain ages. They should be aware of their own family medical history. So what is a healthy woman and what is wellness? So wellness, is it just the absence of disease? Well, not exactly. Wellness is perfect harmony of the mind and the body. Okay, so we have a wellness wheel over here, and it is very difficult to be well in all aspects, for any woman, be it the physical, the emotional, spiritual, occupational, intellectual, environmental, social. It is just impossible to be well, in all the aspects, but that is something towards which they should, strive for. It is just to be in harmony, perfect harmony of body and mind. And for that, we need proper, well-balanced nutritional diet, good physical fitness, lifestyle, and stress management. Now that these three components remain the same throughout all age groups, no matter what, because all the symptoms and all the diseases that we see are because there is imbalance in one of these. The diet is not proper, there is no physical activity, there is a lot of stress, and there is improper lifestyle going on. So we'll come to the diet and all later, because that is part of the complete multidisciplinary and a complete approach which we need to take. But overall, different concerns and requirements at different ages. So from childhood to adolescence and then menopause. So when it comes to teenagers, the first thing which they need to be educated about is proper menstrual hygiene, because some of the girls, they are actually not aware, what they need to do. They need to be made aware in schools, right from the schools. And I think on this topic of adolescent health, Supriya Madam is the best person to take it forward later, because Madam is the head of the Foxy Adolescent Committee. But they need to be made aware in school regarding menstrual hygiene. They need all the kids and the mothers need to be made aware about the HPV vaccination. Best time to give it to teenage girls, which there are two strains available, the Gardasil and the Cervarix. And both have to be given. There are 3 doses, 0, 1, and 6. Okay. And that goes a long way in preventing cervical cancers. And that age group is the right age group to be given. Okay. Then comes the main problem in teenage girls nowadays is PCOS, which is just the tip of the iceberg. We have almost 5 patients out of 10, 50% patients in this age group who have the symptoms of PCOS. PCOS is a topic by itself, and I can go on and about it, but the basic crux of it anywhere is it needs lifestyle modifications. The girls, they need to focus on proper diet, proper exercise, proper sleep also, and the stress management. That needs to be taken care of, and only then can polycystic ovaries be controlled. We have come back to this, like I mentioned. Then come the 20s and the 30s, and now is the time now they need to look for the contraception part. Okay, she should actually consult a gynecologist. The patient can consult a gynecologist and be made aware about the various forms of contraception which are available instead of just taking over-the-counter medicines. Okay, regular pap smear is a must. For pregnancy, they need to be screened for rubella virus and they need to take the vaccine for rubella if necessary. And overall, this is the time when they are looking to start a family. They are looking for to take all the preconceptional vitamins which need to be taken and your proper iron calcium requirement which is necessary. If smoking and drinking should be discouraged at this place, avoid or control caffeine intake. And now comes the time of change, the one on which we are mainly focusing on, like, the 40s. So this is the time of menopause. And in India, 15% of the current women between the age groups of 30 to 49 are in the menopausal phase, out of which 10% have natural menopause and 5% have surgical menopause. Now, perimenopause is a phase which is just before menopause, and that is when your hormone levels have started decreasing. Okay, so you have to understand that menopause is not something which happens overnight. It is not like a switch which is just switched on and off and now boom, tomorrow you're in menopause. It is a gradual process. It is a transition. Just like, puberty happens over a period of time. Okay, that is the same way menopause is going to take some time, a few years. And that is the time of perimenopause. And that is the time, when your ovaries start, the function of the ovaries starts decreasing. They are not functioning as well as before. The hormone levels, your estrogen, progesterone, the two, the two favorite hormones of any woman, which she has been exposed to all these years. These are the hormones now they start dwindling, they start depleting. And now body just cannot understand how to, how to manage this. Body is used to these hormones since so many years. And now suddenly they are depleting. So body cannot adjust. And that's when it starts throwing a tantrum in the form of all these menopausal symptoms that the patient experiences. So she will have, period changes. Yes, periods will be irregular. There will just be little spotting. She will have hot flushes, night sweats. There may be mood changes. There is anxiety, depression. There is palpitations, vaginal dryness, sleep problems. Yes. Weight gain also. Yes. So again, so body is going to change, just as when the body enters puberty, there are changes, physical changes which take place. At the same time, some physical changes are going to take place during menopause. So it is very important, first of all, for the patient to understand this menopause has been, it's going to happen to everyone. It is part of a natural physiological process. It is not a disease. Menopause is definitely not a disease. It is a natural physiological process. It has been happening to everyone over all these ages. It's going to happen to you no matter what. You cannot stop it. The only thing you have to realize that, some of them just go into menopause without breaking a sweat. They don't have any symptoms at all. So it's not necessary that each and every patient is going to have some or the other symptoms. Some of them will just be, very comfortable about it. And so these are the patients who are, I'll talk about that later, who are, already following a good, healthy lifestyle, who are, following a proper diet, exercise, a sleep regime. These are the patients who will experience less of these symptoms. Okay. In the 40s, it is still time, contraception still cannot be avoided because ovulation is happening at an irregular basis. So you just cannot skip out contraception completely. So now is the time when the menopausal symptoms creep in. There is tendency to gain weight more so around the abdominal area. She has to take care of her, lipid profile, the calcium, vitamin D, and all these things. Now, once the menopause sets in, again, there may be some time where there is hot flushes. She may have, frequent urinary infections. There is vaginal dryness. There is definite drop in the bone density. And so that is why that needs to be fortified with calcium and vitamin D. It's very important, especially at this age, that the patient regularly checks her blood pressure, diabetes. And there are few screening tests which need to be done. We will come to that later. But in the 60s, again, it is very important that the woman manages her exercise with a healthy diet and weight management. Now there is increased risk of heart disease. There is a risk of ovarian, uterine, and breast cancer is highest at this age. Benign causes, a benign discomfort at this age can be some uterine prolapse or osteoarthritis. Overall, it is important to understand that an average woman will lose muscle with each and every decade and will gain fat. So the more muscle mass you gain before you hit menopause, that's just going to help you in the long run. And so hence, at any given point of time, your exercise schedule should include some form of weight training because that is how you're going to gain muscle. And the more muscle mass you have initially, that's going to stay with you later on because muscle is going to deplete every decade. Okay, but if you have a good starting pot, it's like that, then you are taken care of. Again, 5 medical conditions which are of great concern later on, in the perimenopause and the menopause period is you have to look out for heart diseases, breast cancer, osteoporosis, depression to certain extent. And the screening tests which should be done, routinely, like I said, the blood test, yes, for checking your sugars, your lipids, those things. But the 3 important ones which need to be done is a mammogram. Yes, a mammogram for breast cancer, sonography for, any ovarian pathology, and a pap smear test for cervical cancer. These are 3 things which need to be done on a routine basis. It's important that the patient discusses that with the doctor, with her gynecologist, and gets those tests done at a routine basis. It's important to check for bone density, osteoporosis, and blood pressure, cholesterol, diabetes, vitamin deficiency. And overall, just to conclude, I would like to say it's important to take care of your body. It's never too late, even if the grandmom can hop onto the treadmill, or hop onto the bike, to build up some muscle, it is never too late. It is very important that no matter what stage, it is important to eat healthy, be active, manage stress, and supplement wisely, and so that's where, again, the whole integrative approach, it's important, to include the gynac, the nutritionist, some lifestyle coach and everyone, sometimes a psychologist, everyone has to be on board to manage these symptoms. Okay, so finally, I'd like to conclude by saying that yes, menopause is not a pause. In fact, it is time for power play. Okay. So, yeah.
I think on that note, we're going to launch the initiative, and interestingly, actually, we also have Dr. Sushruth Babulkar with us, and you did mention, Neha, about bone density and bone issues. Dr. Babulkar just recently launched the basically the Osteoporosis Society of India, and he is with us. We have Dr. Rekha Bhatkande with us. Um, she does a lot of work in the public health segment, and she's relentless. So the reason to bring all of us together on this panel, or rather this program today, is to be able to leverage our position and to be able to take this initiative together ahead. Create be the ambassadors of Womenopause, but also train and create more Womenopause ambassadors. So I would can we also add Dr. Sushruth Babulkar? And if I mean, I know it's a women panel, but he's actually doing multidisciplinary work for women. Thank you so much for that, Dr. Babulkar. And we have Dr. Neeti Desai here. She's uh, she has extensive experience in nutrition and when it comes to bone health and women. We have Dr. Shamal, who's actually uh, who's on the research side of it, who works on different deficiencies and works on manufacturing those products. I want to bring him in here because he is very keen on getting or rather developing more personal care products for women. He has done that in the past. He has very deep experience in it. So can we also spotlight him? And we have one very young woman here, Charvi. I don't know if she's going to be able to put our video on. And we have some um, young women here also who can actually contribute to our initiative. So it's such a happy time. Charvi, if you can switch your video on, that will be great as well. So with you all launching this Womenopause initiative, I would really want each of you to say a few words. I first would insist, Dr. Supriya, she being so active in so many associations, gynecological associations, and given her experience, if she can share her inputs, I think she's on. Yes, yes, Dr. Supriya. Am I audible to you, Dr. Supriya? Probably not. Okay. Then I think we'll move on to Pallavi Srivastav here because Pallavi and I have spoken about this as well multiple times, and she has her own views on it. Pallavi, please share your inputs.
Yeah, very good afternoon to everyone. And thank you, Rashri. First of all, hearty congratulations on a topic not much spoken about. It lacks awareness and education. Even I'm talking about women workforce where education has not been, has been provided. So many congratulations on picking up a a topic which usually challenges, the taboos. And I think it's a step towards reclaiming the dignity of a woman. And it's giving a voice to something which is really unheard and unsaid. So moving on. Thank you, Dr. Neha. Your session was really insightful. Not coming from a medical background, I think there were good takeaways, and I'm sure the coming doctors would add more value to it. To quickly start with, I have been in the social service sector for the last 8 years, relentlessly working for women and children. And in my experience, I believe that the woman is, while maybe a pillar of the family and finally to a society, but honestly, this pillar herself is very weak. I mean, there are a lot of areas where a woman needs to be handhold. And I believe menopause is one such thing where it's absolutely a dark and a gray area, especially I believe in the Indian society. So I think menopause has to be celebrated as a transition. It's purely a pause, and life has to restructure and restart definitely. Our mothers and our previous generation would have taken this and navigated, completely directionless, without in isolation, no hand holding. But I think we as women need to step up because there is more than enough that can be done in this area. My visits, I work very closely to the tribals of Palghar, And every time when I visit, there are new areas that come to highlight, which, it's just 7 or 8 hours away from Mumbai. I'm talking about the remote areas. But when we talk about the areas or the kind of knowledge that they have on the very basics of life, it's really saddening. So I think we as women need to really, really stand up, take up this cause more seriously, and spread awareness. I think the first step or the first, I think the initiative to fight any battle is to remove the darkness, which will be through the light of education and through the light of knowledge. Whether it could be as basic as starting from our homes, where we educate the people around us. We create the empathy that the family needs to develop, the kind of acceptance that is required. Because all of a sudden we find men saying that, things are difficult at the home front, the women are more nagging or stuff like that. There could be areas where the BP is shooting, or there could be many medical issues or the basic functioning of the human body. But I think it's more about creating awareness within the family. It's about creating the acceptability and also about being empathetic to the woman per se, because I think she's equally challenged and accepting and moving on. So to start with the family, then to create awareness at the social level. When we talk about social level, it could be even at the workplace where we are associated with. There could be the HR team who can be sensitized about this very topic, and there could be areas where even men are, required to be more empathetic. The employer needs to be more empathetic to the women workforce, because all these years when they have contributed to the organization, there could be a time, there could be a pause that is required. And here we should be, focusing on the Womenopause, as Rashri has rightly said. So I think it's more about education. It's more about the awareness that is really, really required. Secondly, about there are various women groups that there are available. They are the social groups that are there, the Mahila Mandas. Then these are Bachat Gat Yojanas, and these are women who are very enterprising. They may not be very qualified professionally, but these are women who are very enterprising, and they play a very key role in each and every household and launching any scheme that is rolled out by the government. Primarily now being in Mumbai, I'm seeing how effectively they run any scheme that is launched by BMC, and it's run out to the households. So these are the very good resources for anyone who would like to, tap them as a very wonderful resource to launch any initiative. We might as well be required to launch certain social initiatives, and these Mahila Mandas can be a very great source of mobilizing our entire knowledge right down to each and every household. There could be health camps, checkups that can be run at a local level. I'm very sure there are great doctors, who empathize, who want this to be spread. So getting connected, and here is where I believe the NGOs and the non-profits can play a very important role of connecting the dots or joining the dots to a greater successful venture or an initiative. So launching health camps primarily at a local level, and then whatever medication and other things that are required can be the step two. This can involve complete areas where the women, are importantly shown the right way to respect themselves during this sensitive time of their life. And there could be community kitchen classes as well, because finally it's all starts with the kitchen. Because I think our traditional Indian diet, the Ayurveda, and the naturopathy, I mean, we have more than enough to explore, and I'm sure there are professionals who can guide these women well. So, like, if I have, sorry. So there could be workshops, there could be some storytelling sessions where these topics can be discussed in a more lighter and in a more deeper way than it has ever been done so far. If I have to refer to an example of my nonprofit, so we have a 360-degree view to the women around us. We primarily work for the marginalized. So there are many workshops where we conduct, and we have a total group size of, even 700 to 1,000 women gathering at one place. And I believe if we integrate this with places like how Rashri has done, I think there could be some very effective speaker. I mean, we have some very wonderful women here who can come guide these women, and the takeaway can be really high. So I think it's more about integrating what is currently available and what we have and putting together to create a more wonderful and a beautiful way to structure this problem. And more so, I believe that it's more about how it differs from women to women. That also needs to be inculcated or addressed in their education system. 18th of October, which is celebrated as the World Menstrual Day, I believe that this could be a greater platform to have the greater workforce working towards this to make it more grand, more relevant to the Indian society. So finally, to sum it up, I believe it's more about public health campaigns. It's more about education, awareness, how to rope in the NGOs, the non-profits, the government agencies who are willing to work, the women workforce who are already there on ground, how to utilize them, optimize their pluses that we have, and embrace menopause as a transition phase and not as a permanent stoppage to their life. There has to be somebody coming up and saying, hey, women, you're important, and so is your health. That's all I believe. Thank you.
This is absolutely amazing, Pallavi, because this is why I love you. That you actually gave us me the roadmap and also gave me a timeline. So we better get working towards it, and that's and with your support and with the support from all of us here, I think we will design so many things that can be done in the coming year and of course the coming years. So I think now that we have started, let's take it forward with strength. I would also want Dr. Anagha Karkanis to share her insight. She does a lot of work in women health, and she's very well known celebrity, and also celebrity not just because she's famous, but also celebrity of the therapy that she provides, the treatment that she provides. So, Anaga, it's always a pleasure to have you. And we know each other for two generations. Our fathers knew each other well. So having you and having your organization with us is really very pivotal for this kind of an initiative.
Thanks, Rajesh. First of all, heartiest congratulations. And since it is, about your father and all, especially I had to make it today. I canceled something else. I wanted to be here. Yeah, and it's a great, great, great initiative. And I would like to add, I'm so impressed by what Pallavi Srivastav, just whatever she said, I would like to connect with her because, like you mentioned, I also do a lot of programs where, like, women's health, the checkup camps, or free vaccinations we did. I have now completed about 10,000, not 1,000, 10,000
Yeah.
vaccinations, HPV for cervical cancer prevention, HPV, and like especially in 9 to 14 age group. So a lot of activities happen, and that is also because I am in the field of gynecology. It happens to be so, but I'm really passionate about the other aspect of it, which goes beyond just disease and treatment. So, what you're doing basically, the integrative nutrition and health and everything, it is so much important because that is exactly how we deal with it at our clinic levels also. When we see someone, it's not about treating a blood report or just a disease. It is going beyond, and in a way also trying to educate the family, because if a mother has features of, say, diabetes, obesity, she comes with her daughter who's 13 or 14, and it is so important to tell her the importance of lifestyle and like if any factors are there. And I'll tell you, most often children are like, they are doing a lot of McDonald's, sorry, not particularly saying a brand, I mean a lot of outside fast foods or burgers or pizzas, and a lot of aerated and carbonated drinks. It is so much there, and I think so much the again, not taking any brand names, but the food delivery providers, it has
Not
become
taking any children names as well. Remember
no,
that.
no,
Taking
children
brand
is
names is still okay.
no,
Taking
children
your
will never.
children name is not
Children,
okay.
no, that will never come. No patient names ever, never.
Not
So,
patients, our own children.
our children, no,
That's
that I
deadlier.
dare not. If he sees this, I dare not. But yes, everything starts there actually, and that is why we understand when we explore outside, we say, okay, it's not only at my home. It is a problem of a whole generation that they are exposed to things outside, which is advertisements, food, easy food deliveries, and this is where we need to really educate right from that adolescence age group. Because if we see, they had done this study. This started in 1985, the childhood determinants of adult health. So they checked 1,500. It was done on girls. So 1,544 children they followed up, and they were followed up for 25 years. And that is where they found that girls who had obesity as children until the age of at the age of 12 and onwards, they were more at risk of infertility and requiring infertility treatments in the future. So there it goes. I mean, there is so much happening there that if we try and kind of control it from the beginning, we can probably prevent those things, because these are even like childhood obesity. Again, we talk about the numbers. It was a 2023 data which showed that 550 million children globally today between the age of 9 and 19, 5 and 19 rather, are suffering from obesity. That is too much. I mean, we used to also think that it is about, okay, people who eat more, or they have access to fried foods and all, but now it has all changed. It is not socioeconomic. It is also the kind of food, what we were speaking of, extra processed food, and maybe the whole environment of plastics and everything. So this somewhere needs to be changed, where we do the like children and mothers, basically, where we do the health camp. We speak on this as well to spread awareness. And many times they don't know, which is surprising. They don't know. They feel that, oh, I'm just having, it's a meal, right? A meal is a meal, whether I have home cooked food or I'm having something outside. It's the same. So this is where the gap comes. And so I often families who are educated as well, it comes as a surprise to me that they are not so much um, strict, or I shouldn't say strict because it's difficult to be strict actually, but at least they are not so much making changes until really we need to sit and counsel them and tell them, and that is where some eye opener has to be there. So that is one thing. So this completely resonates with what I feel preventive care. Your Womenopause is preventive care and taking care of the future, that they don't land up in health issues, because we are facing problems now that the previous generations did not. We really don't move around much. We don't walk to our works. We don't cycle. We don't do much. So that is the whole crux of it, I think. Yeah.
Absolutely. So I know we have a time crunch today. It's just a
Yeah.
launch, but that doesn't mean we're going to stop. So we're going to have more programs, and though it's not going to be my father's birth anniversary, but we still have to get together. Pallavi's already given us a deadline, so I think I will have to start urging and working towards it. So we will of course have another program where we all can share our thoughts more in detail, and also share the knowledge. So I would like to, from the bottom of my heart, thank each of you to be here. Pallavi for being here, Dr. Neha, Dr. Anada, uh, Dr. Supriya. We didn't get your input, but we are going to get that in the. We have a panel discussion coming up with you, with Neeti, and of course with Dr. Babulkar. So that session is coming up next. Womenopause there is no pause now. We started, so it's only going to be progress. So thank you for joining me in for this. I'm going to take the proud privilege now to introduce Dr. Sutfur Babulkar. And can't be proud enough of him, because he's one person that I've seen when he takes up something, you know it's going to go to its best high, and it's going to really going to be a great initiative. So, Dr. Shushrit Babulkar, it's such a pleasure to have you here. He's founder president of the Osteoporosis Society of India, which was recently launched, and it's already growing leaps and bounds. He's director of Sushruth Institute of Medical Sciences and Academy of Clinical Research, India, Nagpur. He has been president of the Trauma Society of India and seen the way it has grown. He's MS Orthopedics, MCH Orthopedics, Royal Liverpool University Hospital, UK, trained at the Bedford Hospital, Cambridge University, Kirk Hospital, University of Manchester, Fellowship of Royal Society of Medicine, Joint Replacement Fellow, Dr. C.S. Ranawat at Lennox Hill Hospital, Fellowship in Hand and Upper Limb Orthopedic Surgery, Thomas Jefferson Medical School and Philadelphia Hand Center. He's authored multiple textbooks, publications. He's speaker at endless national and international conferences. It's a proud privilege to have him here today with us. I did introduce Dr. Supriya, but it's a pleasure to have her here. She's three decades long experience in gynecology and obstetrics, and she's doing extensive work with different associations. So, it's a proud privilege to have her with us. And Dr. Neeti Desai. Neeti Desai is a consultant nutritionist practicing in South Mumbai for over 20 years and is attached to Kambala Hill Hospital and Heart Institute. After having worked in UK, Neeti has a master's degree in nutrition and dietetics from University of Mumbai and a postgraduate diploma in dietetics from the Leeds Metropolitan University, UK. She was the official nutritionist for Femina Miss India 2008, Grazia Supermodel India, and Teen Diva 2008 pageants. She's a consultant and KOL to leading food majors, nutraceutical and pharmaceutical companies, educational institutes, and gyms. She's an absolute asset to have. When it comes to any nutritional planning, doing any nutritional talks, and it's always a pleasure to have Neeti, to have you on our programs. And when it comes to osteoporosis and bone health, it's your deep experience and expertise, and we also, I know a lot comes to you from your home as well when it comes to bone and joint health. So I think many perspectives that we are going to hear in today. But at the outset, first, I would like to congratulate Dr. Sushil Babulkar for launching such an amazing initiative. And I wonder why it was never done in India until now. But we would really want to hear from you what really made you do it, and what's the vision forward, when it comes to this society.
Thanks, Rajeshri. Thanks for inviting me. And of course, when it's Kakansa reason, I could never say no to your invite. So Osteoporosis Society of India is an amalgamation, is a group of orthopedic surgeons who are responsible for treating fragility fractures, gynecologists, endocrinologists, rheumatologists, and medicine physicians all have come together. So Foxy coming in together, ISBMR, Trauma Society of India, and API Medicine National level. Couple of years back, we thought that we should establish guidelines for postmenopausal women, and that's what we did. And it was a group of gynecologists, endocrinologists, and me. We brought the first scientific postmenopausal osteoporosis guideline. But when it was put to use, I realized in clinical practice that gynecologists are very afraid of using higher end pharmacological agents like teriparatide or bisphosphonates. Orthopedic surgeons are extremely afraid of using HRT, hormone replacement therapy. Endocrine, though they are the brain behind osteoporosis and its mechanism at molecular level, they are so busy in diabetes that they get seldom any time to treat osteoporosis when it should be treated, which is peak bone mass age group, which is 25 to 35. So we thought that there should be one guideline followed by all the clinicians who are actively treating osteoporosis or who should be actively treating osteoporosis, which starts at a young age, which Anagha was talking about. It starts from childhood, and those people manifest when they become adults as fully grown osteopenia or osteoporosis. So peak bone mass age group, which is 25 to 35, is what we should aim at, and when we should improve the bone health. We are talking of only health which is maybe not related to bone, but we very fondly say that beauty is bone deep and not skin deep. So we have to go bone deep, and we have to make sure that bone health is better. We have to have one guideline which is to be followed by gynecologists, orthopedic surgeons, endocrines, physicians, whosoever is going to treat patients, or in fact persons. These are not patients as yet. Persons whom we want to improve on bone health should be treated equivocally, with the same background, with the same thought process in mind, which has to be scientific. And so Osteoporosis Society of India was created 7 or 8 weeks back, and the launch, it took place in Taj Mahal Palace in Mumbai. I am the president. Dr. Nandita Palshetkar, gynecologist, is the secretary, and vice presidents are from every field, which is endocrine, which is physicians, which is gynecologists. So we are making the core team, which is from all the branches. And I suggest all pretty ladies sitting here to be a part of this. The first annual conference is happening in Nagpur, 6th of July. But the next meeting, which will be in Mumbai, and Nandita will have it, will be a big roar. And I'm sure it will create, by that time, we will create some guidelines for every age group of men and women, which we should be tackling. So that's the idea, and that's why we want to come together on a scientific basis, on an academic basis, completely non-political, but we want to have a common guideline to be followed by every one of us listening here.
That's great, and I'm excited because I'm such a big fan of integrating therapies and treatments, and I think this is what happens to us when it comes to nutrition as well. I mean, we keep treating the disease only with nutrition, so sometimes that's not enough. You have to have the aggressive treatments also, which should be integrated together. So, having said that, I mean. I did invite two of our great friends, Dr. Supriya and Neeti here, also to add their gynecological and nutritional perspectives. And so on that note, I would want to ask Dr. Supriya. It was happy to have you for the launch of Womenopause with us today, and also when it comes to what Dr. Baburkar just said, what's your take on it? Because and how can you really make audience here understand that women across different life stages, there are hormonal shifts during perimenopause, menopause, and how does that really directly impact the bone density, and along with bone density, the muscle strength, which indirectly then again affects the bones. So, and what are sort of the early signs and symptoms that women should watch for?
Okay, first and foremost, Rajeshri, let me congratulate you on this wonderful, platform that you've created. And it's been such a great learning experience for me. I've been, hearing all the stalwarts. And Sushrut sir, I think that's a great initiative. And I'm sure once Nandita takes the reins, it is going to come with a bang. And really looking forward to, being a part of the entire initiative. I cannot proceed before I pay my homage to dear Dr. Gadgil sir. He was a mentor, guide, a friend, philosopher for several generations of doctors and pharmacologists. My brother being one of them, and I have great respect for him. And I'm so glad that Rajeshri is carrying forward the baton of doing good work to society. Now, coming to the topic itself, lots have been said about menopause, about the importance of osteoporosis in menopause. Now, menopause, as the previous speakers have mentioned, it's a very, very natural process, something that is unavoidable. But at the same time, we need to get to the masses to tell them what are the problems that menopausal women are going to face. It's time we made a shift our focus from cure to control, from treatment to prevention. And I think this training should start as early as when the girls are in their adolescent age. Especially women go through lots of physiological changes during life, and consequently their metabolism changes a lot, and always it is the bones that are taking the brunt of the entire process. During adolescence they have their growth spurt, during reproductive years they are having babies, then they are lactating, wherein a lot of calcium is drawn out from especially the hip, from the spine. And then there is the menopause where the estrogen start dwindling, and therefore the bones become rarefied, leading to osteopenia, osteoporosis, and all a host of symptoms that are associated with it. Then not only that, there are a lot of mental changes taking place in the women's mind. These are often neglected. They are probably at the age when their daughters and daughters-in-law have taken over the reins of the family. They're probably nearing their retirement, lot of free time on hand, and somehow the feeling that they don't no longer are productive members of society. So I guess the awareness has to start that number one, it is not a full stop, it is just a colon. It's a start of a new phase in your life which they can cash on. It should not be a menopause, it's me no pause. And coming to the medical aspects, yes, they need to be advised about good diet. The importance of diet and exercise cannot be overstressed. We have a nutritionist on board, and I'm sure she will give more insight. Exercise is something that is extremely neglected in the Indian context. We as a whole, as a Indian race, are very very lazy as far as exercises are concerned. You take maybe the 20% of population staying in the metros, 80% of the rest probably don't know the importance of exercise. Then again here, catch them young and watch them grow. This awareness needs to be given to the adolescent age group. The signs and symptoms that women may face is easy fatigability. They have cramps, night cramps especially. They can have aches and pains, difficulty in getting around, in movement, in turning, or in changing postures, easy fractures. These are the various signs and symptoms that women can have face probably particularly because of the bone and the osteoporosis that is taking place. The mental changes, like I already mentioned, the emotional lability, there may be little lack of sleep, there may be easy anger, easy crying spell, immediate crying spells. All these need to be addressed. So I guess as a whole, it should be a holistic approach where the woman's physical, mental, emotional health is also targeted. Unfortunately, our women already what the previous speakers have mentioned, keep themselves the last on their priority list. And this is where when they come as accompanying some patient, some maybe they come with the pregnant woman, the mother-in-law is there or the mother is there, the nanny is there. That is the time maybe we can take some time out to counsel them. So I guess advocacy, awareness, and a multidisciplinary approach as what we are doing today with so many of the experts from various a cross section of various fields connected to women's health. They should be on board, and I think that's how we can take the whole thing forward. Thank you.
This, I think you explained everything in a nutshell. I think the holistic response was what it was. But so, to add to the nutrition part of it, and I'm itching to ask this to Niti because I know she will aptly answer this, is that, one thing is planning proper meals and the right foods is one thing I think you can throw light. But in addition, also in these type of conditions, especially when it is osteopenia leading to osteoporosis or osteoporosis, how effective are supplements? Because here, I think there definitely there is an importance here. And, when we talk about proteins, then, proteins with vitamin minerals, is that a good idea to have such comprehensive supplements? And also trying to, one of the earlier speakers also spoke about digestion being an important aspect. So, does that also really count when you're actually advising your patients?
Right. Thank you on the outset. I would like to thank Rajashri for having me here. It's always a privilege and pleasure. I absolutely admire your passion for holistic approach to health and to your dad's memory. So, coming to the question, yes. So there are two, three issues. One is that protein is always kind of associated with muscle health, but protein also forms the backbone of bones. That's the basic
Yeah.
matrix in which the minerals are embedded. So as we've discussed earlier, also protein, we as Indians are not getting enough protein. So that needs to be emphasized significantly, even when we are talking about bone health. ICMR-NIN recommends that we should be getting sufficient protein from our diet. That should be our first goal, which is what we all want to do. But very often, for different reasons, that is not possible. That doesn't happen. And that's where the protein supplements can come in to augment the intake, even to meet our basic requirements, which is 0.8 grams per kg per body, which we are not meeting most of the times. Along with protein, of course, when we talk about bones, it's calcium and vitamin D, which are absolutely the next important nutrients. When it comes to calcium, again, statistics show that majority of the population is not meeting the calcium requirements. Added to this are some of the challenges which we see in practice. One is that a lot of people are avoiding dairy for different reasons. They are going on a vegan diet, or they're not wanting dairy for multiple reasons. And if you are primarily a vegetarian, where are you going to get your calcium from? So that is a big challenge. Then there is this kind of people are not very keen to even take calcium supplements, some of them, because they've read that calcium supplements causes calcification of arteries. So then there are questions there. Besides that, one needs to understand that the calcium that we get from supplements, for example, calcium carbonate, it is only 40%. So even if you do a 500 milligrams of calcium carbonate, what we are getting is 200 milligrams. And our requirements, depending on the age group, is 1,000 to 1,200. Since we are talking about menopause, is 1,200 milligrams. So if we are still getting only 200 milligrams from supplement, we will still have to make it up from the diet. Also, one needs to understand that the higher the calcium supplement dosage, lower is the absorption. So even if you want to take more calcium from supplements, it needs to be split between two doses. And then, of course, vitamin D is the challenge, the sunshine vitamin. Unfortunately, most of the metro cities, we are not getting the sunshine, the right one. So we are not getting enough vitamin D.
Yeah.
Vegetarian sources are not there. Majority of the Indian population is vegetarian. Even the non-vegetarian, some of them have non-veg maybe once or twice a week. So getting vitamin D from food sufficient vitamin D is not working, and that's where the supplementation is almost mandatory. Here again, we need to just a sign of caution that vitamin D supplementation cannot be indiscriminate. We need to know the vitamin D levels and then only supplement, because we do see cases of hypervitaminosis where the vitamin D levels have gone above level, and that's clearly not good for bone health.
Yeah. I'm glad to hear all that you said. Resonates completely to my thinking. But so then, actually, just pointing this whole thing towards Dr. Babulkar, that when it comes to in your surgical practice, in prepping your patients for surgeries in such cases, or non-surgical as well, do you really consider supplements or nutritional planning pre-post surgeries, especially when it comes to osteoporotic fractures and when your patients are osteoporotic, going through a knee surgery, etc.
So, Rajesh, actually, what happens is fragility fractures or fractures because of osteoporosis needs a completely different workup. We have to have a lot of technicalities are involved. We have to have multiple implants, which plays a role in fixing the fractures, but nutritional status plays a crucial role in recovery. So the hypermetabolic response increases the nutrient demands, leading to muscle breakdown, impaired healing. So targeted nutritional supplementation can preserve muscle mass, it can support collagen synthesis, and of course reduce post-operative complications. As Niti suggested, high protein diet also reduces post-operative complications. So it pertains to hospital stay, cost, readmissions also. So what we are looking at is while whole food proteins are ideal supplements, often a concentrated source without excessive calories is what is preferred. So we want to bridge the gap between evidence and clinical practice through personalized nutritional plans, some standardized protocols which can improve the outcome of osteoporosis and related fractures. So that's what we are looking at.
The other thing, just to share with in the patients that we especially see at Kaushalya, and there are a significant number of orthopedic patients out there. This is what you've realized, that most now, if there are three patients coming to you, at least 1 to 2 patients have digestive issues, and especially if they are the elderly group, that's where they're suffering. So no matter what multivitamins you're taking, or no matter what foods you're eating, if that's not getting digested, even if you're trying to eat protein because protein is needed to build bones, they're just not simply not able to digest it. And there's a lot of bloating
True.
and those kind of issues. So I have seen in my practice that that we've been talking about gut brain axis. Now there's a gut metabolic axis. So I think gut really is at the center of everything. So in these integrative programs, or the integrative nutritional plans that you actually, protocols that you put together, I think gut is really at the center of a lot of things. Earlier, of course, there was also a discussion on kidney, and kidney diseases related to the bone loss as well. So many parameters that are really connected to beauty being bone deep, like you rightly said. On that note, I think, Dr. Supriya, do you also feel the importance of, like we said, proteins is one thing, and digestive enzymes? Do you see digestive issues increasing? And also, protein is something which you always talk about women not eating it. So, what's your take on supplementation?
Actually, yeah, see, there are certain things that are, myths that are associated with supplementation. An ideal supplement actually should, contain the required amount of proteins, calcium, vitamin D, some of the trace minerals, zinc, magnesium. All these are, the ones needed by the body. If I talk about the women, especially nearing menopause, in the peri or the postmenopausal age, calcium is an important supplement apart from protein. Of course, protein, because it is the main building block of the body, and for muscle mass, we need proteins. But in addition, we need to also remember calcium, which is required for replenishing the dwindling calcium supply of the bone. Vitamin D is another, new kid on the block, and now it is being implicated in each and every disease and each and every specialty, and that is something that we have to, give due importance to. And the trace minerals are something that can, bring all these together. But we must remind our patients that supplements cannot replace a balanced diet. The mainstay of their good nutrition to the body has to be through the diet, and that is something that maybe then we as caregivers need to, imprint on their mind. It is not enough that they have a fat diet and then take a few supplements here and there, and then they'll be sorted. They need to have the right kind of food also. And another problem that we as an Indian society faces, vegetarianism, which then exposes them to very low sources of proteins. So we need to tell them that it's not that only there are non-vegetarian sources, there are lots of vegetarian sources that need to be included in their routine diet. Apart from that, of course, the supplementation is going to be there. But yes, importance of a balanced diet needs to be stressed. Vitamin D freely available in our country. We have, 3 seasons. We have summer, we have monsoon, and then we have more summer. So in such a hot country, it is so shocking that more than 80% of women are vitamin D deficient, and 1 out of 2 women are going to have osteoporosis. So we need to imprint on the mind, exposure, something simple like exposure to sunlight, which we take it for granted, but often is not done with a modern kind of lifestyle where we are always indoors. We are in AC chambers, we are traveling in AC cars, we are hardly exposed to sun. We hardly need only 15 to 30 minutes of exposure to the midday sun, that and you are sorted for the requirement of vitamin D. But even that is not available even to small kids, because they are more indoors than outdoors, and for them now gaming means using their thumbs and not their feet and hands and running around. So these are small things that can be inculcated into their lifestyle, which will of course reduce the need of supplements. But having said that, supplements are here to stay because our diet is as such very deficient in certain food products, and that is something that will be there to stay. Except that we should not expect that our supplements will replace our food. Let food be your medicine and let your medicine be thy food.
Absolutely. Yep. So I think on that note, we'll wrap up this panel discussion. But time was not enough to discuss more aspects. But I will have Neeti definitely put some takeaways before she leaves. From this program, and always the nutrition takeaways that you want to put forth, and followed by Dr. Prabhulkar, of course.
Rajashi, this was excellent program put together. At least I could encourage and ask and request couple of colleagues to join hands for coming together. Osteoporosis Society of India is going to climb way up. I am sure if we all come together, we will have some good patient outcomes, because we will have some good guidelines which every branch of medicine will and should follow. Thank you very much for inviting us and having this together. Thank you.
Sushrut sir, may I request you to send us the form so that those of us who would like to join the society can, take membership?
Yeah, absolutely. So Nandita knows about it, and once we have this annual conference, we will do this big way. And of course, Dr. Supriya, we will send a form to you. Yes, thank you.
Sure. Thank you, sir. Thank you, sir.
Yes, Dr. Neeti, go ahead.
Yeah, I have a request for Dr. Babulkar. If the nutritionists and the dietetic community also can be part of the society.
You're the backbone.
I've already told them that. I've already insisted on that. We must.
And yes, I think when it comes to bone health, so people at the stage of menopause, there is a lot of awareness about osteoporosis, but the prevention starts way early. So it's the early years of life when the calcium needs to be packed up. Taking a calcium supplement in the menopausal years is not going to undo all the damage. So we as professionals also need to look at the calcium intake of our young teenagers and the women coming to us in 20s and 30s. Thank you.
Awesome. So I think kudos to OSI, the Orthopedic Society of India, and we look forward to doing more such programs together. Sorry, my video was off. So I think thank you each of you for all your insights.
Thank you.
Thank you very much.
Bye.
So with that, we come to, of course, our next very important presentation of the award. And so I take the proud privilege to introduce Dr. Milan Patil, an amazing surgeon, very well respected in Thane, Mumbai, and an amazing human being. So with that, let me give a detailed introduction of Dr. Milan Patil. Dr. Milan Patil is amongst the the five topmost joint replacement surgeons in India, with over 30,000 joint replacement surgeries performed. Practicing in Mumbai since 1996, he does about 1,200 joint replacements annually and has a high success rate and patient satisfaction. After completing his MS Ortho from Mumbai, he moved to UK where he did his fellowship FRCS from University of Glasgow in 1991, FRCS Ortho UK 1994, and MCH Ortho from Liverpool in 1994. He was awarded multiple distinctions, scholarships, and prizes during his academic career. He has gained extensive experience in trauma, sports injuries, primary and revision joint replacement surgeries in India and the UK. He is skilled in primary total joint replacement of hip, knee, shoulder, elbow, and experienced in managing complex fractures, including spinal, acetabular, and pelvic fractures. Featured in Mumbai Top Talks 2013 by Internovation Inc. USA, selected for the third consecutive time in orthopedics. He is featured in the Limca Book of Records 2014 for performing successful total hip replacement on a 15-year-old Nigerian patient, the youngest globally. He has pioneered robotic joint replacement surgery in India, first in Western India and fourth in India to procure the Mako robotic system, performed over 2,500 Mako robotic surgeries, certified proctor trainer for Mako robotics system, authorized to train other surgeons. He has published and presented numerous research papers in international journals. He actively trains young orthopedic surgeons and conducts workshops on total knee replacement. He is routinely invited as faculty for national and international conferences and clinical demonstrations in India and UK. He is regular faculty member of Bombay Orthoplastic course. He has performed live hip and knee surgeries in India, Bangladesh, and ASEAN Pacific countries. This is just a gist of what Dr. Milan Patil is. But to hear from him about wisdom and excellence, because these two words are something he personifies. Though I know he's modest enough to say that I won't, but we're really looking forward to hearing from him about his life journey, about his successes, about his challenges that he had up until here, and also his insights for the forthcoming generations to come. Um, Dr. Milan Patil, it is more than a pleasure to have you here today, and be able to present you the award. But we would definitely want to hear from you. The stage is over to you.
थँक यू व्हेरी मच राजश्री. ऍक्च्युली मराठीमध्ये गदी माडगुळकरांनी असं म्हणलंय की प्रत्यक्षाहून प्रतिमा उत्कट. It has become like that what you portrayed just now is probably much more than what the reality is. I'm really grateful to God that I'm here. It's a blessing of my parents, as you have blessings of your parents and blessings of all the patients, and luck which plays, I mean, recently I remember I read in newspaper that Nadal was given an award in the Hall of Fame in France, where his statement was, that a injury-free long career is really required for this, and I'm lucky to have that. I mean, I couldn't say anything more than that. I'm really honored to be receiving this award, for two reasons. One is it is in the name of a person who always thought out of box, and he really was a legend in his field, and his every year was better than the previous year. I mean, very few people have that kind of a graph of their life. Not just the career, it is the respect from the community, the medical fraternity, his ability to help everyone and also to help the society through various camps. So I always think that to have an award in his name is a great thing for me to remember and take me forward. And also, secondly, for all those people who have, you have bestowed this award on, like people were all my mentors and my teachers and my role models, I would say. People like Dr. La, Dr. Ingarikar, and all those surgeons, Dr. Ram Prabhu. I see their faces in your video, and I felt that these are my role models, and you put me into, put my photo into that league. So thank you very much for that. And I really am very, very happy to see that you are carrying forward the out of box thinking and the real advocacy for prevention of diseases and making the entire society healthy. So I really wish good luck to you for that. Thank you very much.
We want to hear from you now. I think we'll put you on the spotlight.
What do you want to hear now?
Well, we would want to know how up until here, what has your journey been like? I mean, that is something which we are all. I know there are many people here. There are a lot of people in the participants who would want to hear from you.
So I think I'm really happy that, I probably always have felt that I was very lucky to reach where I've reached, and I probably couldn't have imagined that I will reach over here. Frankly, it could be, you can just say that right man at right spot, or you can say that never turn on any opportunity, or, I think whatever comes your way, I mean, if your lemons are thrown at you, make lemonade. A lot of things are there. But I think I'm just happy that, I mean, I was educated in Borivali, in a small Marathi medium school, from where I went to Ruparel College, and then I went to Nair. I did my MS Ortho. I mean, then I went to England. When I came back, I was looking for jobs, and I suddenly felt that Shikhande Hospital was a place where I got a place to stay and also, a job. But then the hospital didn't go forward, so I started my practice, and I think that everybody whom I came across really loved me and helped me. I cannot really say that there's anybody who didn't help me. So I'm very happy, for that. I'm really grateful to God for that. That where I've reached is could be, just the right man at right spot, or it could be just the luck. But I think, there is probably kind of story to every person. I'm sure that everybody sitting here and listening here has a fantastic story of his life. And all of us are running a race where I think we are trying to make our today better than yesterday, or tomorrow better than today, not to compare me with you or you with somebody else. So that, I think that's what one should do. I mean, each one of us is running a race and trying to make that, with be as good as possible, do as good as possible, and try and make your today better than yesterday.
We had earlier Dr. Bandupala receiving the award, and he said something similar to what you're saying. And he said that everyone can achieve. He said maybe not wisdom, but everyone can work towards excellence. So everyone can sort of work towards it. The other thing also I would like to ask you is, when I know from so many people in Thane, what is that secret behind, having so many satisfied customers, because, or rather patients, where, patients are in pain, and when it comes to knee surgeries especially, they're very apprehensive, and after their surgeries are done, it takes some time till they're completely gone back to their routine. So how do you achieve this? And, every second person, if they're thinking, in Thane, at least if they're thinking of doing a knee replacement, I know they're coming to you. So, what's your philosophy? I know there's no secret. There's some very strong philosophy behind it.
Well, I think you caught me on that now. I don't really think that, as you rightly said, that when Dr. Bandupala said everybody can achieve, I'll go ahead and say that everybody has achieved in his own way. I don't think anybody is behind in this world. I would say I'm very lucky to have this love and affection from patients. I'm very lucky that everything when the robot was a big thing for me. I mean, Marathi jala पण शिवधनुष्य म्हणतो ते होतं माझ्याकरता. And it has worked very well. So from that point of view, I think I'm very grateful to God that where I've reached, frankly. And it's not just that we working. I think everything works with us. Everybody works with us. So very lucky for that. Really help from the God, the nature, or whatever you may say. I'm very happy for that.
Also, sir, you've actually you have so many fellowships, training experience abroad in UK. In those days, going there and getting educated. Of course, one thing coming from a middle class background, then going to UK. One part is, of course, expenses, going to a completely different country and learning, and then coming back. What was that experience? And what would you actually tell the next generation? Because, right now, probably the Gen Z, I would call them, are completely, they're confused what they should be doing. For them, all these avenues are open. So how was it back then? And what do you think, would be your advice to the forthcoming generations?
See, I think when I went to UK at that time, there was a lacune in Indian training, especially the high-end surgeries like joint replacement surgery or major trauma surgeries, which required a lot of cost. And luckily today, that much of lacune is not there because there are many people like me who have come back from abroad and have changed the surgical scenario in India, and probably we are not very behind as compared to many countries. But yes, I think I think going to different countries, trying to see their way of thinking, their school of thought is very important. I think it's important that all of us should see various aspects of a particular disease, how it is taught. I mean, luckily, as you rightly said, that I went to England partly because it was possible in those days to get a job directly, which was paying you. So the cost of going and staying there was not there for like years. It was just for maybe a month, and then you are going to have a salary. So that way, I think I was very lucky on that aspect that I went on a proper job. The second important thing is probably working there gave me a different outlook to the practice, how you behave with the patient. Quite often, in government hospitals here, there's a different way of thinking. In a private hospital, different way of thinking. And in UK, there's a different way of thinking. So that the various, they shape your personality. You look at various people, how they behave. I think there's something to teach by everyone. And then while coming back, I mean, if you ask me frankly, when I went back, although there's an opportunity to stay back, I mean, people like Talwalkar, Lad, Chaubar, whom I had thought like they are my role models. I wanted to be like Lad, like Chaubar, like Gangarekar, like Talwalkar. So that's the reason I came back, frankly. And to some extent, it has probably worked that way. I'm very happy for that.
Well, I can resonate. That resonates with me because that's what I did in my career as well. That I got that exposure and chose to come back. Looking at people like my father and looking at so many of you all doing great work here. So that's absolutely rightly put. But since you mentioned Dr. Lad, uh, of course he's received this award before, and he very rightly aptly put at that time saying that I'm first an orthopedician and then I'm specialist of anything. I see that in your case as well because you're specialized in so many different aspects of orthopedics. How important is that?
See, I think it's very important that, means as an orthopedic surgeon, even today, I see there are some opportunities some people get where immediately they specialize into a small niche kind of thing. That may work well for a very small percentage of people. But first, you should have a broader outlook. It is not necessary that you're master of all things, but you should first become jack of all trades and then become master of one. That becomes very important because a patient is not just going to have a knee osteoarthritis. Like, for example, I'm a total knee surgeon. I mean, I need to know that whether the patient has some other disease also, whether he's got back pain also, whether his back is giving him more trouble or the hip is giving, or maybe he doesn't require replacement, he requires some supplement. So these things are important that I need to know other aspects of patient health. So I think specialization is very, very important, but one should do it as an icing on the cake. It is not the cake itself, you know. So
One more question. I'm sorry, I'm trying to,
no problem. Yeah.
I am trying to get the insights from you because, I think asking questions is a good way to do that. There are, in today's scenario, there's so much of corporate culture in healthcare. Having said that, it's very difficult to run your own setup, and you are very relentlessly doing it. And, so what's the advice here again, How can one, relentlessly do that, stay focused? What are those skills that you need apart from, of course, your surgical skills? What is that one should have to be able to run their own organization with conviction?
Yeah, I think looking at it again, going back to what I said to begin with, that say my role models, Dr. Lard or
Yes.
Dr. Ingalerikar or Dr. Tarwakar, they all had their own setup. And quite often, there are certain things which you want them your way. And if you want them your way, then I think perhaps having your own setup becomes important. At the same time, as we know, as we spoke just now, that patient is not having just one problem, he could be having other problems also. So you need to be open to working in both the places. I mean, there are certain advantages of being in corporate. There are certain advantages of having your own setup.
Yes.
I mean, there is no,
Yes.
you can't really
Yes.
win either side. So, but
Yes.
you need, perhaps, I think, if you are lucky enough, you can have a good balance of both the worlds. Have your own setup as well. I mean, as you said, that medical field is an individual game also like tennis, or it's a team game also like cricket.
Yes.
So you need to have probably a skill for both.
Yeah.
I mean, if you're just individual, then you can never survive in corporate, because you need to accommodate other people's point of view as well. But if you still want to protect your point of view, you require your place as well. So I think it is important that you can have your own place. Probably the scenarios keep on changing, and as I'm seeing now, that individual doctors have become corporates now. Like I mean, Sri Sancheti, Dr. Babulkar, who was here just now. I mean, his father was an individual doctor. He became a
Yes.
corporate. So I think there are individual doctors getting corporate as well
Yes.
now.
Yes.
So I think it is, I think it's the way what you want, what you want out of life. Yeah.
Yes. So I think that was amazing to hear all this from you, and I'm sure you have so many students and so many orthopedics who look up to you. So I think this is going to be a very insightful talk for them. Lastly, since you're here, I just want to and this is there's also an integrative nutrition and health summit along with this. What are your thoughts when it comes to integration of treatments, therapies, nutrition?
I think it's very important. I think if you probably, I'm seeing one of the sponsors lower down, that CalPal. CalPal is, is they माझे अन्नपूर्णा आहेत. They are, almost always have the lunch and dinner from them. So I feel that nutrition is most important part of life.
Yeah.
I mean, if you are not, I think diet comes before exercise. Mind and body. In that, mind is you really control your mind. But in body control, diet is before exercise actually. For a person who's completely office job and sedentary job, for him exercise is important. But for an active person who's going to office, going to the railway station, catching a train, standing in the train, going down to the getting up from his table, going to the canteen. So for such people, some activity is always there in the day. But where they go wrong is the diet, I think. So I mean, I'm seeing here that CalPal is one of the sponsors. So they are my feeders. Every day I eat their lunch and dinner. So diet is very important. Nutrition is very important. Yeah.
CalPal is actually maybe not our sponsor, but our partner definitely,
Oh,
because
doesn't matter. I will see the name. Yeah.
no, because we can't survive without Mrudula. But
Yeah.
to mention her, right? So I think she's amazing, being a doctor herself. She runs this setup, and we have been designing food meals together at times. We have so many chats as to how we could make meals healthy at the same time, interesting to eat. People don't get bored of it, so it's amazing. So thank you so much for being here.
My
We're going to
pleasure.
now present you the award virtually, and I will of course come and present that to you in person. So bear with us for a minute. Yeah. Dr. Bhatkande, Dr. Rekha Bhatkande, if you can join in, ma'am. Yeah, it will be a pleasure. Dr. Bhatkande, ma'am, has been, she's ex-dean. She's been dean for many years with Sushrusha Hospital, as you mentioned, Dr.
Hello.
Yeah. And
Hello,
she,
Milan, and congratulations. You've been
Thank you very
been
much.
a great, and you're a pioneer. Remember that, You brought robotic joint replacement surgery to India, think
Thank you very
that's
much.
wonderful.
Thank you. Thank you very much.
Thank you so much
Thank
for
you.
being here with us. And we've taken a virtual pick of this, but I will come and see you in person, sir.
Thank you. Thank you very much.
Thank you.
Thank you. Thank you.
So we'll move forward to the next presentation. Now, this presentation is by Mr. Kushal Kamath. And again, we've spoken so much about vitamin D in our earlier, I think since our first panel discussion, vitamin D3 has been a topic of discussion. So I think it's apt that we should have a more detailed understanding of this topic, because normally what happens is we all think um, earlier we thought it was calcium, then we now know it is vitamin D, then we suddenly know that it's vitamin D3, then it's vitamin D2. So it's best to understand this from the technical experts who have been involved in the research and been involved in promoting vitamin D3 actively. So it's a pleasure to have Kushal Kamath here with us. He's General Manager Marketing and Business Development with the Fermenta Biotech Limited FBL team. And I'm sure he's going to bust a lot of myths and give us a lot of scientific facts as he's been working with the Asia Pac APIs, vitamins, nutritional ingredients, customized premixes, and food fortification business. And he's also been involved in market expansion and growth strategy across the APAC region. So really over to you, Kushal Kamath, to hear all
Namaste,
those.
everyone. Thank you, ma'am. Thank you. First of all, I would like to thank the organizers and everyone, especially you, for giving the opportunity. It's been wonderful to be amongst all of you. I was here for quite some time listening to all the stewards here, Mr. Bandupala and many other panelists as well. I had the pleasure of working with Mr. Bandupala for more than 8 years, and listening him was absolute insightful pleasure. I'm sure it takes me back to the memories, because some of the work that I have done with him is in terms of vitamin D. And of course, along with him was Dr. Malarkar as well. And again, it's a pleasure to be amongst all of you. In fact, it's the evening time. I was going to say good evening and then started with my namaste, because the sun is just about to set. And then I'm given a topic which is which in fact is a thing that many of us see every day. Probably know, many of us probably follow, not follow, but it's there, and that's about sunshine vitamin, as you rightly said. If you may allow me, I'll just take a short moment to share my screen. Yeah, just wanted to know, is my screen visible to all?
Yes.
Thank you once again. Before I begin, I think it's right for me to quote Joseph Joubert. He once said, "It's better to debate a question without settling it than to settle a question without debating it." My topic for today is vitamin D. Is there a need of difference for efficiency? And I hope in the next 5 to 7 minutes, probably 5 to 7 minutes is what I'll try to wrap it up short. I'm able to seed a thought of debate in all of our minds, that when it comes to vitamin D, that when one talks about vitamin D, is it the right choice that would make the difference? And would the choice make a difference that would lead to change? In fact, it's been more than 100 years of this remarkable discovery, and this magnificent vitamin continues to fascinate everyone, may it be the researchers to the scientific community. in our everyday life. In fact, while the genesis of the molecule happened in around 1600, just about a couple of years back, I think so in 2022, we celebrated the centenary of this remarkable discovery. It was the discovery in 2022, 100 years completion of the discovery of vitamin D via cod liver oil to treat or cure rickets. That was done by Dame, a scientist called Dame. But I think we all owe it to the man in the slide, Elmer McCollum. He is a renowned biochemist and a nutritionist who is known for his work, diet on health, again having a D factor. He was the one, when the early research of vitamin D was going on, identified that in the cod liver oil, it is not vitamin A which actually has the anti-ricketic properties, but it's a new nutrient. It's a nutrient other than vitamin A which has these properties. And he gave the nomenclature to this vitamin, which is vitamin D. He named vitamin D as it has it today. In fact, the rest of the decade was much more remarkable, because in mid 70s, I think, there was a discovery of vitamin D receptors all across human body, and that significantly changed the outlook of researchers as well as medical fraternity from the skeletal benefits of vitamin D3 to what we now know as the extraskeletal benefits of vitamin D3. So may it be in the form of support to the immune system, support in the chronic illnesses, mood elevation, and many more. In fact, while it is a vitamin, and I say it always that it's the only vitamin which is mentioned in notable textbooks like Goodman and Gilman, and they want to declassify that vitamin and name it as a hormone rather, because of its profound benefits on health. When we talk about vitamin D usage in general population, the spectrum and choice of vitamin D goes across various applications, may it be the pharmaceuticals, the food and beverages, dietary supplements, and nutraceuticals. Of course, as this topic has been touched in the previous panel as well, very insightful thoughts coming in there as well, which I made a note of. When you talk about vitamin D, we basically have two forms. One is the vitamin D3, which is cholecalciferol, and the other is vitamin D2, which is ergocalciferol. While everyone is aware about it, it is important to note whether both are same, both are slightly different, as they say, or they are actually different. And I think when we dwell into science, it notes that the metabolic fate in the human body of this vitamin D gives the answer to it. Both vitamin D3 and vitamin D2 in human body is converted into their respective metabolites. And while anyone who would generally view metabolism of vitamin D in a quick search in Google will always see these popular terms of calcidiol and calcitriol, it is important for us to note that these commonly known nomenclatures are actually the metabolites of vitamin D3, which is cholecalciferol, and not D2. D2 has its own respective metabolites that are produced in the body. Again, D2 comes in from food, majorly from mushrooms and yeast primarily, but its action is similar to D3, but it's found to be much weaker in capacity and potency as compared to D3. Today, there is ample evidence that distinguishes that vitamin D3 is much better, is much more efficacious as compared to D3. D2, it's found to be 87% more potent as compared to D2. And it's also the rise in vitamin D3 levels after D2 and D3 supplementation has been steady. And it's been shown and accepted that vitamin D3 produces much higher levels of vitamin D levels as compared to D2. Like I said, while everyone sees the sunshine, the sun is one of the most prominent source of vitamin D. And when we expose ourselves to vitamin D3, when we expose ourselves to sun, the form that is produced in the body endogenously is actually D3, cholecalciferol, and it's not D2. So D3 is the most natural form of vitamin D3 that one can get, and it's also has known to have a longer half-life as compared to D2. That helps it translate much better benefits in human health as compared to D2. It would not be right for me to say that vitamin D, with more than 100 years being in existence, no work has been done in terms of deficiency. There is a lot of work that has been done in terms of treating and making people aware about vitamin deficiency. It's a wheeled pandemic, as I always say. But India is a humongous population. I think all of us will agree we are now #1 in terms of population. It's been said that every year, every day, India gives rise to one Australia, and that's the level of people that we are adding to our pool. When we talk about vitamin D3 deficiency, a lot of progress has happened in terms of that, but it still persists. In fact, just about a couple of months back, the Apollo Hospital released the Health of Nation 2025 report, and it specifically mentions vitamin D amongst all vitamin deficiency, vitamin D as a staggering figure still prevalent in Indian population. This in fact is an indication probably that while vitamin D awareness and treatment has increased generally over the last decade, is there something more that needs to be thought about? And I think it's the choice of vitamin D that is adding to this fact. Vitamin D3 remains one of the most, when we compare D3 with D2, of course, and I'm a strong believer that science channels the good health, and therefore vitamin D3 is the only form which is clinically most studied among the two forms, may it be in every indications that we know today. There has been consistent evidence that D3 is more potent, better, more bioavailable than D2. And this not only translates in terms of the health benefits, but in terms of the larger population when it comes through nutrition, supplementation, and food fortification as well. In fact, I was just reading a recent report again from Pune University. The Jahangir Institute there, researchers from there have conducted a recent study to see the impact of vitamin D fortified food on vitamin D concentration. It was a community-based study that was carried out in more than 100 families in Pune. And the average consumption, I think, was around 200 IU per day. And what they found out at the end was that the current levels that are incorporated for the larger population, may it be in terms of supplementation or food fortification, are ineffective in coming out of vitamin D deficiency. There are two. I can say there are two roads to it. We can take an example of a destination having two highways and two highways going to the same destination. One is the old bumpy road with nothing really up to date, whereas one is a new highway which has much more researched technology used into it, much more refined, much more real-time evidence to it. Both of them lead to the same destination, but the old one has done its part, and it's time for us to change to the new one. I think vitamin D, when we talk about vitamin D as a molecule, it's equally important when we talk about deficiency, when we talk about the amount that is consumed. It's equally important that we talk about the form or the choice of vitamin D that is consumed by the consumers as well, and that is vitamin D3. I think on a closing note, I will like to quote once again that history has been the best guide to future. I think one of the biggest example that I can give to all of you is of an example of goiter that was done in association with the medical fraternity along with the government of India at that time. I remember in 1940s, goiters was something which was an unimaginable disease. No one knew about it. It was seen in the hilly regions, particularly in the Himalayan regions more prevalently, and everyone blamed it onto hereditary or a cause that was unknown. Of course, over science and research, it was known that it is basically because of the iodine deficiency. And then hand in hand with the government of India and medical fraternity, there were programs that were especially launched, the salt iodized programs that were launched in 60s and 70s that took place in in 80s, somewhere around in 80s, the NID program came in, the National Iodine Prevention Control Program, which was a universal program to help the larger population move out of goiter. And in 19s and 2000, I think the government converted into a legislation. Why I give this example of history is because the result of this awareness program was the fact that today more than 90% of our population in India is aware that goiter is caused due to iodine deficiency. I think you all will agree that someone will not try something unless he knows it. And but when the light of awareness falls onto him, the right choice becomes the only choice. I think while addressing the D gap in deficiency and supplementation or fortification that's happening on a larger scale for the larger population in India, while the levels and the amount is equally important, it's also equally important to choose the right choice, which is vitamin D3. I think that is the need of the hour to push India out of vitamin D deficiency. Thank you once again, all of you. I think I'll come back to ma'am. I just stop sharing my screen.
I would like to thank the entire FBL team for actually, supporting this event. I think once you stop sharing, you try to stop with it. Yeah.
Thank you, ma'am.
Yeah. So, it is a pleasure to have, to associate with your entire team, with Prashant Nagreji. Incidentally, he shares his birthday with my father. So, yesterday was his birthday. and with you, with Sahil. So, it's amazing to interact with you because the kind of in-depth work, especially Fermenter Biotech has been doing for years together, being one of the pioneers, being exclusively working on vitamin D3 for so long. So it's really insightful, presentation. I learned so much out of it. So, we keep doing in-depth research, and we look forward to doing more such research and more such in-depth work with you, and also, of course, spreading awareness as much as we can. So thanks for being with us, and we're looking forward to doing more.
Absolutely. Thank you, ma'am. Pleasure once again. Thank you.
Yeah.
Thank you.
So with that, I think, more is yet to come. And the next panel discussion is again something which is very close to my heart, because I really believe that gut is at the core of everything. Gut-brain axis, also gut feeling, all of those aspects. And two great panelists that we have here with us, and I'm also going to take the privilege now to introduce Dr. Rekha Bhatkande, she having been working in the field of gastroenterology, and look at the she's trained in gastroenterology from JJ Group of Hospitals, hospital management, which she did in 2004 from the Symbiosis International University, years after finishing her MD General Medicine in 1976 from GMC College. And then see the amount of positions she holds in public health. So, she's president, and vice president, member of endless society, and the kind of relentless work she has. She's not just doing it now, she's been doing it for decades. She's also been the ex-dean with Sushruta Hospital, which is also an hospital which has been working for the middle class fraternity, for the ones who don't have easy access to great healthcare, and to provide that, and who are running the hospital administratively, also focusing on gastroenterology. So it is always a proud privilege to have her with us. And so with that, the next speaker for today is Dr. Sharad Deshmukh. He's consultant gastroenterologist and director at Medilive Hospital, Nashik. He's MD, DNB Gastroenterology and Hepatology from Apollo Hospital, Chennai, liver transplant hepatology course at Vedanta Hospital, acquired training in pediatric gastroenterology at CGPGI, that is Sanjay Gandhi Postgraduate Institute from Lucknow. He's acquired training in ERCP, US, and advanced endoscopy at Bardota Institute of Gastroenterology, Mumbai, and at Tata Memorial Hospital, Mumbai. Dr. Sharad Deshmukh is a consultant gastroenterologist and hepatologist, like I mentioned, in Nashik, at several centers, and he has a vast experience, having performed 10,000 diagnostic and therapeutic upper GI endoscopies and over 5,000 diagnostic therapeutic colonoscopies, and that's why it's going to be really insightful to hear from him, as he's also worked as a consultant with the Tata Memorial Hospital, Wokhart Hospital, Nashik. The next speaker, of course, is also Dr. Amol Vadgaonkar. He's MBBS followed by DNB in General Medicine and DNB in Medical Gastroenterology. He's completed a fellowship in Advanced Endoscopy, enhancing expertise in therapeutic procedures. He's consultant gastroenterologist Nanavati Max Hospital, Mumbai, ex-consultant medical gastroenterology at the Sir H.N. Reliance Foundation Hospital and Research Center, Mumbai, proficient in advanced diagnostic and therapeutic procedures, colonoscopy, endoscopic retrograde, and ERCP, esophageal manometry, and complex endoscopic interventions. He's recognized by the Navbharat Times for his consumer-friendly commentary on GI conditions and wellness. So a warm welcome to Dr. Amol Vadgaonkar to be a part of this panel discussion. And of course, Dr. Ruchir Lavate. He's MBBS from Bharati Hospital, Pune, post-graduation in clinical nutrition from IGMPI Institute, New Delhi, and fellowship in industrial health from Lokmanya Hospital, Pimpri. Worked on board the nutrition team at Valadictory Hospital, Devan, devised nutrient-rich foods using local ingredients for pregnant women and adolescent children. He has a passion for nutrition owing to a love of food and cooking combined with medical education. He currently does his own private practice in Pune. He specializes in metabolic health, weight management, lifestyle-related diseases, and gut health. He's actively involved in patient education, preventive health strategies, and regularly collaborates with medical professionals on integrative care models. It's a pleasure always to work with Ruchir and have him also on the panel. So with that, I am going to quickly have all of them on the screen and going to jump into the questions as we still catching up on the and I'm far behind when it comes to our timelines actually. Dr. Amol Vadgaonkar, it's a pleasure to have you here. You've been actually working in different gut conditions, including the IBS and general indigestion. So what are the sort of medical treatments and procedures that you normally rely on? Especially when there is so much of increase in these gastrointestinal issues that we face, and do you actually adopt an integrative approach, which includes integrating multiple different doctors as well as nutrition in improving the healthcare outcomes?
So, am I audible?
Yes.
Yeah. So, at the outset, I would like to thank True Wealth and organizers for giving me this opportunity. And this is an excellent initiative. I'm first time I've joined this initiative. So, as a clinician, when we deal with the patient, there are a lot of patients which come with different symptoms, and most common symptoms which they do come to our OPDs is dyspepsia, sometimes bloating, sometimes abdominal pain. So generally, when you see such kind of symptoms, you have to see whether if we are dealing with a upper GI pathology or a lower GI pathology, and accordingly you have to tailor down the approach. So whenever the patient, most of these patients of the so-called irritable bowel syndrome may have different syndromes, or you can call it as a subset of patients where only they may be involved with the upper GI. So sometimes you may do an upper GI endoscopy in those patients who come with a acid peptic disease, or sometimes reflux, regurgitation, and uh, an upper GI endoscopy helps to uh, see how is the mucosa, how is the stomach mucosa, whether you have a gastritis or you have sometimes H. pylori infection, and likewise also if the patient is having diarrhea. So also you have to see, sometimes we do an colonoscopy to see whether the mucosa or the internal lining of the colonic mucosa is proper. So sometimes it depends upon the patient symptoms, how he present to us. And also there's a lot of role of nutrition, I would say, because most of the Indian patients who come to our OPDs sometimes have an history of outside food. Sometimes they have sometimes outside food, some spices, which precipitates these diseases. And so we have to educate them how to sort of have a nutritional approach along with medications, because medications are for some time period, but if they change lifestyle properly, then I think the symptoms will get under control for maybe a longer time. So it is a holistic approach. It is a holistic approach. And now the gut microbiome, which is a new kid on the block, which is also which is very related to the irritable bowel syndrome. So we have to educate the patient about the gut microbiome. There's lot of because there are trillions of bacteria which are living in the human body, and they generally live in harmony. So sometimes if there is some imbalance, sometimes there is increase in bad bacteria and there is a decrease in good bacteria population, then also there will be indigestion. Patient may present with bloating, there may be dyspepsia, excessive flatulence, sometimes there may be diarrhea. So we have to also educate our patients that along with the nutrition, vegetables, usually a Mediterranean diets, which have a lot of probiotics in it, are also important, and also including fiber in the diet. Very important, because fiber helps in reducing bloating. It helps in aids in digestion. It also aids as a probiotic. So I would suggest, we should educate our patients that they have to take certain probiotics in the form of curd, buttermilk in the diet, along with vegetables. So yeah, so I think these are the few points I would like to suggest.
I think it was a complete holistic response to, really someone, if someone's listening to it, will understand the crux of A to Z, I would say, really. So really appreciate you sharing this because you also shared what is needed, but also how challenging it is with patients and how the integration is important. Having said that, I think also when it comes to more complicated diseases, Dr. Sharad Deshmukh, when it comes to more complex conditions like, NFLD that you normally face, or, if there is IBD in those kind of patients, what are the advanced procedures you are currently conducting? And, how much also do you believe integration and also diet and gut focused care is more important in those kind of critical conditions?
Basically, as we all know that in today's era, the cases of NFLD and inflammatory bowel disease are on rise. We see many cases. So, in practice, at our center, for specifically for fatty liver disease, we do liver fibroscan, where we see the fibrosis status of the liver, and we also see the fat quantification by CAP score. So we do in many in patients as a screening tool and also as a tool which help us to monitor the progress of the fibrosis and fat quantification. Apart from that, in IBD patients, we do colonoscopy with FICE technology. Basically, we use Fugiscope, so that will help us to detect the early dysplasia and any malignancy in such patients. And also, there are a few things like MR elastography for some patients. If we in some patients of NFLD for fat quantification and fibrosis, and also in few cases, capsule endoscopy for early diagnosis of Crohn's disease and all these things is useful.
That's really great because this is another fibroscan is another new people think it's a new thing on the block, so it's difficult to understand, and I'm glad you explained that in gist to us, and I think more needs to be shared on this front. We need to do more programs on these lines, and I guess even Dr. Amol, you can throw light on more different procedures when we conduct more extensive sessions on these conditions. Having said that, Dr. Roche, this is again a topic very much of your and my interest as well. But in your experience, there's so much talked about processed foods, skipped meals, high sugar diets, and even then, the e-commerce based meal ordering at home is the norms. What are the essentially the food habits that you see are making gut health really worse? Because even Dr. Amol mentioned that with his patients, with especially Indian patients, he's seeing these kind of issues.
Good evening, everyone. First of all, thank you for inviting me to be a part of such an interesting and informative talk. I'm happy to be here. Regarding this question on how the processed foods generally affect gut health in general, I'd like to start off by saying we need to understand that processing is processing happens in almost all food products that we eat, and there was actually a very interesting classification called NOVA classification, which classified the levels of processing that food undergoes into 4 stages. So, according to that, the ultra processed foods, which is the fourth category, is the one that is most problematic, which when it comes to exacerbation of gut disease in general. These are the foods, to clarify a bit further, which contain substances far removed from their natural state, basically. So, not a lot of fresh fruit, for example, if you take an orange cream biscuit, there is little to no of orange in it. And a lot of emulsifiers, stabilizers, preservatives, etc. And these specific additives are what cause problems. So, to put it more into perspective, for example, there was a trial called an ADAPT trial, which highlighted the significance of a low emulsifier diet in Crohn's patients. So when the patients were given a low emulsifier diet, the emulsifiers specifically being things like soy lecithin, carboxymethyl cellulose, which is written on the back of the packets, they showed remarkable improvement in their symptoms within 3 weeks. So a lot of them, emulsifiers, sweeteners, artificial sweeteners, colors, these work by increasing gut permeability, altering the gut flora, increasing populations of E. coli, etc. And this in turn leads to exacerbation of existing health conditions. And also, I would like to say, generally, all the things happen as part of a spectrum. A person who has a very stress-prone, sedentary lifestyle is also likely to be the one who eats ultra-processed foods, drinks, smokes, etc. It's very unlikely that someone eats very clean and yet is having a high stress job, etc. It does happen, but rare. So the constellation of the whole thing affects their health in general and leads to disease.
And then essentially what happens is we have to go, the pendulum shifts from having processed and junk foods to going and having supplements. And then that is the time there is realization that, oh no, we shouldn't be having supplements. They'll probably affect our kidney, not trying to understand that what junk foods are doing to them. So, I think then they have to take the supplements as medicine. So, that's what happens. But on that front, I mean, yes.
Can I add one more point?
Yes, of course.
So one more thing, as Dr. Ruchir also mentioned, that I would like to just make it a point that we should also educate our patient what are anti-inflammatory foods and what are inflammatory foods, because they should know. Because anti-inflammatory foods, have vegetables, fruits, dry fruits, almonds, walnuts. These are all anti-inflammatory foods. As far as inflammatory foods are, whatever junk food which we get, what we order from outside, whatever it is, like burger, pizza, or deep fried foods, or this all ultra processed foods. These are all inflammatory foods. So they increase stress in your body, and these are certain risk factors for any long-term inflammatory bowel disease to develop. That's why we are seeing lot of young patients, even middle-aged group patients, developing ulcerative colitis, Crohn's disease, because of these ultra-processed foods, which are causing immunomodulation, increasing gut permeability, and gut dysbiosis.
I'm glad you brought that up, especially about the inflammation and the inflammatory foods. It is such an important point. I mean, can't stop. I mean, we should probably have a session on this. There can be an entire session really on it, isn't it, Dr. Ruchir? We should conduct one on this. So, I mean, having a balance. So I keep, whenever I do my presentations, I talk about balanced plate, but I also talk about balancing alkaline and acidic foods. So, how you can sort of bring the pH to normal. And then also about the inflammatory foods, high fat content, and, food when it stays undigested, the inflammation that causes havoc for the entire body. So having added that, I think one more question to Dr. Ruchir and Dr. Amol and both of you. I mean, Dr. Ruchir, then we always keep talking about these balanced diets on one side, and also complementing it with protein supplements, which are more, designed well, which are more, say, comprehensive, which will have the right amount of vitamin, minerals, proteins, and also probably looking at digestive enzymes, which I actively use in my practice, because I see that it can address the digestion issue to a great extent. So even the probiotics can then be more effective. So going back to my question to you, really is what's your take on these different types of supplements that are there?
Supplements definitely have a role in improving general nutritional status. And the thing is they all have their place. Like for example, if we were to speak of protein, the majority of Indian population, like we all know, is deficient in protein to a great degree due to various factors. Protein supplementation, according to the ICMR actually has published an eating guideline in 2024, which, since you mentioned eating plate, they have shown that plate. They've provided quite comprehensive guidelines uh, for healthy individuals. But protein supplementation in liver disease, gut disease, yes, it definitely does have a role because they are also deficient in other vitamins and minerals generally. As regards to fiber is very important. In my practice, I have seen that fiber usually is not lacking when it comes to Indian diet. Uh, People do make it up. People generally being a primarily plant-based diet for most Indians, protein more or less, unless the person is eating way off the charts in terms of processed foods, they do eat healthy. In regards to enzymes, even I have seen a lot of improvement in patients, especially when it comes to bloating, etc. FODMAP sensitive individuals, if you give them a FODMAP targeted enzyme supplement or lactase supplementation for lactose intolerant people, etc., it does help in the bloating and
Yes.
indigestion symptoms that they usually face.
Okay.
One more thing, I think
Well,
branch and amino acids and plant-based proteins are easy. It's good option for all
yes,
cirrhotics with
yes.
hepatic encephalopathy. Yeah.
Yes. Any other insights also, Dr. Deshmukh, because these are because from your procedural standpoints and with your critical patients, is there any other supplements? Again, supplements have gained this negative connotation with it, but when it comes to supplements which are well designed for therapy, they should be evaluated well, and patients should actually consult the doctor well and then go forward taking them. So, do not take supplements because they claim so many different things. So I think that's why these experts are here to guide you in the right direction. So, Dr. Deshmukh, your insights, any other insights on that? Please.
Basically, in cirrhotic patients, as we all know that their calorie requirement increases. And many times, even I saw few dietitian, they tell them that avoid oily food and avoid all these protein-rich foods. But as since their deficit, their calorie requirement and protein requirement is not getting fulfilled in Indian diet, we should ask them to take adequate calories, which are more the calorie rich source is fat basically, and Indian diet doesn't provide them adequate proteins also. So this protein supplement, which contains branch and amino acids, is useful. And third thing is, as we know that they should have small frequent feeds also, and bedtime snacks is also should be advised to these patients, so that there should be less muscle wasting and their overall health improves.
That's a very, very important input that you've made, because this is the most challenging spot when it comes to giving protein, and at the same time, you have to give it restricted and give it in the right time. And to your point also, Dr. Amol, where you mentioned inflammation, proteins can actually even are acidic in nature, so they can cause more inflammation if they're not digested well. This is where I try to supplement it with enzymes so that the digestion is better and
Yeah,
uptake is.
one point about protein supplements I wanted to add that because there are a lot of protein supplements nowadays which are marketed.
Yeah.
So most of them are whey concentrates. Sometimes they are whey isolates also. But those protein supplements which contains creatine should be not taken usually because they are more harmful. Secondly, patients who start taking protein supplements for building the immunity or improving the protein albumin inside the body, So those patients should start slowly. They should gradually start with minimal quantity first, see how they adjust, because sometimes the patients, they do tend to start over enthusiastically. They take 2 3 scoops in a day, because one scoop of protein powder, it itself contains 20 grams or 30 grams of protein. So sometimes they do can get diarrhea, bloating, because of these protein powders also. So that's why it should be initially started slowly. And as the patient adapts to these protein powders, then gradually the quantity should be increased. That actually I wanted to make a point, because these sometimes this is should be a right approach. Slowly you start and then build it up.
Also, sustained release proteins can help so that they gradually digest, and
Yeah.
that way there's a better approach. So also,
Correct.
I think that's why taking the right suggestion. And I think Dr. Ruchir wants to add to it. Dr. Ruchir, we'll have to close this panel, so please make your input and also your closing remarks, takeaways for the audience, please.
Yes, I'd just like to add that for the protein supplementation specifically, the big question is affordability also, since a lot of the supplements are not affordable on the long term, and liver disease patients especially need to take the proteins for a long term. I always recommend, what I do is basically I use a combination of food sources and protein sources. If they're non-vegetarians, very easy, egg whites is the way to go. And the highest protein meal, I usually recommend that they eat it in the late evening, as is advised, and for liver disease. And the throughout the day, the protein that can be incorporated in the meal times will come either through milk, skimmed milk powder, or egg whites. Because a lot of the commercials formulations also do have skim milk powder as a source of protein. And it's 30% of protein actually. So that is something, it's very affordable also. So I do recommend. Closing remarks, I would like to just say that a balanced diet for whether people are diseased or just want to improve their health in general. Uh, Avoiding ultra processed foods and sticking to a whole food diet, a Indo-Mediterranean combination diet as far as possible is the way to go.
Sorry. So, Dr. Deshmukh and Dr. Vardhakar, your 1 minute takeaways for the audience here.
Yeah. Yes. Basically, as Ruchi said, we can. I usually ask these patients to include soybean in their diet. Means when they prepare a flour, means they can combine with the wheat some quantity of soybean, and they can use that atta for the chapatis. So that will automatically give them high protein. And second thing is, as we all know, for NFLD, basically it's lifestyle, weight reduction, avoid junk food, and avoid processed food, and low fructose and low fat diet, that is, and high protein diet is useful.
Dr. Vardhakar, your
Yeah.
closing.
So I would suggest that usually our patients who have GI disorders, they should have small frequent meals. Then they should include more of vegetables in their diet, and also along with that maybe a curd or buttermilk to add for probiotics. Secondly, exercise is important, at least 20 to 30 minutes daily, so that it also helps for the gut metabolism. And sleep is also important. So I would suggest for to have an adequate sleep, at least 7 hours, 6 to 7 hours of sleep. And whenever you have a little alarming symptoms, whenever you have you have weight loss, or you have nausea, or sometimes there is sudden constipation, or there is sudden diarrhea. So these symptoms are little alarming symptoms. Sometimes you have blood in stools, or you have vomiting. These are alarming symptoms, and you should consult your gastroenterologist or a physician uh, so nearby, and get addressed these issues.
So I think this is just the beginning that we're having these panel discussions. I think we've got to have more of these discussions coming forth in the coming year. Dr. Amulya, welcome to our panel discussions. Dr. Deshmukh and Dr. Ruchir have been a part of this, so I think we'll keep having more. And thank you very much for being there. I would request you all to be around, because we are going to felicitate actually Dr. Jayan Burve now. So we would want you to be around. Before the award presentation, I actually want to remember someone who's been extremely special. So remembering this genius again. He has been visionary, generations beyond, I would say. Just as my father is what I would uh, resonate with him as a second father. We just lost him last year. And a rare gem, rarest gem, a rare uh, surgeon, a rare human. Um, People who have known him would know all these qualities of him. Um, I have been taking his legacy forward, and wisdom forward now. It is their legacy that has to be taken forward. Dr. B.N. Shikhande, being such a great surgeon, so renowned, was extremely down to earth, and was absolutely a mentor to me. Through my difficult beginnings when I lost my father, he and Dr. Lele had did handhold me, and whenever I made mistakes, they were there to tell me, guide me, and at the same time appreciate whatever I was doing. Most of our wisdom and excellence programs, they would be there. He would be there. Dr. Shikhande would be there for every single program, and the valedictory would be done by him. Through laying the foundation of the wisdom and excellence, this was an epitome to be with all of them, his loving disciples. Special times that he had with us, some special guests. These were all our awards functions. This was when we couldn't have given him the Wisdom and Excellence Award. We presented him the Lifetime Achievement Award. I'm glad it was with a lot of these people he really loved to be with. And I would say the valedictory. And now they both are together. Final valedictory, and he is there up there with my dad. So I'm sure they're enjoying. Emotions are mixed, but I definitely wanted to pay this tribute to him. And he'll always be missed, and he's always around. So, Dr. V.N. Shikhande. I wanted to do this especially now, right before we present the award to Dr. Jayan Burve. I'm taking the proud privilege to introduce another very renowned gastroenterologist, but at the same time, a great human being. And you will come to know when I introduce his philosophy to you. Dr. Jayan Burve, it is really an honor to introduce a legend in the field of gastroenterology and hepatology. He has been one of India's most senior, or is actually India's most senior and respected clinicians, whose remarkable career spans over 4 decades. He has been a pillar of excellence at some of Mumbai's most prestigious institutions, including Lilavati Hospital, Max Nanavati Super Specialty Hospital, and the Jewel Endoscopy Center he owns. With unmatched expertise in diagnostic and therapeutic endoscopy, he has brought healing and hope to thousands of patients, especially those facing critical digestive, liver, and pancreatic illnesses. He is renowned for mastering complex procedures such as ERCP, gastroscopy, colonoscopy, capsule endoscopy, and advanced therapeutic interventions, all performed with precision, compassion, and unwavering dedication. He has been instrumental in making non-surgical endoscopic solutions accessible for conditions ranging from gallbladder stones to pancreatic diseases and digestive tract cancer. But what truly sets Dr. Burve apart is not just his clinical brilliance, but his philosophy that patient tells the truth. For him, careful listening and comprehensive history taking from the cornerstone of every diagnosis, reminding us all that medicine is as much an art as it is science. Beyond the hospital, Dr. Burve has been public health advocate, spearheading national hepatitis awareness campaigns, and a teacher and a mentor to many in the medical fraternity. On that note, I welcome you, sir. The stage is really yours. We want to hear about your journey up until here and your experience with wisdom and excellence, I would say. And because that is something seriously is going to be very insightful for those listening in, those healthcare professionals listening in, and at the same time, general public listening in, the next generation who is probably dwindling, trying to think if medicine is a profession for them. For all of them, I'm sure this talk is going to be inspiring. Over to you, sir.
Hello, everybody. Thank you so much, Mrs. Rajeshri Gadgil, and of course, RSG Nutrition and Healthcare Foundation. It's a great pleasure to be among all of you to receive this particular award. In fact, when I was given a topic, talk about yourself and your journey, I was very happy. I don't have to talk about viral hepatitis, cirrhosis of liver, vomiting of blood, blah, 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 etc., etc., etc. But it unfortunately made it very difficult, because when you talk about yourself, you tend to become pompous, and you probably blow your own trumpet. So I will try to avoid both these things and try to tell you in a nutshell about what my life has been in the field of medicine. In fact, I always feel taking some risk at certain stage is very important. When I passed my SSC examination with good marks, because of certain influences of circumstances, I always thought I want to become an architect. So in 7th and 8th standard, I gave my elementary and intermediate drawing examination, which was the requirement. Thankfully, I had good marks in SSC. So I got admission into the prestigious JJ School of Arts. Difficult because there were only 30 seats all over the Maharashtra. And I was very happy that I'm going to go to JJ School of Arts. Before the admission process began, I visited one of my friends who was an architect. I saw the numerous lines, the caliper that they use, the straightness of the lines, the finesse that they had. And within 5 minutes, I realized this is not my cup of tea. So at the age of 16, I came home and I told my parents, I don't want to be an architect. I want to be a doctor. So they looked aghast, saying that, look, you got an admission in JJ, which is so difficult to get. And now you are trying for admission to MBBS, which is going to be after 2 months, 2 years, and that also is going to be equally difficult. I said, no, I want to be a doctor, and that changed my life. Thankfully, in intermediate science, I got good marks and got admitted to the prestigious institution of KM Hospital and GS Medical College. In fact, when I got down at Elphinstone on the first day, I remember I didn't know where the college was. It was on the east side or on the west side. Thankfully, found my route to KM Hospital and GS Medical College and successfully completed undergraduate and postgraduate program there. I think that was one of the best period of my life. What I learned is 3 years of residency is something which has lasted with me for more than 30 years. I am very grateful to KM for giving me this opportunity. While I was in KM, again, it became a tussle to get into postgraduate course. Luckily, again, good marks, I got into medicine, which I wanted for MD medicine course. And there, another important breakthrough came. I worked with Dr. B.D. Pimparkar, who was one of the handful of gastroenterologists in the city. There were not more than 5 gastroenterologists practicing in Mumbai. And I had an opportunity to work with him for about 2 years. And that kindled my interest in gastroenterology. But we had no great facilities in KM. So I changed the course again. After MD, rather than sticking to KM Hospital, I took an important decision of leaving KM and I went to Nair Hospital. Now, why Nair Hospital? Because that was the year when Nair Hospital was recognized as a department of gastroenterology. And first time in all 4 medical colleges, they advertised a post of lecturer in the field of gastroenterology. And maybe because of whatever curriculum CV I had, I got the post of that first lecturer in gastroenterology in all the 4 medical colleges. That was a very important experience. I working with Dr. H.G. Desai, Hiralal Desai, who was a very bright gastroenterologist. In fact, he was one of the person who diagnosed when Jayaprakash Narayan in Jaslok Hospital had bleeding per rectum, and he said that this is ischemic colitis. So it's not a common disease to diagnose, but I had an opportunity to work with him. So certainly gathered a lot of clinical experience from him. But the real path breaking was I got introduction to endoscopes, which had newly arrived in India. In fact, in city of Bombay, there are only 2 private endoscopes. And among all 4 hospitals, there was not a single endoscope for teaching. Nair was the first hospital to acquire the endoscope. So my first exposure to endoscopy came in Nair Hospital. First 6 months, as per the discipline, I was taught how to wash and take care of the scope. And next 1 year, I was involved in doing the endoscopy personally or under guidance of my teachers. Now, that was really a path-breaking thing. That differentiated me from normal MD medicine to a gastroenterologist, though there was no degree available that time. Because of certain financial restraints, I had to leave the post and I joined my private practice in a short period. Along with that came the struggles of short period, trying to find out the patients, trying to find out the income, trying to find out how you can progress in this field. After a couple of years, I accumulated enough of money to buy one upper GI endoscope. And that was a revolutionary point in my life. After that, I never looked back so far as the endoscopy is concerned. Over a period of next few years, I again and again accumulated the money and invested the money, thankfully, not in anything luxury, but buying my endoscope. They were quite expensive. And then I, on my own, in fact, that was one of my, I feel, plus point, or you can call it as a drawback in the career, where all risky procedures of therapeutic endoscopy, I had to learn all by myself. I had to learn by myself without anybody's guidance, without anybody holding my hand, on my own patience. So the risk involved is mine. Lot of expenses for which I had no money. And most important thing is I had no backing of any private or public institution. See, in a private institution, if you get into some complication, it gets diluted and there are enough of people who are supporting you for that particular complication. In a small private practice, it doesn't happen. Because by that time, I had taken another risk, and along with buying these endoscopes, I had invested in a nursing home also, which is called as a Jewel Nursing Home and Polyclinic, which was very renowned during that period. And I am coming from a non-commercial or non-business background. It was definitely a eye-opener for me, a different experience, but it was a wise decision because it provided me with a stable address, and it gave a stable address to my patients that in case of problem, go to Jewel Hospital, Dr. Burve will take care of it. I think that was very, very important. Next few years went in learning colonoscopies, learning, as Ms. Rajeshri mentioned earlier, ERCPs, which is one of the most delicate endoscopic procedure. The complications can be really serious and life-threatening at times. In fact, we jokingly say that talking ill about ERCP also can produce complications of ERCP. It is as sensitive as that. Thankfully, I overcome all these problems and started doing endoscopies and ERCPs on my own. But for refining the technique, it was important to visit few places outside India. So I had thankfully opportunity to go to Hong Kong for the third international workshop in therapeutic endoscopies. Eventually went to New Zealand to Auckland University, landed up with Middlesex and St. Mark's Hospital in London, and ultimately Duke University in USA, North Carolina. Dr. Peter Cotton, the name in English-speaking countries in endoscopy, was head of the department there. So I had some opportunity of picking up finer points about ERCPs under these international experts. That time I also got attachment to Cooper Hospital, now which was very important for academics, because in Cooper you have got students who want to listen to you. There are other consultants who are going to ask for your opinion. And you are going to see enormous volume of patients. And enormous volume of patients, thankfully or unfortunately, who are needy, who are poor, who got no financial resources, who got really no education, who get very easily devastated by a serious illness in the family. So you really learn the compassion for the patient. You really understand their daily problems. When I write a medicine, as on today, I take care, I think about the cost of the medicine, it is essential or not. But the genuine problems firsthand of misery, I have seen it in Cooper Hospital. Doing a practice in public in hospital is different, and doing it in private hospital is entirely different. When you are attached to private hospital, there is a glamour behind that. Patients probably can afford money. Now they are all insurance paid patients, so they actually demand certain things which may not be indicated. So you start doing things which are inappropriate and unindicated, and eventually what you are doing knowingly, you start doing unknowingly. That is where my problem begins. Because you start doing investigations unknowingly without any justification. And then the clinical medicine or clinical acumen takes a backseat. And your whole life future becomes dominated by the machines and the results coming by machine. My sincere request to the students or the next generation of doctors is ultimately the origin of medicine and problem, the solution comes from good clinical history and a good clinical examination. Investigations are supportive. They are not diagnostic. It has got no meaning unless it is supported by clinical. You must know a diagnosis before you ask for investigations, or at least you must know differential diagnosis before you ask for an investigation. In private practice, to keep a balance of both of them is very important. I feel if you can be honest to your patients, you know your limitations, and you work for the best interest of the patients, you have achieved a lot of success in your professional life. That is very important. Does the life stops at being only a good professional or good consultant or a successful practitioner? No. There are other things in life also which I have always been attracted to, and they give me enormous happiness, enormous joy they give me. And one of the most important hobby for me is driving. I'm not a fast or rational or irrational driver. I drive safely, but I like to visit a lot of places by driving rather than going in a conducted tour. So driving included going in Australia, landing at the airport, taking a car and going to maybe the beaches around or Brisbane or wherever we wanted to go. After that, we drove all over the South Island and the North Island of New Zealand, probably one of the most beautiful country I've seen. And driving there on your own gives us enormous pleasure. So it was Scotland. When we landed up in Manchester, we rented a car as usual at the airport, drove whole of Scotland, including the famous Whiskey Trail and Edinburgh College of Medicine. All we did by ourselves, only by driving. After Scotland came an unbelievable journey in Norway. Norway is a place not many people visit, and those who visit normally do the cruise and come back. But I said, no, me and my friend and my wife, we decided to drive there. We rented a car, and the two important circuits which cover the whole of Norway, we drove all by ourselves. I think which was a great experience. I will never forget and I will never regret. Though there was some risk involved. The roads are narrow, the traffic is fast, winding roads, very hilly area. So driving is not really easy. And then I like to visit unusual places. So we visited a place called as Svalbard. Svalbard is about maybe 1.5 or 2 hours flight from the north coast of Norway. Probably it is the last human habitation closest to North Pole. So we had great time and maybe I get some kick out of that. So we visited Svalbard also. Similarly, we visited Oceania, which is the other end of the world, which is the closest point to Antarctica. That is the last post in the in southern hemisphere, which is closest to Antarctica, was Oceania. So another interesting driving came in Alaska. Everybody again told me, don't go to Alaska and drive. You take a cruise and come back. I said, no, I want to drive. So we rented a car at Alaska. We landed up, rented a car, and all the way up to Arctic Circle, we drove and came back again, which also gives me a great high, because I feel these are memorable things in life. It is as good as or better than doing a good ERCP. Both have got their equal value, and you must learn to keep balance of that. But the real high point came of my driving when, like a little out of mind or irrational person, I decided to drive from Delhi to Leh, Ladakh, and to the highest point in the world, what is called as the Khardungla. Khardungla is at a height of 18,500 feet. And this was about 30 years ago when the roads were non-existent. We have to drive through the snow, we have to drive through the ice, we have to drive at a very high altitude, through broken road, through streams of water flowing ferociously down the mountain. But we did that, successfully managed to go to Khardungla. And that is the age when I was in my early 40s probably. That is the age when you are really confident about yourself. In fact, so confident that you don't even realize that you're confident. Only thing I know is I was full of excitement. I had no fear in my mind. The question was of overcoming all these difficulties and reaching Khardungla. That is where the joy of life comes. You are not even worried because you don't know what worry is, genuinely. We made that Khardungla, I think, which was one of the highest point of my driving in life. And second, along with that came the trekking. Though it started quite late in life, it began with small treks like from Mahabaleshwar to Pachgani, about 18 kilometers, or doing a little eccentric act of walking from Oberoi Hotel to my residence in Vilepale. And that is on my 50th birthday. We walked 25 kilometers, me and my son. But these are unusual things which sort of give me some kick and some happiness. I may be tired, sweating, legs are hurting, back is hurting, mouth is dry, but still keep on walking. Like Johnny Walker says, keep on walking. I also say keep on walking. After doing these treks, then it came to something doing more. So I started going to Karnala, the foot, for walking, for training myself, or Matheran, the point there for walking, Dasuri Point, all along the way. And that allowed me to train myself for walking at not high altitude, but walking at least up the hill. And then we did wonderful. Starting from mid-Himalayas, if you take from east and go to the west, then in east, I walked up to Zongri Top, which is at 15,000 feet, bang opposite Kanchenjunga. Then there is a wonderful place called as Sandakphu, which is at 11,000 feet. But if you stand at Sandakphu, you see 4 summits which are about 25,000 feet from one place. You see Kanchenjunga. In fact, those summits are in front of me right now. Then you see Makalu. Behind that, you see Lhotse. And slightly to the right of Lhotse, behind the Lhotse, you see the Everest itself. So that was a good fun, walking along the mountains in eastern part. In mid part, it came to going to all dhams, Gangotri, Jamnotri, Badri, Kedar, etc., Valley of Flowers, and of course to Hemkund Sahib, which is the highest Gurudwara in the world. After that, we did some trekking and walking along Spiti Valley and driving also. And then came one of my high points, that is when we went to Ladakh and we tried to go to Stoke Kangri. Stoke Kangri is a difficult peak to go. The success rate is about 30%. Me and my daughter were walking, and at a height of about 19,000 feet plus, we were about maybe 800 feet down the summit. I started becoming tired, not forgetful, but I kept on repeating the same thing. It was icy cold at 4 o'clock in the morning. We were standing on a glacier. There was no oxygen. It was pitch dark. We didn't know where we are going. And then, being a little experienced doctor, I realized I'm getting into cerebral edema or swelling of the brain. And luckily, I turned back, and I think I survived that night. My daughter was fit enough to go further. Poor girl had to walk back because I could not go further. But that was a great experience. After doing this, something in India, then we thought we should go to Nepal. And then in Nepal, I really did some adventurous camping, or trekking. We went to Gokyo, which is like standing at Warsaw and seeing the Nariman Point. And you are seeing Everest at that close distance from a height of about 18,000 feet. We also did Everest Base Camp, which was a fantastic trek to do. And it was really high of walking and seeing the Everest at a very, very close range and seeing the Khumbu Glacier. Then we came slightly to the west. Annapurna is again one of the peaks which is about 25,000 feet plus. There are only 14 peaks in the world which are about 25,000 feet. Annapurna is one of them. So we did base on ABC, Annapurna Base Camp, which is like a shallow cup, surrounded by high mountains of 18, 20, 25,000 feet, and you are at the bottom. So bottom is also about 16,000 feet. And then I said, no, we have done Annapurna Base Camp, but let's walk around Annapurna. So we actually walked around Annapurna, what is called as the Thorangla, which is at a height of about another 18,000 feet. It was a tough trek because it was snowing the whole day, and there was real danger to the life because there was a complete white wash, Unless you go there, you won't know what white wash is. You don't know where the sky ends, where the horizon is, and where the soil begins or the ice begins. So these were very important things that came in Nepal. And then I said, let's go a little beyond Nepal. So we went to Tibet. And then we trekked the whole of Kailash Parikrama. And of course, we saw Manasarovar, which was also a very humbling experience to me. And then the last came last year that somebody said, no, but now there is another pass, which is called Umlingla, which is at a height of about 19,000 feet. And now that is the highest road in the world. So of course, I said, why not? So we visited Umlingla and completed my bucket list probably, But doing all this, does that help you? No. I think as a doctor, it is your responsibility to do some charity and some public work also. So we decided to do some public health program, and hepatitis B was a major thing. Hepatitis B and C, they have got about almost 4 crores of people involved who are going to go into chronic liver disease, part of them, and eventually die. So luckily, I know Mr. Bachchan, so we took him as a brand ambassador. We went to Mr. J.P. Nadda, who was then the Family and Health Minister, and we convinced him to make people aware of hepatitis B and hepatitis C. Because for both these diseases, which otherwise can lead to premature death, there is a good treatment available in the form of either vaccination, very effective, very, very effective oral treatment for hepatitis C, which is about 12 weeks of course, and absolutely affordable 500, 600 rupees a month treatment for hepatitis B. What it lacks is awareness. So JP Nadda ji, over a period of next 3 years, he almost sanctioned 950 crores, for eradication of hepatitis program. Mr. Bachchan also became a brand ambassador for Southeast Asia, and I thought somewhere we did actually contribute to this. And another opportunity came in the form of centenary function of KM Hospital and GS Medical College. For any institution to survive 100 years is a huge achievement. And to remain as one of the top institutions in the country is something which is remarkable. Though I had left KM in about 30, 35 years ago, I was still called for contributing some way to the centenary function. And then I said, let's do something which will add a couple of stars to the reputation of KM Hospital. And the issue came of non-alcoholic fatty liver disease or NAFLD, which is, I feel, Rajeshri's contribution so far as the diet plans are concerned is going to be very important. It is a disease strictly of obesity, of unhygienic eating habits, lack of exercise, in general, poor social life. Added to that is your diabetes, your high sugar, cholesterol, blood pressure, what is called the metabolic syndrome. And a lot of things are controlled by diet. And that's why I feel your institution doing a remarkable job in nutrition should seriously look into it. See, these hepatitis, NAFLD or non-alcoholic fatty liver disease is very prevalent, varying from age group, urban against rural or weight. The incidence can vary from 20 to 75%. That is huge. You can imagine 135 crores of Indian population, how many people are at risk. And this is all seen in the younger age group. Unhealthy, working for 12 hours, 15 hours, 5 days a week, partying for 2 days a week, no exercise, unhealthy fast food. Now for even buying onions, you don't walk. You call it on Amazon. Now where will you walk in that case? So these are unhealthy habits which are going to be responsible for the next epidemic of chronic liver disease, which can result in premature death. So I thought we should do some work for that. And again, we involved Mr. Bachchan. He gladly contributed. He said, I will be the brand ambassador to promote. And you can imagine how healthy he is in spite of having some problems. And at the age of 82, he works 10 hours a day. So he was probably the ideal person to be a brand ambassador for us. The Dean of KM agreed. And we launched a hepatitis NAFLD campaign and started a NAFLD OPD there. So that was a real contribution, I feel, to the society, which I could do as an individual. Does it stop there? Well, almost. I also joined Cooper Hospital, where I was earlier assistant only for more than 30 years at my age now, to teach at least some tricks of endoscopy. Though there is no need at this age to go and do that. But I said, no, why not to teach students? So I joined back again, and probably I'll be teaching them some tricks of the trade. The endoscopies are involved. Now, doing all this, does that bring you happiness? Happiness can be a little different. I will close with that. There was one day when normally I never quote the names. I had an opportunity to see one of the Miss Universal's mother for some serious illness. After 1 hour, I saw one of the Supreme Maestro in Santur on the same day. And then I saw one of the legend of Hindi industry who passed away. So these three huge celebrities I saw within a period of about 5 hours or so. Does that bring you happiness? Yeah, you feel proud that yes, you are, people know about you. But the day came when about 15 years after leaving KM Hospital, my endoscope was sent to repair to Delhi. It came in old custom house. Now I didn't know from Adam's Day where the old custom house is. So I found out the address, went there. I was, very easily identifiable as a completely newcomer in that field because the office is so different, full of agents, and those who are in know of it will know what it means, So I was like standing like somebody who is completely undressed or something like that. Everybody was looking at it, ye kaun aaya? And then I didn't know what to do. Then one fellow came, he was short, 5 feet 6 inches, 7 inches dark. He said, "Sab kya kaam hai?" I said, "Nahi yaar, my endoscope has come." And he said, "Sir, ye aapka kaam nahi hai, aapko nahi jamega. Aap baithiye idhar." So I said, fine. So I sat down. I said, I don't know what's happening. He said, paper de do. He took all my papers. and disappeared. Now I should have, he's gone with papers and I got no proof that my endoscope is lying here. After 20 minutes, he came back with the bag of endoscope. And he said, sir, ये paper sign करो और हो गया काम आपका. So I took the endoscope and I asked him saying that, but why are you doing all this, I don't understand. I thought he wants probably, as usual, we are also corrupt in our mind. I also thought that he probably wants money from me, And he said, साहब आपको याद है आप 15-20 बरस पहले KM में थे, न्यूरोलॉजी में काम करते थे. हाँ, तो मेरा बच्चा वहाँ पे मेनिंजाइटिस से एडमिट था और वो बच्चा बहुत बीमार था और आपने उसका बहुत संभाल किया. Now, that is what gives you happiness, The tears in his eyes, I can't forget even today. I feel as a doctor, you can do that. You have been successful in your life. Thank you very much again for all of you to listening to my boring talk so sincerely. Thanks once again. Thank you.
Sir, it was an absolute privilege to hear it, all that you said. मराठीत बोली नाही ते की खूप गोष्टी शिकायला मिळाल्या. म्हणजे डॉक्टरनी कसं असावं आणि आजकालच्या जनरेशनच्या अँझायटीज आणि त्यांचे प्रॉब्लेम्स आणि त्यांचे चॅलेंजेस अँड हाऊ यू बॅलन्स्ड युअर प्रोफेशन विथ ऑल ऑफ दिस वॉज मला खूप शिकायला मिळालं. आय मीन आय एम शुअर ते जे लोक इकडे आत्ता आहेत आणि नंतरही ऐकणार आहेत त्यांच्यासाठी दिस इज गोइंग टू बी अन अमेझिंग insightful. And the last topping was the best to know that what it is to tell what kind of a human being you are. So it is our privilege, sir, that you are adding. I was waiting to play the video. Can I, if I can share?
Yeah, please.
What?
I don't know what video it is, but
no, this to me where you said about you spoke about him and it is he speaking about you.
No, it's like this
is this audible? Is it audible? Take second, I think it's not audible. Audible.
Well, almost 30 years. Namaskar, this is Amitabh Bachchan. I'm here to introduce, in a sense, my family doctor who's been with us for well over, almost 30 years, Dr. Jayant Burve. Dr. Burve has been with the family for so many years and has been responsible for not just me and my immediate family, but my parents and elders and to others that I have sent a recommendation for. Dr. Burve is a very, very qualified doctor. It's an expertise existing in diagnostic and therapeutic endoscopic procedures. And but for me, he has always been like a family friend. He comes from a very illustrious family, which has excelled themselves in the field of medicine. He himself, his wife is a gynecologist. His daughter is a great surgeon, a plastic surgeon. His son-in-law is a very qualified doctor in the field of urology, and both his daughter and son-in-law have been practicing and working in America, and now they're here. That was just a general introduction to Dr. Burve. But on a personal note, I must insist on informing you that for me, he has been a lifesaver. With the kind of medical history that I've had and the complications that I keep getting into ever so often, he's the first one that is always in the forefront. Whenever there has been a crisis, a medical crisis, he's been there at the press of a button and given his very professional, guided opinion. And by the grace of God and all the well wishers that have prayed for me from time to time, he has been responsible for making it possible for me to talk to you today. I'm here really to introduce Dr. Burve, who now has been told many times by me and by several others in the family to have his own website. And the family wanted me to say a few words about him. It's very difficult to put a few words for Dr. Burve and for what he has meant to me and my family. But I have to insist on saying that almost all the major medical calamities that I've faced, Dr. Burve has been the one that has been responsible initially to detect it, to guide me to the right care, and to treat it to perfection. Apart from the fact that he's a family doctor and has been a guiding force for us, in his own way, he has been largely responsible for working and pushing towards some of the medical issues and problems that are prevailing in the country. Hepatitis, for one, and diabetes, and tuberculosis. We've worked together on several campaigns for the government and in personal capacities as well. And it's been a passion with Dr. Burve to make sure that these not very comfortable diseases are taken care of. What he has always insisted upon is that, yes, these diseases do exist, but to push people to go in for some kind of an investigation before time is lost. And that has been Dr. Burve's mainstay, I would like to say. He insists on asking his people to come in for an investigation. During my private conversations with him, he has always been very particular as a doctor to insist upon clinical observations that he finds now getting evaporated by all the new technology that has taken place. A lot of people rely on technology. Yes, he does too. But his initial reaction to anything is to have a personal clinical observation before guiding him or the patient onto the machine.
Out of paucity of time, I think I thought this covers most of what you said, and this is what he had to say about you. So again, it's an honor. We have Dr. Rekha Bhatkande Madam here. I'm sure you know her. Ma'am, thanks for being here while we present this award to Dr. Burve. Absolutely an honor.
Jen,
Hi, Rekha.
hi, hello. Your journey through life, past, current, and your career path, they're so remarkable and so very inspiring. I'm glad I was here to listen to you in person. I mean, online, of course, but wonderful. Congratulations.
I think don't take her seriously. She is a good friend of mine, so she always encourages me.
No, I take her very seriously, so I can't help it. She's an amazing lady. But sir, we will present this award in person to you. This is just a virtual representation of it. Thank you so much for receiving this. And especially since it's in my father's name, RSG Wisdom and Excellence Award. It means a lot to me.
Okay. Thanks, Rajeshri, and thanks, Rekha, for all what you've done. Thank you so much, Reddy.
We will have to quickly move forward to the next presentation, which is what I think Dr. Burve did mention, not just medicine, but also doing and giving back to the society. And here is someone who, in my mind, absolutely, I would say, does not need any introduction, but for the people who don't know him, of course, I will have to present one. We have Dr. Jitu Jodhpurkar with us, and he's Managing Director of Share Our Strengths International Strategy. Is a seasoned leader, senior leader, deeply experienced in the corporate and philanthropic sectors, with C-level positions held for over 20 years of his career. Following his engineering education in India, Jitu went to Virginia Tech for graduate studies and also received a master's degree in engineering management from the Catholic University of America in Washington, D.C. He completed his executive program in strategic leadership from University of Virginia's Darden School of Business in 2010. Project management professional, PMI certified. He's a graduate of Leadership Greater Washington's class of 2012 and served on the board and audit and finance committee of the California-based Taproot Foundation, among other affiliations. Before joining Share Our Strength, Jitu served as the Chief Operating Officer at the Community Wealth Partners, also held the Chief Operating Officer and Vice President positions at Washington Gas Energy Systems. After nearly 15 years at WGL and 5 years in other larger corporations such as Vodafone and United Airlines prior to that, Jitu Jodhpurkar has decided to focus the rest of his professional career exclusively in non-profit space. And well, he particularly even not only ventured into it, he's infecting a lot of us with it as well. So I'm glad we have been able to have him on this day today and in this program. And I would like to thank him and his team to partner with us in this program and support like we say, share our strength. So that's what we're trying to do here. And Jitu Jodhpurkar, everyone, I mean, I think what you're doing, a lot more should hear through our platform. And that's the whole perspective of what you're doing. After so many years of corporate leadership roles, you've ventured into this. And why? And why should we not? Is really my question. So it's over to you, and we would like to hear everything about Share Our Strength and your initiatives that you are proudly conducting in India, being a US-based organization. All that you're doing for the Indian continent is amazing.
Thank you, Rajeshri. For a brief moment, I saw the video that I'd sent.
Yes, you want me to play it?
Sure. Why not? Since you have it, yeah. It's less than a minute.
So I'll do that.
अमन कुमार, अवध अशोक, भानु Vishnu Pratap. Present. Vindhya Rani.
Present teacher.
Balchandra Lalji.
Present teacher.
Diya Jaiban.
Present teacher.
Karan Singh.
Present teacher.
Gagan Deshbanda.
Present teacher. Present teacher. Present teacher.
Present
teacher. Present teacher. Present teacher. Present teacher. Present teacher. Present teacher. Present teacher.
Thank you, Rajeshri. Thank you for the introduction. Very kind, and I must say, extra generous introduction. The first thing I'll say that I am not a doctor. So I'm the oddball in this community. Pardon me for it. And the closest that I've come to being a doctor is that my daughter is in the final lap of her PhD, and in some form she'll be a doctor. Perhaps because I've seen so many doctors in my life, that maybe I should get an honorary degree of a doctor. Because this guy is always being a doctor for something. But anyway, thank you for having me. This is an impromptu, completely intuitive and unprepared conversation, more like just to share a little bit about myself and also about share our strength. And this was upon insistence of Rajeshri. She bullied me into it, absolutely. Will not take no for an answer. So thank you. But very much appreciative and humbled and honored and inspired by this esteemed company. Not sure if I belong in such a, you all with so much pedigree. So thank you for creating some space for me. And I'll say that, I'll start with this, like what Dr. Burve ended with, I think is where I'd like to pick up from. And it really resonated with me. Obviously, he's achieved so much that we all heard from none other the king, Bachchan himself. But you're right, Dr. Burve, absolutely. That was kind of the moment that was a turning point for me as well. After nearly 30 years, my name again is Jitu Jodhpurkar, grew up in Nagpur, Parchapal, just to take a step back through my chemical engineering and then came here to the US. Been mostly in Washington, DC for the last 34, coming up on 35 years. And it's out of it nearly 30 years in corporate America, including multi-billion-dollar companies, Wall Street traded, and all of that. But there came a point when I started to lose meaning of what that meant. Working hard for 55 million shareholders and just dropping extra dime in their pocket really started to lose meaning of what, in the end, what is it all adding up to? What does it mean? And I was very lucky to be invited to lead an organization in the US, which is the largest nonprofit in the US that works specifically in the child hunger space. And it's in its 40s now. It has completed 40 years a couple of years ago, so 42nd, 43rd year. The name is Share Our Strength, founded by a very iconic figure in the US in the social philanthropy sector, Billy Shore, and his sister, Debbie Shore, at the time in their 20s, when the great famine in Ethiopia had hit, I believe, in the 80s. I don't myself quite remember. And then they'd used their credit card. This is an inspiring story. I had not planned on sharing this, but Dr. Burve's inspiration prompts me to share this. Brother and sister in their 20s used their credit card to buy some groceries, like to send to Ethiopia because people are dying. And they started sitting on the steps of the Congress in the Capitol building, talking to senators and congressmen that US has so much to share, that we should be sharing our strength. And they got some success, and one presidential candidate picked them up. And out of that idea came that everybody has a strength to share. And doctors and clinicians in the medical industry, you have so many, starting with the brain power and the knowledge and the contacts and the ability to influence and convince people to share your wisdom. Like that, though, architects and engineers, singers, dancers, mechanics, teachers, everybody has a strength to share. In India, Bollywood, cricket. So if we can create, at the time, the idea was, if we can create a platform where whoever wishes to share their strength can bring it, and we can figure out how do we use it collectively to help fight child hunger, and specifically focusing on school meals program, like the one that you all might be familiar with, like the Pradhan Mantri Poshan Abhiyan, the midday meals program in India, for instance. But more focusing on the nutrition content. I should say that Rajeshri, the session before this, I also resonated with there was a lot of conversation about the protein content and all of that. There's a lot of obviously awareness in the US about it as well. So the point being that if collectively those of us who have been fortunate and endowed with perhaps more than we need or can use, to come together and create a system, create a pathway for us to contribute more than we have consumed. Essentially, that's my personal philosophy. If we can figure out a way to contribute more than I have consumed, then I think Dr. Burve, I think that might fit the definition of happiness as well. So with that, then about roughly, I volunteered for Share Strength for 4 years and eventually invited to help them expand internationally. We studied 120 different countries and shortlisted to 7 countries, some African, some South American, and obviously on top of the list was India. I happened to have grown up in India, so it was a good fit, and I was invited to lead that expansion. We launched in, I think, we started this journey in 2018, and then in 2020, Nitin Gadkari was at the keynote speaker when we sort of kicked off in New Delhi. I think our executive director in India, Rohit Chaudhary, is a participant, is a panelist here as well. Rohit, feel free at any time to chime in. But I brought a team of executive chefs, celebrity chefs, board members, American people from the US, and we went crisscross the country, north, south to a degree up to Bangalore, east west through the villages. We went to Rajasthan, deep down into Jodhpur district, Nathadwara district, and further some villages in Vrindavan, in the Dharavi slum in Mumbai, some smaller places like Gadchiroli in Vidarbha, like in the forested regions. I've spent a weekend with Dr. Ante, for instance, really understanding the landscape. And it was obvious that while India has all its strengths, and there are significant weaknesses as well. Became evident that hunger is an invisible problem in India. I'd been out for 30 years, I'd sort of lost that visibility, but I was surprised and sort of saddened to see that even my friends were kind of living in denial that no, there's no hunger in India, like everybody gets food, and not even thinking about the nutrition content of that if there's no hunger. So what we also realized that hunger is an invisible problem, sure, but it's also a solvable problem. Child hunger in India is not due to lack of food. It's due to lack of systems or how to access it. And we've done a lot of great work here in the US. Share Strength has been responsible singularly to make sure that every student in every public school in all 50 states, it's a very large country, gets 3 meals a day. That's 3 meals a day. Breakfast, lunch, and then well, the third meal is during the summertime. We don't provide dinners, but when the school is out, that the kids should not be deprived of nutritious breakfast and lunch. And so we wanted to bring that learning and some of the best practices or the smart practices to India and see how we can share our strength, essentially, was the idea. We started working with 5 major partners. Akshaya Patra, for instance, is the world's largest school meal provider. So we've been a funder for them last several years, and that's how I'll bring Rohit on in a moment. We came across Rohit as well. Annapurna, which is Satya Sai Baba Foundation in the South, they serve 10 million, address morning hunger, they focus on breakfast, to 10 million servings every day. Akshaya Patra does 2.3 million midday meals every day. Annamrita, which is the Hare Krishna ISKCON, Juhu ISKCON, like Mumbai ISKCON Foundation, they do 1.3 million meals a day. And then Mumbai-based, the Breakfast Revolution is a doctor also, Dr. Pankaj Jethwani, currently based in Boston. He and his brother, Dr. Kamal Jethwani, their father was a doctor in Mumbai as well. He started the Breakfast Revolution, focusing on nutritious breakfast to kids. And then Dr. Amte's Lok Biradri Prakalp. We sponsor 1,000 kids in their school in the remote tribal regions for breakfast, lunch, and dinner, all 3 meals. So that's sort of the work that we're doing, and primarily doing through reaching out to high net worth individuals, inviting them to very exclusive events that we create. Essentially, our mission in India is to raise funds, raise awareness, and raise standards, as I like to understand myself. We don't run the kitchens, we don't deliver meals. We help build kitchens and hand over. For instance, we built a 25,000 meal per day capacity kitchen in central India and handed it over to Akshay Patra to run with some operating expenses as well. We focus on our expertise in raising funds and then raising awareness campaigns. Our immediate goal is to add 1 million kids to India's school meals program, nutritious meals. And then our long-term goal really is to create a national campaign. This shirt that I'm wearing, No Kid Hungry, is a household name in the US in the grocery stores. Everybody's heard about it. This was a campaign that made it so big in the US. Our hope is that in the next several years, there will be a national campaign in India where everybody has come together to make sure that there is no child that goes hungry or deprived of nutrition, so that we truly secure the future of India. Because the soldiers and the engineers and the ministers and the doctors, if they're not receiving the nutrition today, then 2030, if you're not feeding the future today, then decades later, generations later, we'll have a very different country than we had imagined, envisioned. And I feel a very strong obligation, moral obligation, all kinds of obligations. The soil of India has raised me, and I feel like I must figure out ways to give back as well, which has prompted me to take on this work. Let me pause for a moment, bring on Rohit Chaudhary. He is a man of pedigree in his own right. Rohit, if you'd like to introduce yourself, and I think our time might be coming up, and then we'll wrap up with a word of gratitude for Rajeshri for bringing us here. Rohit, go ahead.
Thanks. Thanks, everyone. Thanks, Rajshri, for hosting us. I'll just keep it very brief. Delighted to be part of this gathering. As Jeetu said, it's a critical, large-scale problem, but a solvable problem, and very happy to kind of play a small little role in the endeavor to address this, as I currently serve as the Executive Director based out of New Delhi for Share Our Strength, and have been in the social impact space for the last 11 years, again, focused on the cause of childhood hunger and nutrition. And unlike most on this gathering, I'm not a doctor, but an engineer. So I think that's what distinguishes me probably. So, and the only thing that I would put out is, I think as Jeetu outlined, the approach, or you could say the focus of Share Our Strength is in building communities, creating platforms, and then accelerating impact. And that's where we see again the value and immense value rather in this gathering and in this community, because I think that there's a strong intellectual and emotional inclination with the cause, and would be happy to kind of build up on this. This was just a forum for us to kind of give you a glimpse of what we've done so far, what we're attempting to do, and I would be looking forward to engage more deeply, more consistently as we move forward, and reach out in both virtual and physical formats of engagement. But really delighted, and also very thankful for being offered the opportunity to present ourselves and to be a part of this gathering.
Yeah, thank you, Rohit. He's a humble guy. He left Akshay Patra as their Chief Growth Officer, so we're very happy and proud to have him on board as an IIT Bombay, a graduate with MBA from HEC Paris. So he definitely has the vision. And then the last thing I'll add, Rajeshri, before ending, is that doctors are so special to us, and to medical professionals, but doctors in particular, physicians, I should say. In the US, we have 49, going on 50,000 physicians in the network of Share Our Strength. Most of them are pediatricians, as you can imagine, but not exclusively, that help us spread the word and awareness about the value of nutrition and the emphasis and the ways in which you can access nutrition. It's a very large, it's probably the largest, single community that's working towards it. And wouldn't it be fantastic, Rajeshri, with your inspiration and perhaps your father's inspiration and the likes of people who spoke before me, real luminaries and honorable people, if you could create a platform of physicians that sort of join hands with and sharing their strengths. Billy Shore, our foundation, was on the U.S. president's committee to monitor child nutrition. Our chief operating officer, Ann Philippic, was the sitting Biden administration White House's chief operating officer. So we've all recognized, and she rolled out Obamacare, the healthcare during President Obama, very acutely aware of the very pivotal, critical, significant role that the medical community and especially physicians can play in addressing this. So thank you for making this opportunity available. I'll be visiting, Rohit and Debbie Shore, our co-founder, will be visiting Mumbai in September. I'll be there with Billy Shore in November. It'd be fantastic if I could just have a few minutes with Dr. Burve and the others here as well with your facility, just to thought partner and seek some advice. To be honest, just seek some guidance for that. So thanks again. We'll leave you with that.
Thank you to both of you for joining in and taking their time out. I know it's a little too early in the US, but and Rohit having too many things on your plate. I mean, it's really I'm really grateful that y'all are here and y'all have partnered with us the idea is to spread the word and to make sure that we reach nook and corner of the country so that they all know what y'all are doing, and that's the one. I really think that's the way we will be able to get a lot of support and, like we say, share our strength. We'll have more people sharing the strength with us. So thank you so much, and I will have to unfortunately or fortunately move on to the next panel.
Yes,
but
yes, please.
we are looking forward to having more such programs, so we will be able to propagate the message.
Indeed, absolutely. Thank you. Take care.
Thank you so much for the field.
Bye.
Well, we are yet another exciting panel that we have. And I think this is something which was hand in glove, fitness, which goes hand in glove with nutrition, and digital technologies are something which is the today now, not even tomorrow. So how does one see the future of health and fitness in the digital age? So, tech to true fit is what this panel discussion is about. And our first and foremost speaker that we have is Nazneen Hussain. She has extensive experience again in the field of nutrition. She's founder, director of Freedom Wellness Management, co-founder of Shamrock NutriScience, digital nutrition app and software. She's chairperson Dietetics Nutrify Today, co-convener FSSAI Net Profile Maharashtra, member National Executive Committee Indian Dietetic Association, nutrition advisor Indian Navy, consultant in nutraceutical and food companies, educational qualifications. She's a clinical nutritionist and a sports nutritionist. She's certified in nutraceutical science and its application in nutrition and dietetics, certified diabetes educator, FODMAP nutritionist, nutrigenomics counselor, and bariatric dietitian. She's done research which focuses on nutrition advocacy for preventive and digital health, has authored books for the Indian Navy, FSSAI, Yoga Institute, IDA, and more, and counsels sports and Bollywood celebrities.
Hello,
Then-
Rajshri. Thank you for having me here. Great event.
Yes, thank you so much, Najmi. I'm so happy that you're here with us. And um, the next is we also have Sakshi Matre, who's also a clinical dietitian and nutritionist at InBody India. She's a gold medalist with an MSc in clinical nutrition and dietetics. She also holds the Diabetes Educator Excellence Award and is certified as a Level 2 body composition analysis specialist for InBody headquarters, Seoul. Dr. Mohan's Diabetes Educator Academy recently presented her with the Diabetes Educator Excellence Award. She has previously achieved first place and a gold medal in her field, earning her the coveted KU Naram Award. With over 150 seminars and camps conducted in the past year, she is a passionate advocate for the role of body composition in medical care. Welcome, Sakshi.
Thank you so much, ma'am.
We also have dietitian Amanat Kagzi here. She's clinical nutritionist on panel with InBody. She's founder, director at Fit Mantra, founded in 2017, a diet clinic situated in Surat. She's again a certified fitness nutrition coach, certified sports nutrition coach, and has gained these trainings from Leicester, California. She's certified sport nutritionist coach from K11 Academy, Mumbai, certifies diabetes educator, International Diabetic Federation. She's member of International Health and Fitness Association, IDA, ADE, IFL, PCOS Society of India, and has helped more than 5,000 patients to reap the benefits of non-drug therapy. So we really welcome her for the session as well. Welcome, Dr. Amanat Kagzi.
Pleasure.
And last but not least, we have Dr. Reshma Malia. She is a former dental surgeon turned healthcare marketing leader, founder at Soul Fluence and Healthcare Heroes Circle, healthcare brand strategist. She's been ex-vice president marketing and communications at Twitterfly and Wealthy Therapeutics, the digital Google, Yahoo building influence with Soul and Strategy. She has helped digital therapeutic companies, diagnostics, wellness startups, and aesthetic brands. Healthcare Heroes Circle is a growth accelerator for doctors and wellness experts. So really, all experts from the field of nutrition, and it's such a pleasure to have you all here. And all of you all are with a super edge with technology added to your expertise. So I'm sure it's going to be a wonderful discussion between us today. And I'll take an immediate dive at Amanat Kagzi because what does she really feel that digital health and fitness? What does it truly mean to you? And is it just tracking steps and calories? How has technology really transformed your coaching approach at Fit Mantra?
Thank you so much, first of all, Rajeshri, for having me here and the co-panelist. Lovely being with you. To me, the entire practice has changed after we have gone digital. It's not only about tracking your steps or a calorie, it's much deeper than that. And today, AI, you can literally see when you use our application. So you can just upload your plate and it kind of gives you the entire narrative of what you're eating, how many calories are there, and what are the options you can try. So a little implementation with the technology advancement can really raise the practice. It kind of helps clientele also to retain the kind of love using your app, health monitoring, your steps counting. These are very small steps before time. We could literally track the sleep routines Now we can see their blood sugars, we can see their blood pressures. There are a lot of gadgets available which you can just, we have literally integrated them. So it has helped us being accountable, and it has raised our retention ratio a lot. So I personally believe in growth and also being adaptive with the time. Though we've crossed our 40s, but still I feel we are just the start to learning new things.
It's
So you're
great
not
to know
audible.
these inputs. It's great to know these inputs actually. I'm sure this session is going to be a lot of learning for me itself, because we also have Nazneen here, and with Nazneen, with your We Coach platform, offering holistic wellness support to urban and corporate populations, do you feel similarly to what Amanat Kagzi feels, or I'm sure you've always felt that, which is why the platform, right? I mean, we would like to know more about Recoach as a platform from you.
Thank you, Rajshri. Yeah, kind of I echo what Amanat actually said, because as a dietitian, who's been in practice for 28 years, you suddenly realize that you've got to kind of move beyond the pen and paper approach. You need more evidence, you need more Indian data, and things need to be go with the smart formula of specific, measurable, adaptive. So I think that with that in mind, I kind of started working towards Recoach. It was interesting because somewhere all dietitians are also wanting to kind of grow in a bigger way, have a digital practice. And when you are able to kind of track things for the patient, and doctors previous, like Dr. Deshpande, etc., said that we spoke about plant-based diet, we spoke about gut health, we spoke about glucose monitoring, micronutrients. How do you actually quantify them unless and until you measure them, right? And you're not going to go and do a pat test every now and then. You'll do it only once in 3 months at the most. So kind of tracking your diet is the most low hanging fruit, and that's where the entire digital whole play comes in. Also, measuring sleep, it's very simple, right? But today, if all your clients were to just measure sleep, you then know what's going wrong, whether their leptin ghrelin cycles are working or no, whether he has sleep apnea, and what are the reasons why he's craving for so much food the next day. So this tracking is much more deeper. Yeah. And one of the roadblocks what I also understood was that for us, it's easier to change a man's religion than his food habits. So when you go on a digital platform, you're actually helping them to kind of get recipes, get things which are closer to his own cultural habits. And so when they get something as close to what they are already eating on his geotags in terms of recipe, things become far more easier. And that's what I've tried to integrate all of these points in Recoach. And I think I'm hoping that people find it much easier to make those behavioral changes, because the first 3 months of following any diet are easy. The maintenance phase and the long-term phases require behavioral modification. So I think for adherence, digital plays a huge role.
Yeah, you said it. I mean, adherence is the real key.
Yeah.
We all face it, and I'm glad that you're keeping it at the core while you are designing and making getting customers to use Recoach as an app.
Thank you.
One question then, given that the corporate wellness platforms, again, these apps are very connected to that. And Dr. Reshma, you have a lot of experience in this field. So how do you think these kind of digital solutions corporates would leverage in first place, and in second place, how open are they and their employees to using these kind of health solutions?
Yeah, what I've seen is that the employee buy-in is very important. It's no longer a checkbox based, like we have executed this, right? So employee buy-in is very important. And how does that happen? You need to create that environment. You need to create that kind of buy-in. You need to enroll people, right? From their minds and hearts. It's not just about physically enrolling for something. So for that, you need to have a lot more, in whatever your digital health apps you're building or digital therapeutics, you need to have a lot of care micro moments, right? And the client should feel very cared for every moment of the day. And AI and a combination of AI and humans is the best combination. I feel like whatever AI comes in and all of that, we cannot let go of human-based care, right? So that is always going to be there. AI can help the nutritionists, AI can help the doctors serve better, okay, keep track and know where to provide the micro moments, care micro moments, right? That is how I see it. Second thing, what I've seen in corporates is it needs to have a lot of gamification. And by gamification, I don't mean only leaderboards and points and all of that. That's all done to death by now, right? So it's about gamification is all about understanding what really drives the humans, right? The core drives. There are 8 drives, and all these apps are built as per those core drives, right? So it's quite deep, and they need to sort of get rewarded for every positive step they've taken, right? While gently nudging them if they've not done something, right? So it's all about behavior change, and slow behavior change. Third is that, it needs to be top down in corporates. So there needs to be adoption even at the top levels.
Yeah.
Most of the times what happens is, they just give it to employees and, HR is supposed to execute that.
Lead it by example.
Yeah. So if it comes top down and if the leaders themselves are, health conscious and all of that, so then it, trickles down. Otherwise, it's just a checkbox based activity, which doesn't work. I think lastly, it's about culture, right? So it's about building that culture of care and prevention and, all of that. And a lot of storytelling, internal marketing is also very important, right? So if, ex-employee has achieved some results, everybody should know about it, right? So there is a lot of internal marketing that needs to happen, storytelling that needs to happen. So all of these are key elements, I feel, for corporate wellness, like corporate therapeutics, digital therapeutics for corporates. These are the things which can help in those cases. Yeah.
So one way I think, Sakshi Matre, one way I think this could be done, that we could improve compliance, is also by showing them the mirror to their inside, instead of just seeing it on the weighing scale. I mean, telling them what is actually their body composition, and when they see those results, and when they are compared, would that help? I mean, could you sort of help the audience understand what you actually made by body composition analysis, because that's still not very commonly seen here. And before it really got common, people think, is it even necessary? And vis-a-vis BMI and just weighing scales, how do you weigh it better?
So, ma'am, thank you so much, first of all, for the opportunity to be here with this esteemed panel. And speaking a little bit and quoting Reshma ma'am again here, she mentioned that storytelling works very well most of the times whenever we speak about things. So, just a small quick story. There were 2 people, one Mr. Yajnik and one Mr. Yudkin. So, one had a BMI of 22.3, while the other one also had a similar BMI of 22.3. But they looked similar, they had a same stature, same height, everything same, with the same BMI. But when we measured the body composition, and with the help of the body composition, the exact percent body fat, one had a percent body fat of 9.1%, while the other one had a percent body fat of 21.2%. This extreme difference we can't tell by just looking at a person. For this analysis, we definitely need something which is more detailed than just BMI, than just our normal bathroom weighing scales, which is something which is technology based and of the new era where we are speaking now about digital health. So body composition analysis, what we use here in body, works on a BIA technology, bioelectrical impedance analysis, which in detail measures the breakdown of muscle, fat, water. And surprisingly, now there are more parameters into it through which we can actually understand the recommended calorie intake. We don't have to do manually the BMR also. So segmentally, when we analyze the body, we actually understand what exactly has to be done in terms of exercises, and also how to make it into an integrative diet. So more or less now, as nutritionists, what we look up to is more of muscle gain and fat loss with the help of BIA or body composition than just weight loss. So yeah.
Well, I'm guessing some of you were also on our earlier panels in the morning, and I don't know, you should listen back into it and see where our customer base is actually, where people are right now and where we want to get them. It's a huge gap, the way people don't take nutrition as seriously. People hardly exercise, and body composition is absolutely a next parameter. And I completely agree with you that looking at someone, you are just, or looking at the weight, you just cannot tell the complete story, isn't it? And I'm sure Nazneen is nodding her head, and she's definitely agreeing with that fact. I don't know, Nazneen, if you want to add something to this out here, because I'm sure you are looking at adding these kind of perspectives, apart from the fact that you're also going to help the customers leverage the power of technology and the power of nutraceuticals onto your app as well. And I don't know how you're looking at having nutraceuticals on your app, and do you really think they're evidence based? And how you and I know exactly what we are talking about. So if you could throw some light on that topic as well.
Okay, thanks for that question. So I'm going to actually resonate with both Reshma and what Sakshi said. So I'm also the chief nutritional advisor to the Indian Navy. We always thought that was the most fittest group of people, but now when we do a lot of body composition, reports, thanks to InBody, we always collaborate with them. We found some amazing, results even in that very, very fit population. So obviously there needs to be, when you look inside, even in the fittest of the lot, you have challenges. I do also work with a lot of international athletes, and there also suddenly in the lean periods, you see the change. So there is a need. Now there is a need also to marry all of these with nutrigenomics, with a lot of omics studies which are coming in today, be it the gut microbiome or the food sensitivity. And together, all of them have followed the route of some kind of an elimination. Even a simple calorie restricted diet also follows an elimination.
Yeah.
Okay. And so when you are eliminating, you eliminating also food groups, restricting, there will be an insufficiency. Okay. First step is that we measure the insufficiency. And that's where the digital platform comes in, because it gives you the objectivity of measuring how much you actually had. Does it fit into the RDA? Are you way below it? And that's the scope where, you also see that if you're not able to correct the food for XYZ reasons that people are traveling, they're cooking, they're ordering in, they're single, they don't really have a thing. The role of you need to step up the supplementation. Okay, maybe corrective or maybe long term, either which ways. And so in our digital health tech, we are looking at supplementations. So first is when we do our assessment, we follow the entire nutrition care process. When we do the assessments, okay, the prescription, you kind of understand where is the gap. And first you try to kind of, meet it with the diet. And even so, if there is an insufficiency, sometimes the diet is adequate, but you need, you have a problem with the digestion. And that's where all the, enzymatic preparations come in. That's where, especially for sports athletes, they need a little more for their performance. So, so those kind of supplements actually come in. And we definitely have incorporated the same. In fact, we also go through a very, very stringent audit on choosing the products and then getting it there. But definitely it's a part of our tech platform.
Great. So, my next question really will be for Manav Kagzi. I mean, yes, I mean, we are using supplements, and so do the results which you get out of the body composition analysis, does that really help you marry the right nutrition plans and the right nutritional supplements? Does that really help you do that, or I mean, or do you see that your patients are just a lot of them are not convinced a lot of times. So when they see these results, does that really help you make them work towards it, improve the compliance of your nutritional meal plans in them?
So, Rajeshri, there are two portions to this. One is for us as practitioners. I've been using in body past 8 years, and trust me, how it has helped us recognize osteoporosis, even the diabetes. For a lot of diabetic patients that I had seen, and I could tell them, you might need a nephrologist, go see them.
Yeah.
Okay, because of their, body water composition and things. But majorly the struggle is not with us as a practitioners, because we are very well versed with this, and we can, by seeing their body composition, we can really know that it is a lean fat person. Being think they're very happy, especially female struggles to accept that they have a very less muscle mass, maybe because they've not been working out during their early days, they are not into sports, maybe not eating. Being Indian, we really don't eat a lot of protein, which is now a lot of awareness. But in our normal, houses, it's not in every meal. So they really have a very low muscle mass, and they kind of struggle with their metabolic health.
Yeah.
Right? Now, for us, we have recognized, but I'll resonate with Nazneen ma'am. We also have a nutraceuticals, mentioned as a shop on our mobile application. We refer them for their good, but there is a mindset here. Give us something natural, give us something organic, so food se hi mil jao. That's a major struggle. I think a lot of education is needed from our side as a practitioners to tell them which are the safe supplements and the difference between supplements and medicines. Major struggle that I see personally is they take it as a medicine. And they quote, "Hame dawai nahi leni." And it takes time to literally counsel them, make them understand why it is important. And the body composition in that really helps also in say it plays 50% of the part, where you can show them their segmental muscle mass, the fat muscle mass, the visceral fat for the perimenopausal females, for the high muscle mass in PCOS, PCOD patients, kind of tell them why this is there. With my sports, I do a lot of sports nutrition. So I have clients who are at 100 plus kgs. Recently, they were supposed to go Italy for a world record. They are 100 plus, but they are absolutely with a 4% of a body fat. We had to maintain that, body fat percentage, because they had to go for that particular, world record. So here, if you see his body composition, it was not I. It was a D.
Yes.
So that's a very rare competition. Now, what I do is when a gym goer comes to me and say, I want a sports nutrition. So I kind of use that body composition to make them understand what is an exact sports athlete looks like when his health body score is 107, which is
Yeah.
very rare to see. He has six packs all round, 365 days. He's not on any growth hormone, he's not on any injections because they play certain sport, they have to qualify. But along with the nutrition, with certain supplements, they are able to maintain it. It does helps, but yes, there is a challenge, there is a struggle, I won't deny, and I think it will take a lot of time from us as a practitioner to kind of educate, in which again a digital world plays a role. We kind of see a lot of reels every day. There's a lot of information from influencers, and there's a lot of discussion in our
No, Amanat, I'm going to interject you, and you're absolutely pointing in the right direction. And this is what I have, and Nazneen knows that I have been talking about this for a while. It's not just about creating the awareness, but it's being relentless about creating the awareness, because more than awareness now, it is at the stage where there needs to be more trust building, because there half the population who's relying on the reels, and half the population who's completely saying that the reels are complete BS, and so we should not rely on it. So, that gap, and which Dr. Reshma also mentioned, that, the human element there, but, a lot of awareness, which can create a lot of trust building, and which is why this integrative nutrition and health summit, because, in our country, when it comes to health, the first person people go to is the doctor. Until unless they suffer something, they're not going anywhere. They all need to understand that there's something like a preventive stage. This entire day we had a lot of conversations on preventing so many diseases. Diabetes cannot be reversed, 5% can be reversed. So we all learned that prevention is so important. So, we need to essentially create so much of awareness, especially in that 30 to 50 age group, about, and building the trust about our own community is what I think. And I think, Nazeen, this is what you've been struggling through as a senior nutritionist, trying to create that through all that is going on. And I don't know, but on this panel, I'm saying all this because I think we should probably wow and say that from here on, every single month, every week, we should be conducting at least a single program which will relentlessly start building the trust, starting tomorrow. I mean, starting today, really.
I would like to add, Rajeshri, in this.
Yeah.
I think we are equally responsible
Yeah.
in putting that gap and giving the way to the
Yeah.
influencer to put
Yes.
anything out. As
Yes.
we are not very active, somebody is taking the
Yes.
Platform.
Yes.
When there is a discussion in our community group, when other dietitians post the reels and say, "Oh, this is a misinformation," I said, then why don't you put the right information?
Right.
Why are we following them to say what they are saying? Just forget, there is always going to be someone trying to take that place. We are responsible enough. Why can't we make the counteractive reel over that and say this is the false information? Go to a qualified professional and see this. This is our responsibility. We cannot just blame people, but we have to be very proactive. This is what I believe. I've been making my channel very active. I put it a lot of content over there, and I proudly say, if this is right, this is right. If this is wrong, this is wrong.
But
I feel there's no
at
harm
the
in
same time, getting together and raising the voice together is
exactly.
what
This is where I
exemplify.
believe all of us lag, where we feel and we are laid back thinking we have a degrees. I think this is where it is. We have to understand. Even if you hold it, you have to show it.
Yes. Yes.
This is very important.
Absolutely right. So,
Yeah, I love the word relentless. It's something like nutrition advocacy is something which I've been doing for the longest time. But now I'll prefix it. I learned it from you, Rajshri, that I agree that we need to be more vociferous about it, go really full on. I think at every platform, this is what I also say, that first, even companies for that matter, have, like, individually as dietitians, we definitely need to but also companies do have a budget, and I think a lot more work needs to be done on awareness building for lay people first, also for the nutritionists and the doctors, because a lot of myths they themselves have. So getting the correct word out there is an important thing, first to the HCP and then also to the consumer. Only then, all these influencer lots will slowly disappear. But first, even our own see, because also nutraceuticals was not a subject that we studied way back in college. It was not even a subject. So it's only now what we know is from all the companies who are making, and like if we have time after the entire long 16 hours of day, you go back and read, right? So there has to be more awareness also for the HCP, and also more advocacy programs and awareness programs. I agree.
So I have been working in the Nutra field for 25 years, and I probably have more experience because I saw my father actually making nutraceuticals in 90s. And so, I've seen it so closely, and I've seen the therapeutic value of it if it's done rightly. So, honestly, it pains when people say it's not important. And they all are going to, realize that this is the way forward in the next coming years for sure. So, I don't know, but Sakshi, what do you think? I mean, as InBody as an organization, I mean, I think this is something which is probably a takeaway for you as well. And how can we sort of use the body composition as a way forward in actually, propagating more knowledge and more awareness and more trust, because the analysis will sort of show what's the real difference that is happening, isn't it?
Yes, ma'am. So this was the first point of problem which we identified when it comes to awareness, because the senior dietitians or the dietitians who are working with closely, maybe like Nasin ma'am has worked with the Navy project. There are certain dietitians who are working closely with the hospital setups where correlations are happening. Okay, if diabetes is there, then there will be a little bit of more leg muscle wasting, which has to be monitored. But yes, there was lack of awareness. So what we came up with, we started our own newsletter. And in that newsletter, in every month, we started covering topics which are only focusing on this part. While a newsletter which is only in a form of a written kind of thing, which will not be appealing to people. So we made it in a video format. So a small 4-minute video is more appealing to people, and they listen to things like the trendy topics which is happening, like GLP. So GLP also is having a lot of kind of effects on the body composition, sometimes positive, sometimes negative. So how to tackle it and how to actually understand that, okay, so if a certain body composition report is showing that there are high visceral fat levels, then you have to start on maybe a anti-inflammatory diet. And also there has to be insulin sensitivity, which has to be monitored. Then you have to see what stress management methods you can do. While if I see something like this, I prioritize high protein quality diets while focusing a little bit more on leg muscle wasting for diabetes patients. But again, for the kind of awareness which we need, we make it a point now that every 6 months we organize a conference which is having a certain set of speakers who are speaking about different kinds of correlations, be it diabetes, be it bariatric surgery, be it nutrition, esteemed members who have been using body composition for a long time, who can actually speak on practical cases. And there is not much of influential marketing which is going on, but actually speakers who know in and out and can give something.
So next time we are collaborating on that. And
Done, ma'am.
but also Dr. Reshma is here. Now she's a doctor, a corporate, and now she's actually consulting so many professionals. How do you look at this? I mean, of course, the awareness perspective that you're seeing. How does this whole relate with the corporate culture? I mean, how do we spread the awareness in the right way? Because all corporate companies are doing, they're just probably doing a program. The program is done, and I've heard this from my friends. The program is done, everyone forgets about it. and there is no actual utilization of it. And how do you also see that in the healthcare fraternity? Because what is the kind of acceptance? I mean, are they themselves are you yourselves also trying to utilize it? I mean, what would you say?
Yeah, I think first of all, I agree with Amanat Kagzi. She was talking about, the experts stepping up to, spread the awareness, right? We can't keep complaining that these influencers are doing this, that influencer is doing this, right? I mean, you have the responsibility because you have the knowledge, right? So it is time that they change their identity from just experts to educator entrepreneurs, right? So that is very important these days to counter the miscommunication, first of all. So whether it is a corporate, whether it's an individual, right? I mean, ultimately what happens, even if you're going through a corporate, the individual is still going to consume content from elsewhere, right? So it's not in just the corporate plans, ambit, right? So it has to be, I think, it has to be a 360-degree kind of a awareness, right? So that is very important. And secondly, I think the healthcare professionals, what I've seen, I've worked with many of them, and I've seen that they feel like selling, they feel like marketing is selling, right? But what I always tell them is selling is serving, right? So they're actually serving more people because they're marketing or because they're talking about themselves or what they have, right? Or what the knowledge they have. So that mindset needs to change, right? That's the biggest problem I've seen in healthcare professionals, the mindset, right? And third is kisko time hai and all of that, so I think marketing has changed a lot, right? You don't need to struggle so much. And I know a lot of agencies and all of that have sort of spoiled the environment where they just copy paste from others and then just do something for you. But right now the marketing is all about magnetic brand based marketing, right? Where it is pull based marketing. So you need to actually find out what is your unique strength or your unique superpower. You need to find out which is that unique audience that you need to target, right? The soul aligned audience, I call it. And then you sort of craft your personal brand assets around it. And then you do that magnetic kind of marketing, right? So if each of you guys, if each of the healthcare professionals, whether it's a doctor, nutritionist, physiotherapist, psychologist, whatever it is, each of them do this, I'm sure a lot of different kinds of audiences are catered to, and the kind of awareness that needs to be created that comes from within, right? It is, it will transform healthcare as I know it, right? And apart from this, I feel from the consumer side, it's all about understanding what they really want to know. And in digital marketing, you have a lot of tools. Okay, you have all SEO tools, and actually what people are searching for on YouTube, on on Google and all of that, right? And what happens is that you can do intent based education, right? So they may not be looking for how to lose weight, but they may be looking for how to have vegetarian sources of protein, right? So you need to get deeper into it, and you need to see what the actual problems are and cater to it, right? So I think both of these, from the consumer side and as well as the educator side, if both of them are sort of catered to, I think, and I've been on both the sides, so I can sort of, for Z Digital, I had created this health portal which reached 55 lakh unique visitors. So I and understand the consumer side as well. So I'm just telling you. And right now I'm working with this, I've created this community called Healthcare Heroes Circle. So where I actually coach health and wellness professionals, to find their soul aligned, marketing strategy. So, yeah.
So I think, so having said that, I mean, in our earlier panels, I think Nazneen and Amanat, what we saw is we're talking about marketing, and Nazneen, like you said, you picked my word relentless, but on the other hand, we had Dr. Burve and we had Dr. Patil who were saying it was luck. Dr. Patil said the way I just kept working my way up. And, it's that faith and trust building. And we saw Dr. Burve getting, he has a testimonial from Amitabh Bachchan. So, so we have such examples. And I think that's really what this whole summit is about, this whole platform is about. So I'd like each of you to give a quick 30-second takeaway today, and with a promise that we are going to keep doing these more programs, because this discussion, I don't think we have done even 0.1% of anything today. Sakshi is smiling, so I'm sure she's agreeing with me. So whoever wants to go first, the takeaway.
Yes, so Rajesh, I'll take the platform first because I believe Nazini ma'am will have more things to say
Yes.
with her experience.
No, she can surprise you. I haven't even talked to her about yoga. So I want her to give a takeaway on yoga for sure.
Sure. So I kind of resonate with Reshma a lot. Though we are a healthcare professional, I last year completed my MBA in marketing from IIM Raipur, especially to understand how to align. So, like she said, marketing cannot be like buy this from me, buy that from me, or we cannot just keep promoting weight loss in today's age. If somebody's coming to me saying weight loss, I always tell them this is not health. Now let's understand what is health about. So that kind of a marketing where you give the content to the consumer, what they are looking forward to, then they kind of becomes your follower and lately your customers. So this is an entire journey. So I appreciate Reshma, you've been doing that coaching to the healthcare professionals. So I started that for myself, and today I kind of see 3 companies as a marketing expert, and these are 3 different segments that I could bring on my board for my growth. But this is something we have to learn in today's world. Even though you are a healthcare professional or you are a doctor or you are XYZ, today marketing is the right medium to reach out to your audience, to your collaborators, to your co-creators. These are all important for your future growth. You will never learn anything if you don't collaboratively work. If you keep competing within the community, it's not growing. So we have to, hold each other's hand and say, let's grow together. So this is where the marketing comes. And my takeaway today is, yes, digitally we are growing. Today I'm sitting here in Surat, others are sitting elsewhere, and we are connecting. So this is the power today. We saw a doctor coming in from US. We kind of working with the 11 countries today, sitting in Surat. So it's such a small world. It's today in such a small world. So why don't we all, kind of help each other in growth? If I am struggling, I may reach out to Reshma, I may reach out to Nazneen ma'am. Why don't we create that an ecosystem? That's what I feel that is important today.
I'll take it next.
I'll request everyone to just be 1 minute, please, because
Yeah.
there's one last launch still pending, which I will insist you all should wait for 5 minutes till that is also launched. But go ahead.
Yeah, I just have 1 or 2 sentences. So basically, I see that there's a lot of supply, there's a lot of demand, and just needs to be matched. And there's a lot of scope there, and we all are equally responsible to do that, and we'll get there. And thanks, Rajeshri, for getting us all together.
Yes, Sakshi, now it's you. Nazneen is waiting to go last.
Yes, so the topic which I spoke on BCI, I feel it's the future of health and weight management. In Marathi, we say that Poshan ahe ahar, arogya ahe puraskar, which means that nutrition is the foundation and health is the reward. So for that tracking, we need, yes, nutrition is one key, but for tracking it regularly, you need body composition analysis. And for the correct awareness of it with the help of the marketing, which we just discussed a lot, I would love to plan a podcast kind of thing with all of you someday, because it was so nice to listen to all the views together. And I think a short time period like this doesn't justify it. So maybe a nice 20-minute thing with all of us speaking would be something which is really important also, not just in terms of creative or interesting perspective, but to advocate the right thing and as we say, be the change you want to see. So let's unite together to make something creative. Thank you so much, ma'am.
Yeah. Okay, great. I think, Rajshri, let's do this often. I think podcast is a great idea. Let's get more like-minded people to kind of spread this awareness. That itself is a huge part of the marketing, especially for, you know, genuine nutrition. And I think both for healthcare professionals as well as consumers, I think we need to go aggressive on it and talk to people. And yeah, going digital is the most easiest form to help people to kind of, you know, make that behavior change. So take the first step now. Call to action.
Absolutely. Call to action. You said it. So I think I want all four of you to wait for just 5 more minutes because we launched an initiative, Womenopause today, and we are launching another initiative called True Talk. And this is for the younger audience, the Gen Z, who's going to obviously, I mean, these are the ones who really need to start becoming healthy, isn't it? And having said that, to your point, Nazeen, I think API, which is, and I can say that very openly, it's the Physicians Association, the Association Physicians of India was 400, 500 doctors way back in 90s. And uh, I have seen that grow leaps and bounds. I've seen many such associations, which my dad did support the medical education, and I've seen how those associations have grown big. So you know what's stopping us from? I mean, see, this is a program we are doing the 11th year that we are doing it. In COVID, we did relentlessly 500 programs. In the last 4 years, we've done more than 500 programs, reached more than 2 million people. So, you know, we have everything that we need. So we just need to start, I guess. And I think probably True Talk is also a platform where um, I think the Gen Z, there are girls waiting. I think let them come up and speak about it in a minute. Uh, just give me a second, and I'm just going to share the slide.
Yeah, I'm going to introduce the panelists who are there for launching True Talk today out here. It's Kimaya Joshi, who's going to do the introduction. We have Rutuja Dongre. We also have Swapna here, and we have Charvi here. So, and of course, we have Dr. Rekha Bhatkarte, ma'am. She's 70. Ma'am, you're 74 years young, and she's here to bless us with this initiative. She's been relentless, an amazing lady, of course, who does understand does understand why we're launching True Talk. So I think, ma'am, you were muted, so you know, I think I'll let Kimaya give an introduction. Kimaya, can I request you to give an introduction of for this platform, please?
The future speaks now. We're thrilled to launch True Talk. Truth, talk, transform. True Talk is a groundbreaking platform where Gen Z takes center stage to express, reflect, and lead conversations that actually matter. What if I told you your story could help someone else breathe easier? Yes, you heard it right. Your story. The one you've lived quietly. The question you're scared to ask, 1,000 others are thinking the same. I'm Kimaya, and today I'm launching True Talk. It's more than just a channel, it's a stage for the truth. Real talk, no edits. From career paths to social stress to figuring out who you are when no one's watching. This is your space. So bring your voice, bring your mess, bring your questions, and bring your achievements. True Talk is where your story gets to speak. Where young voices share their lived experiences, raw insights, and powerful truths. and where successful, grounded adults share the wisdom and perspective they've gained over time. Because when the youth hear from those who've been through it and found their way, it reminds them that they're not lost, they're just becoming. This is not a highlight reel, this is real life and real growth. Our speakers today are living proof of that. They're students, professionals, creators, healers, and each of them carries a story that can spark courage and inspiration in someone else. Because when someone shares how they found clarity or success or even peace, someone younger, someone unsure, somebody trying to find their way gets to feel a little more possible. Their story becomes our reassurance. So today we have four panelists here. I would like to introduce the first panelist. From Mumbai to Boston, our first speaker's journey shows what's possible when you step out of your comfort zone. Rutuja Dogre is a data scientist currently working at a startup in Boston where she applies machine learning to real world problems. After completing her engineering degree in Mumbai, she discovered her passion for data science through internships and research. She took a bold step and pursued her master's in data science from WPI in the US, a move that deepened her skills and widened her world. From contributing to research at IITM during the pandemic to navigating the fast paced tech space abroad, Rituja's story is one of clarity, curiosity, and growth. Today, she'll be sharing what it's like to step out of your comfort zone, follow your interest, and build a career that reflects who you truly are.
Thank you so much, Kimea, and thank you everyone for tuning in today. Also, a big thank you to Rajashri ma'am for inviting me here. And I'm so happy to be here and talking to all of you today. So, Kimea gave a very nice introduction. So, just to summarize it, I recently completed my master's degree in data science from Massachusetts, and I'm currently interning at a startup in Boston. So, today I'm not here just to talk about what I do, but actually want to share the story of how I got here, the highs, the lows, the mistakes, the detours, all of it. So let's rewind a bit. Not too long ago, at least it doesn't feel so. I was exactly where many of you might be now. So maybe fresh out of school or fresh out of college, wondering what comes next. So my younger brother recently finished his 10th grade, and watching him go through it brought back all the memories that what do I do with my life? The panic. Yes, I have lived it. So I did my schooling from Singhania School, Thane, and after a lot of thought, I decided to pursue a very unique career path. Engineering. Yes, I know, totally unheard, right? So I joined classes for JEE preparation, and before I could even celebrate finishing my 10th grade, I was back to the grind, the college lectures in the morning, the JEE classes in the evening, and sleep somewhere in between, maybe if I got the time. So the JEE preparation was definitely tough, but somewhere between that exhaustion and solving the HC Verma physics problem at 1 a.m., I actually found a gang of fellow strugglers who became my emotional support group and also my therapists. We studied, we panicked, we stress ate samosas together, and I also prepared for CET, in which I eventually scored better than in JEE. And that is how I landed my engineering college, RAIT, or Ramravadik Institute of Technology, Navi Mumbai. So in my junior college, I had studied computer science a bit, and so that's why I thought maybe I enjoy coding. And also the seniors had told me that it had better job prospects, so I ended up choosing computer engineering in RAIT. So when the college began, it had a very fun, chill, and vibrant vibe. Tons of clubs, events, and mainly the struggle of making the 75% mandatory attendance when your college is two trains and two auto rickshaws away from your home. one of the pro tip I would like to give is be in good books of your teachers or professor, because it helps when you're 1 or 2% short on that 75% attendance. So now if I could go back and redo one thing in my college, is that I would spend way more time building my profile. So back then I thought just doing well in exams and attending classes was enough. But looking back, the real magic actually happened outside the classroom. I remember the first time when I participated in a hackathon. So it was in IIT Bombay. I had absolutely no clue what I was getting into. So, if you have never heard of a hackathon before, it's a competition, it's a coding competition. A bunch of students, often strangers, they form teams and are given 24 to 36 hours to come up with a working tech solution. So, it could be an app, a device, or any real world solution, whatever the problem statement which is given on the spot to the students. So all I knew that I was involved in a coding challenge for 24 hours straight. It started off with excitement, but it quickly turned into panic when our code wasn't working somewhere around 3 a.m. We were all running on caffeine chips and sheer willpower. But that experience, it taught me more about teamwork, problem solving, and creative thinking than any textbook ever did. And here's the thing, no one told me about these hackathons or these events even existed. I stumbled upon them, and a friend of mine just dragged me into it. So that's when I realized that if your college doesn't have that kind of culture, you can be the one to start it. You can gather a few like minded people, form a club, organize a small coding challenge or project or anything in your space which interests you. So, taking initiative and not waiting for someone else to give you permission is what I learned. I also used to believe that I had to be good at everything in college. So, since I was in computer engineering, everyone around me was learning front end development, back end development, Android, databases. So, that's the impression I had, that I had to be good at everything. But over time, trying to do everything left me feeling like I wasn't good at anything. So it was only when I picked one thing and really committed to it, and then things started falling into place. So if you're exploring, that's great. But once you find something you like, double down on it. Get your hands dirty. Go to the depths of it. Make projects, even if they break, especially if they break. That's where actual learning happens. And then there were internships. I know applying to internships can feel scary when you're an undergraduate. Like the questions, what if I'm not ready? How do I know if I'm enough? Trust me, no one ever feels ready. I didn't either when I applied for my first one. But the truth is that you don't need to be perfect. You just need to be curious and willing to learn. So you just have to start small. Look for maybe any small organization, research internships, NGOs, anything basically where you can apply your skills and learn from real world work. Even unpaid work in your domain is valuable early on. So yeah, that's what my advice would be, that what matters is your efforts and momentum. And let me tell you that it's never just about your technical skills. It's about the teamwork you do, learning under pressure, and realizing that even the messy, imperfect progress is still progress. One of the things that I would recommend doing is to join communities. So since I was in the tech space, I had tech communities like Google Developer Students Club, Microsoft Learn Student Ambassadors, Kaggle. So these aren't just buzzwords for your resume, but they are amazing ecosystems where you meet people from across the country or even the world. You get to attend workshops, collaborate on projects. So these communities will basically give you the exposure, the confidence, and the networks that will open doors when you least expect it. And let's not forget the soft skills. I have seen technically brilliant folks get rejected just because they couldn't explain their ideas or communicate clearly in discussions. So, confidence, storytelling, listening, these are not just good to have skills, they are actually what help your ideas land. And if I could go back and give younger Rutuja some advice, I would tell her to speak up in class. Don't be afraid to share your projects, even if it's just with your friends or family. Go to tech meetups, even if you feel awkward at first, even if you feel you don't belong there. Because because I realized that confidence doesn't develop overnight. You build it bit by bit just by showing up. So, yeah, grades might matter, but your profile is what opens doors. Building things, sharing them, speaking about them. I think that's what will make you stand out in the crowd of people having the same hard skills as you. So, somewhere around my third year of engineering, while I was helping to build an app for our tech fest with the Computer Science of India committee, I had what I like to call a mini existential tech crisis. I realized that I did not like building apps or web development. It was a bit awkward because everyone around me was doing it, but I just didn't enjoy it. Then came 2020 pandemic, and with it, like the world's longest time out. But in that strange stillness, something unexpected happened. I landed a remote internship at the Indian Institute of Tropical Meteorology in Pune. That was the first time I dipped my toes into the world of data science working on a real project. And it was nothing short of magical. I was analyzing climate data, learning machine learning from renowned research scientists. And for the first time, I felt like, yes, this is it. I wasn't just crunching numbers anymore, it was storytelling with data. And I was hooked to it. When the placement season came in my college, I got placed at LTI Mindtree, which was great. But here's where I messed up a little bit. I did not explore off-campus roles in data because I thought, why would any company hire me if I don't have real-world data science experience? But honestly, that was just me underestimating the value of initiative. Looking back, I really wish if I had applied to some startups. And surprisingly, there are quite a few that are open to taking interns and fresh grads if you show genuine interest. So that's what I want to tell you, that your first company doesn't have to be a big name. And what matters more is whether the role aligns with what you want to build a career in or not. So after joining LTI, I didn't get a data science role obviously right away because it's a client-based company and it is mostly development, testing kind of roles there. But after a lot of asking, nudging, and borderline begging, I was moved into a project that involved Python development. So still not quite data science, but a lot closer than working on something entirely unrelated. So that's when I started seriously considering doing my master's because I had to upskill myself in data science. So, yeah, making that switch to do my master's wasn't an easy decision at all. It wasn't one of those woke up one day and applied stories. It took a lot of overthinking, spreadsheet budgeting, and endless conversations with my friends and family. It was a big leap financially, emotionally, and mentally. But I knew that I needed to push myself out of my comfort zone. I wanted to grow, and not just as a professional, but as a person. So, doing my master's gave me more than just a degree. It gave me independence, it gave me perspective. I learned how to do life, from setting up an empty rented house to figuring out how to network in a new country, how to ask for help, and most importantly, how to ask for what I want. Because there's one thing, if this journey taught me, is that you only get what you want if you have the courage to ask for it. The job market in US, it's brutal, but the people who get ahead aren't always the smartest in the room. They are the ones who show up, who raise their hand, and who aren't afraid to send that one email, take that one call, and ask that one question. So, in today's world, you cannot afford to hide behind the I am shy excuse, because trust me, I have tried it. So, the ones who speak up, who share their ideas, go to that one extra event, or reach out to that one extra person on LinkedIn, are the ones who get noticed. And honestly, it's okay to not have it all figured out. Your interests might change, your priorities will definitely change. And sometimes life just throws a plot twist. But what matters is that you keep showing up, keep putting yourself out there, even when it's scary, even when you think you're not ready. because the chances are you are. And remember that your network is your net worth. And that's not just a LinkedIn code, that's real. The people you meet, the communities you become part of, the relationships you build, they can change the game entirely for you. So I leave you with this, that be curious, be brave, and be kind to yourself in the process. And if you ever feel that you're behind, just remember that you're running your own race. Thank you so much, Rajashri ma'am, for for inviting me here. And I hope some part of my story resonated with you. And I'm more than happy to answer any questions if anyone has.
Yes. So, Rutuja, I think based on whatever I heard from you, I think we will, of course, have a separate True Talk session with you. Meanwhile, for everything, Dr. Bhatkande ma'am, is it okay for you to wait for another 10 minutes till we wind up?
Yeah,
Or
sure.
would you
No
want
problem.
to?
Don't
Okay,
worry.
okay.
No,
Okay.
no.
No,
I've enjoyed it so far.
she's been sitting since morning, so I just wanted to ask. But this was excellent. I think Rutuja, you really resonated to the whole ethos of True Talk. I mean, this is exactly why I would want to have this channel. You're probably realizing it already because you're in a situation where you already finished with your graduation and now going to start your career and your work, etc. And I'm sure Charvi and Kimaya are going to appreciate this more and more as they see more sessions happening. So I think let's try to keep the talks a bit short today because your extended talks, let's start having it right after this thing is launched today. So I think should we I'll give it over to Kimaya to again do the next introduction.
Yes, thank you so much, first of all, Rutuja, for everything that you said. I think it has really told us that it is a very important thing to step out of your comfort zone. Sometimes for people, it's not, for people who are actually initiative taking, sometimes it's different for them to, mellow down sometimes as well. That is, a completely different side, but that also happens with people. So I think stepping out of anything that is your comfort zone is very important for everyone to also explore other things, and keep exploring till something feels right. I think that is what I learned from what you said, and that you shouldn't be scared to try something new, because unless you try something, you won't really know what's for you. So I'll move on to our second speaker. Uh, our second speaker is someone who represents the journey many of us are still on, figuring things out one step at a time while learning to trust ourselves in the process. She is passionate about using tech to solve real world problems, especially in healthcare and education. From volunteering for the visually impaired to speaking at model UNs, anchoring campus events, and interning in both mental health and finance, Charvi brings a unique mix of curiosity, empathy, and growth. Today, she is here to share what it means to chase ambition, handle pressure, and grow into yourself in to a world that's constantly demanding more.
Thank you so much, Kimaya. It was a lovely introduction. I'm so happy to be here, honestly. It was something I was waiting for a really long time. So, I am currently pursuing first year engineering in artificial intelligence and machine learning. And to be honest, I used to be an engineering hater, okay? From literally hating engineering to pursuing a career in it, it's been a very difficult task for me, because when you're like just when you're a COVID batch, and especially when you just don't know what to do in your life. And I was a student that I loved to do everything. From I loved arts, I loved speaking up, I loved law, I loved psychology, I loved biology, I loved everything. And then figuring out one career to do for the rest of your life felt like curse, honestly. Like, how can one just do one thing forever? It just felt like, I mean, I was really confused, and I had some passion and all. And then I learned about AI, one of the fields that's really emerging now, and that's taken up over the world. And when I heard about that, I was like, initially, I thought that I'll never ever take up a career in AI because it's replacing jobs. Like, it's taking away people's hard work, people's all efforts. So I would never want to do something in AI. I would want to do a career that does not involve AI. And then eventually I realized that if it can do everything, I can train it to become better and help people's life. And that's the major reason I ended up with AI, because it's from healthcare to to fashion to design to agriculture. Even now, it's in every single field. It's a part of our lives, and it can really revolutionize the upcoming years for us, making our lives better. So that's one of my aims as I started to pursue this career. And one thing that I've been started to do lately is to always get out of my comfort zone. That taking part in events, like usually I used to be very shy and scared. Like, what if people judge me? What if what if this happens, that happens? And then I got one fear out of my mind after this one quote that I read. It was, when you stop being afraid, you'll feel good. And I learned that, and everything that I was afraid of, I stopped doing that. I started doing that. From taking part in events, speaking up for an MUN, volunteering activities. I even in my school events, I took part of this event. I won, and then I secured an internship with the CA. So you never know what is awaiting you. You never even know what's there for you unless you don't try and get out of your comfort zone, which I think we have mentioned before as well. But the whole point of this is that once you learn to just get out of your comfort zone, you never know what awaits for you. This year I started doing that majorly. Like, I took part in a lot of tech events as well, and had the privilege to talk to actors and all in the panelists, even ask some business people who have made big in the tech world about their opinions on AI. And it was magical for me to not even having that opportunity once. Like, I was always denied. I tried very hard to getting it on a very big scale was really meaningful for me. And eventually I figured out that even though I don't know what I want to do in my career, which still it's a big question a lot of times, but we eventually will realize what we want to do. And it's always about trying new things to figure out what is really meant for you. And this is one lesson that I've learned, and it's really helped me. And all the journey that I had, from dealing with a lot of mental health issues, from emotionally being like vulnerable to not figuring out what I want, to even having some physical health issues, and then having my interest dwell into biology. So it's a whole thing. And one thing I would also like to add on is that whatever happens in your life is for a reason. Whatever you are going through right now is for a reason, and you will eventually realize it's meant to shape you into a better version of you. And never be afraid of doing things that people might judge you for, because life is too short. You have to live it. And my journey is still ongoing. I still don't know. I have so many things to explore yet, but it's never too late to do anything, honestly. So that's all that I'll say. I would love if anybody has any questions as well.
Well, more than a question, I think I would just add, I mean, I hope I'm audible.
Yeah.
Yes.
Yeah. So I have met Charvi a couple of times, and we did our Star Sports event together recently. And she's such a bubbly and a cute girl. I'm sure, Charvi, you're on the right track, thinking the right way, and you will get there. It is an ongoing journey. So all the best. I would just want to say that.
Yeah, amazing.
Thank you so much.
I've interacted with Charvi as well, and it's great to have Charvi on this platform. And I'm sure you all are launching this, and you will take this forward, because we can only support you all. Awesome, Charvi.
Definitely.
It's always great to talk to you and listen to your perspective so many times.
That's really an honor. And thank you so much for having me here, Rashri ma'am. I just really feel so grateful, honestly, for this opportunity.
Yeah, I'm really looking forward to y'all taking this forward to you and benefit out of it.
Definitely.
Yes, I think I also, I think that the way Charvi is really confident about, speaking up, talking, initiating, I feel like that is a trait that everybody should, acquire. Like, even if someone has been shy their entire life or something like that, if people deal with these problems, they should start somewhere. If they start, then it will be good for them. And, exploring like she has explored, and finally, even from hating something to liking it. So it's just that you have to set your mind to it. Ki, even if I think I can't do this, maybe I can. If you do that, you will, in other aspects also propel. So I would like to introduce our third speaker. Our final speaker today is Swapna, whose journey is a beautiful reminder that growth doesn't always follow a straight line. She started out in the corporate world, explored hospitality and public relations, and later found her calling in yoga, healing, and emotional wellness. From dancing in Sydney to paragliding and guiding others through counseling and energy work, Swapna has followed her instincts across many paths. Today, she'll be sharing her own experiences of change, alignment, and learning to build a life that truly feels like her own.
Well, thank you. Thank you so much, Kimaya, for a wonderful introduction and all the sweet follow-up that you have been doing with all of us. And thank you, Rajeshri, for this platform and to organize such a wonderful event. And also thank you to all our speakers and Dr. Rekha ji, who has been patiently listening to all of us. We really appreciate your time and patience for us on a Sunday. I mean, like Kimaya said, and like you must have read on the screen, yes, I have been following my instincts, to be very honest with you. I wanted to become an engineer, but that didn't happen. And my father said, you know what, commerce is it. And I did I took the admission and I got into the college. And well, honestly, years passed by. I wanted to start work. I started working early. And at that time, nobody was really hiring undergrads. So it was the MNC era. All the multinationals were coming up. And I happened to be a part of the early stages of MNCs. And I started working. I climbed my ladder and I was eligible for a promotion. Is when I realized I cannot, because I'm still an undergrad. And that's when I realized how important it is to have that degree certificate with me. You know, I can't get a promotion if I'm not a graduate. And I finished my graduation, through correspondence, and I got through my promotion. And well, I clearly knew in the background that I'm doing this job because it pays my bills. Because I was living in the city all by myself, and I had to pay my own bills. I had to fetch my own food. And so I stayed along, working until one day I realized, well, this is not what I want to do for the rest of my life. And that's when I started following my instincts. And in the background, while I was working, I was trying to pursue my ambition to become a DJ. I always saw myself as becoming one of the women DJs, and I wanted to rock the crowd, groove the music, and stuff like that. Well, what happened? I decided, I put my hands in it, and I think my husband also came along in my life, and I decided to get married. And well, he was in Sydney, so I had to switch countries. I put my DJ ambition on hold. I got married. I moved to Sydney, and yeah. Honestly speaking, I fortunately married a person who had similar interest in hobbies. Like I loved Latin dancing. He was also in for it. So I learned Latin dance, and I performed with him in a few show in a show with our group over there. He loves paragliding, and I love it too. He got me introduced to it, and I did my certification, and I am a paraglider. I did my solo flight with a wonderful institution in Pune. And yeah, after paragliding, Latin dancing, I mean, it's like a checklist which is going on getting ticked. Honestly speaking, people say Don't keep your foot on so many stones at the same time. Well, you know what? I think if you can balance it, please go for it. Don't stop yourself. Follow your instincts. Uh, I would say go with the flow, but at the same time, be very mindful of what you're doing. Don't waste your time. Don't waste your energies in doing too many different things and achieving nothing out of it. It's okay. It's an experience. Um, but well, it's okay. It's okay to do too many things because learning should never stop. Every time you learn something new, you definitely earn an experience in it, and it helps you to make better decisions. So go for it. Have a bucket list. Keep ticking all your boxes and achieve them. And yeah, we talk about stress and all amongst the youngsters. I completely understand being there and didn't have anybody to talk to, but now you have so much help around you to speak. So go ahead. There are people who can hear you. There are people like me who will hear you out because I'm not only an energy healer, I'm also a yoga instructor. It was amazing to have a lot of doctor panelists also, and I've been listening to them. And the one thing that I realized is that we all are so focused on our physical well-being. I think we also need to look at our inner well-being, and for that, there are people like us who will take you through in our future talks if anyone is interested in that segment. But yeah, I mean, it's all good. Know your passion, develop a skill, and just have a hobby because no matter how many certificates you get, if you don't enjoy your job, it's about it. Don't, and it's never too late to start anything new. I have been learning to dance at the age of 40. I did my paragliding in my late 30s, so it's never late. It's never late. Just go for it. Really, really, what is important is have a skill. I would say it to the youngsters. It's okay to have certifications, but do know your passion, develop your skill, have a hobby, and that is what will keep you going for the rest of your life, even when you grow old. Yeah, let's to talk, but I think for some other day. Thank you so much, everyone, for hearing me out. Kima, I hand over to you now.
Thank you so much for that perspective as well. So I think what I've learned from what you've said
is that you just have to take that leap sometimes. You have to, you know, if you've already committed yourself to something, but you know that something else is falling for you.
You should take that lead. I think that is what I have, done.
Yeah, I really enjoyed your talk too, and I was a little surprised when you said you're 40. Like
So
you,
last
I
but not the least,
would
we
have
have
never guessed that.
one speaker who has been. And where you
Same. Like I have met her as well. Like she's so active. I remember she was so on spot. She was taking the interview. She was so running around, and it was shocking for me also that she's 40. She's so active, so hardworking, and just it's really inspiring to have someone like that as well in our panel. You know.
Thank you so much.
Okay, I cannot see Rutuja, I think if we can, but regardless, I think last but not the least, we have the most senior most speaker out here with us, Dr. Rekha Bhatkande. Just as you all need True Talk, she's my True Talk. I mean, she's my mentor. She's like a mother. I admire her. I can only imagine how it would have been for a woman of her in her times doing medicine, getting up until here where I think hardly any women would do medicine, and it's just amazing to have a mentor like her. And I think ma'am, you must say some things to us as we are launching this platform. You know that when we start anything, it's always that small, and then that's what really becomes grows into what it should be. And also I would want you to do the valedictory of the entire day. I mean, I think that is something we want to listen into.
Oh, one thing is, Rajashri, is that it's a wonderful platform that you're launching for this Generation Z, I think. You know, what has guided us? See, my generation is the baby boomers, okay? And this generation is Generation Z. And of course, there's a Generation Alpha, and I believe my grandson told me there's a Generation Beta as well. That is from 1st January 2025. He said, Aji, there's a Generation Beta. So I said, okay, they're just 6-month babies. I mean, you know, the last 6 months. Anyway, what we have always looked at, inner self-discovery, inner self-realization, are 4 qualities, okay? One is that sincerity. And sincerity starts with being true to yourself. Yes, you will have to struggle, you will have to find your path, but be true to yourself. And then when you do find it, be sincere about it. The second is hard work. Whether it is the efforts that you put in, someone said, you know, the ground breaking and groundwork that you have to do, teamwork that you may have to put in, because that's what work is now. You have to do it. So sincerity, hard work. The third quality that has to be there in us, if we want to be successful, and that is good communication skills. It doesn't matter, Charvi, if you're shy, okay? Communication skills is something you pick up, you learn, you take forward, and it's all about reaching out. I think that is what one of our speakers said. So reach out, and then, you know, you're communicating. And as a doctor, one of the things that we are absolutely into in our communication is empathy. All right? I mean, if if you show empathy, you're bound to have whoever you're talking to, whoever you're communicating with, in whichever form you're doing it, and they will definitely reach back to you. And all these 3 qualities is going to enhance your self-confidence. And believe me, that is absolutely essential. If you want to, you're calling it your net worth. You can call it anything, but it's your self-respect, it's your self-integrity, and it's your self-confidence. And if you have that, you don't have to worry. It doesn't matter what challenge your life sends you. You can do it. You know, Rajeshri, I think I was telling you, my grandson is 10 years old, so he's Generation Alpha. I was telling him that Elon Musk, he said, if there's any activity that is taking place, either you watch it happen or you take part in it. So my 10-year-old grandson asked me, Aji, can't there be a third option? I said, okay, let's think of a third option. So I said, maybe direct it, maybe take charge of it. He said, no, that's just being part of it. So then I had to think. And then I told him, this is an option that I'm going to give you, which I really would not like you to take, but it is an option. And that is to walk away. And sometimes there are some situations where you may need to do that. So either you watch what is happening, or you be a part of what is happening, or you have to take a call. Enough is enough, and you have to walk away. So I think these are the qualities that will really guide you, my younger generations. And Rajeshi, thank you for making me younger than I am. Anyway, all the very best. And it's a beautiful platform. And I'm sure more than, Timaya and the 3 of you, I'm sure more than that, more people are going to take part in it. And it's beautiful. It's really beautiful. Rajeshi, you'll probably make TED talkers out of all these kids. you know.
Yeah,
You
Never
looks
know.
like.
Yeah.
But ma'am,
Why stop? There are TED talkers, you know.
but ma'am,
Okay.
also would you want to say a few words overall
Yeah,
about the
what
whole
I
day?
would, yeah, I know we're really very late, but yeah, one thing that I would really like to say is, you know, this integrative nutrition and health summit of 2025. This is, I think, this is my 11th year coming and you know, coming and honoring your father's birthday. And you know, he was a young mentor for me from the pharma industry when I was a young consultant starting off my gastroenterology practice. So I think that's wonderful. Actually, what I really liked about this summit of yours was that it was very informative, and it was full of camaraderie. You know, everybody was so friendly and so, you know, looking out for each other, and they also had a lot of respect for their peers and mentors. I think that's a wonderful thing in any summit, you know. And of course, if we were to take our awardees, Dr. Bandupala, who showed us that excellence is something you can all achieve. And if that is achieved, wisdom will follow, you know. And then we had Dr. Milan Patil, who called himself a jack of all trades, but he was the pioneer in robotic joint replacement surgery in our country. But see, he doesn't say that. He just says, I'm a jack of all trades. Okay. And then, of course, we had my friend Jayant Burve, Dr. Jayant Burve, who I tell you, he was amazing. All the journeys, his own journey through life, and all the adventures that he went, you know, experienced, and of course his own career path, which led to his very illustrious patient telling us what a wonderful human being he is. So I think your awardees were wonderful this year. The other things that I really learned was in your reversal of lifestyle diseases, one thing I learned is not reversal, it is remission. And that's what we can all achieve. Then, of course, yoga, which we have a yoga expert with us in this, you know, True Talk, but it gives you mental and physical, your health definitely improves. But yoga in lifestyle diseases is an adjuvant therapy. That is what we have to remember. And I'm really happy to know that when you do risk stratification in diabetes, you know, and especially where the kidney is concerned, I'm happy to hear that there are genetic markers which could help us there. Then, of course, weight loss, which is one thing that the whole world is looking at, and there's so many new drugs coming out. What I learned from today's thing is you have to take a detailed history if you want sustainable weight loss. And of course, your proteins and your resistance training, they have to go, protein intake, and it has to go hand in hand. Then, of course, you had this lovely Womenopause. And yeah, I experienced that 30 years ago, and I'm glad, I'm very happy today to say I didn't have to pause. It is just one of the things happening in my life, and we just went ahead. But that was a lovely panel you had, Rajeshri, of all your friends and, you know, resource persons. Beautiful. And then, of course, you have, you know, Osteoporosis Society of India has been launched by Dr. You know, Bahulkar. I mean, it's wonderful to know that we're doing such great stuff in India. And then, of course, nutrition and exercise and absolute, they go hand in hand. Otherwise, one is not better than the other. They have to go hand in hand. And of course, a holistic approach to everything is what we really should be looking at. Where Rohit and Jitu were concerned, that's wonderful. I mean, imagine they have a platform, a non-profit platform, which is looking to try and reduce hunger or to eliminate hunger in kids. I think that's a beautiful thing. I know there are a lot of NGOs in Mumbai which are doing this, and literally kudos to all these people who are thinking like this. The government is also looking into it. We recently in the hospital, we had people coming and saying, we have a campaign going, which is zero food wastage. I mean, see, this is where it starts. Zero food wastage. We never talk about that. We talk about giving food, but what about the food that we're wasting? Then, of course, we have, and then, of course, we had this beautiful tech talk, tech for health. And I'm so happy because you know what happened recently? I don't know how and why, but the Bharat Artificial Intelligence Association of Bharat invited me. Okay, and they believe me, they were half my age or even less than that. But they said, no, we want to know where AI can be used in public health. And this is exactly what your panel was doing today. They were making apps and they were trying to promote AI. I think that was wonderful, and I hope it works. And yes, I know it's difficult to try and change the mind of people like us. But one thing that I must say here is that it's not that the doctors are resistant to promotion of, self-promotion. It is that our medical councils do not allow us. Okay? We are not allowed to advertise ourselves. And so that is one thing. It's not that I don't want to do what you want me to do. I'd love it, but I cannot. Okay? And of course, then we come to your launch, which is so superb. I'm so happy for these things. Thank you so much, Rajeshri. It was wonderful being here. And yes, it was a long day, but I think it was a beautiful long day. It was beautiful. Thank you so much.
That was a complete analysis of the entire day. I mean, and intricate through everything. So, ma'am, you know the valedictories used to be done by Dr. Shikhande earlier, and now it's you.
Yeah.
So the baton is with you now, and there's a lot more we have to do in public health. And I'm urging to these young generation, if they would like to also participate. I'm sure we are going to meet up with Share Our Strength the next time they're here. With you, ma'am, and as well, and you all can volunteer with them because they obviously need volunteers, young volunteers. So I will have Charvi, you and Kimaya can connect, and you all can actually leverage that.
Now, Rajeshi,
Swapna, you have so much of
no,
energy.
Rajeshi, because you have handed over the baton to me. I must tell you one thing about Dr. Shikhande. He was one of the most honest doctors in India. Okay?
Yeah.
He was wonderfully honest. Yeah. And just to carry on his legacy is a big okay? Thank you.
Yes, ma'am. Yes, ma'am. Thank you so much. I think on that beautiful note, we will end today's meet, the summit, the RSG Wisdom and Excellence Award ceremony. And it's been an awesome day, a long and awesome, as you rightly said, ma'am. Thank you so much, Kimaya, Charvi, Swapna, and Rutuja for joining from the US. So and can't thank Bhatkande ma'am enough for everything that she is for me.
Thank you, Rajeshri, and thank you, True Talk, and thank you, Kimaya. And yes, today we just gave an introduction, but I'm sure the whole journey to how we even went through so many different things is a wonderful conversation, and I'm sure we all will learn from that. So yeah, looking forward to many more catch-ups.
And
Thank you, everyone.
I also want to thank my technical team at the back and for helping with all this. With that, I'll say a good night to all of you.
Yeah.
And
Good night, everyone.
connect with you soon.
Good night.
Sounds good. Thank you. Bye-bye.